the nature of man. It's the earth man. Rasta man. Haile Selassie the first.
What is a Rasta man? The man we set the plan. The man we touch the street and love and bless up everyone. The Rasta man no skip a beat. The Rasta man unique. We not go take defeat. The mission have been complete. And through the humble and the meek. My lyrics is my gun. No boy can't tell me no. She rise above the rest. Empress no beg no friend. Real empress no bend.
I'm so sorry that I broke your heart to pieces. Love up pour like some every rain shower. I miss you even when it's only been an hour.
You're coming. the Committee on Health, Hospitals, and Human Services is called to order. I want to say a special good morning to all of the testifiers that are present today in the well. A special greeting to the public and welcome to everyone. We have a real tight session, a full agenda today, so we're going to try to be on time so that we can get Block 1 and Block 2 in today. Madam Clerk, please call the roll. Media mic for the clerk.
Senator Kenny L. Giddens. Senator Giddens present. Okay. Senator Marvin A. Blyden. Senator Blyden present. Senator Diane T. Capehart.
Present.
Senator Capehart present. Senator Samuel Carrion. Senator Carrion absent. Senator Novell E. Francis Jr.
I'm here.
Senator Francis present. Senator Donna Fred Gregory. Senator Gregory absent. Senator Maurice C. James. Senator James absent. Senator Milton E. Potter. Here. Senator Potter present. Senator Ray Fonseca.
Present.
Senator Fonseca present. Mr. Chair, you have 6 present, 3 absent.
Thank you. We have a quorum. Madam Clerk, do we have any correspondence to read into the record? Please proceed.
Honorable Ray Fonseca, Chairman, Committee on Health, Hospitals, and Human Services, 35th Legislature of the Virgin Islands. Dear Chairman Fonseca, please excuse my absence from today's June 7th, 2023 Committee on Health, Hospital, and Human Services hearing scheduled for 10 a.m. in the Earl B. Otley Legislative Hall on the island of St. Thomas. I sincerely apologize for my absence. Please forward my office any pertinent information to my office. Sincerely, Samuel Carrion, Senator, 35th Legislature of the Virgin Islands.
Thank you, Madam Clerk. Please mark Senator.
I have another one.
Moore. Go ahead, proceed.
Honorable Ray Fonseca, Chairperson, Committee on Health, Hospitals, and Human Services, 35th Legislature of the Virgin Islands. Dear Chairperson Fonseca, please accept this letter as a formal notice of my late arrival to today's Committee on Health, Hospitals, and Human Services meeting, which is scheduled to begin at 10 o'clock a.m. in the Earl B. Otley Legislative Hall in St. Thomas. Please have all circulated documents placed on my desk for immediate review upon my arrival. Thank you for your consideration on this matter. Kindest regards, Donna Fred Gregory, Chair, Committee on Budget, Appropriations, and Finance, 35th Legislature. This concludes the reading of all correspondences. Mr. Chair.
Thank you, Madam Clerk. Please mark Senator Samuel Carrion as excused. Madam Clerk, can you read Block 1 into the record?
Block 1. The committee will receive testimony on the operational status of the Department of Health, Virgin Islands Healthcare Foundation, and Virgin Islands Board of Nurse Licensure. The Office of Collective Bargaining will provide a status update on nurse contracts throughout the territory. Invited testifiers: Honorable Usta E. Encarnacion, Commissioner, Department of Health; Ms. Amina Salim, Board Member, Virgin Islands Healthcare Foundation; Walter H. Gardner, MD, Owner, Caribbean Kidney Center; Ms. Tanisha Penn, MSN, RN, Chairwoman, Virgin Islands Board of Nurse Licensure; Ms. Jos N. Springett, Esquire, Chief Negotiator, Office of Collective Bargaining. This concludes the reading of Block 1.
Thank you, Madam Clerk.
Yes, Lord.
Welcome to all of the testifiers today. And at this time, I would like to give thanks and praises to all of the veterans. As you're aware, Veterans Day was Memorial Day was recently celebrated in our country. And in our downtown harbor, there's a memorial dedication to one of our Navy soldiers, Mr. Emil White. Emil White was a personal childhood friend of mine. His family were our neighbors in Bovoni. You know, he lived next to the Clarks, the Turnbulls, the Jacksons, the David families. As you can see, you know, he was a young guy, good friend of mine. Emil lived a few houses up from former Senate President Sean Malone. Also, Nick Daddy Friday was his neighbor. We have another picture of Emil. That picture there is right downtown on our waterfront, Veterans Drive. There's a memorial dedication to him. You know, all of our veterans, we remember them on Memorial Day. You know, all of the veterans, they gave some, and some veterans, of course, they gave the ultimate sacrifice for this country that we could be free today. So we want to, you know, wish that the good Lord continue to bless his soul abundantly and he rest in peace. And to all of the proud warriors, special greetings and blessings. And thank you. And now we would go to the invited testifiers in Block 1. And so we would begin with the Honorable Commissioner Encarnacion, but I would like for each member, before we begin, to briefly put your name and position on the record. And I think we can begin on the right with Attorney Ross Springett. Thank you. Please activate all the mics, media.
Good morning, Joss Springett. Ready? Good morning, Joss Springett, Chief Negotiator at the Office of Collective Bargaining.
Good morning, Joan Jean-Baptiste, Deputy Commissioner over Human Resources and Labor Relations, Department of Health.
Good morning. My name is Tatia Monell Hewitt, Chief Financial Officer, Department of Health.
Good morning, Nicole Cragwell-Sims, Assistant Commissioner, Department of Health.
Good morning, everyone. Justa Ortita Encarnacion, Commissioner, the VI Department of Health.
Media, can you turn up the volume of Commissioner Encarnacion, Mike? Go ahead, Commissioner.
Good morning, everyone. Commissioner Justa Ortita Encarnacion from the Virgin Islands Department of Health.
Good morning, everyone. Ruben Malloy, Assistant Commissioner, the Virgin Islands Department of Health.
Good morning. Renan Steele, Deputy Commissioner of Public Health, VI Department of Health.
Good morning. Carmen Vanterpool Romney, Executive Director, Virgin Islands Board of Nurse Licensure.
Good morning. Tanisha Penn, Chair, Virgin Islands Board of Nurse Licensure.
Good morning. Joycelyn McFarlane, Operations Director, VA Board of Nurse Licensure.
Good morning to everyone. Ms. McFarlane, you can come right here because that seat is available. Vice Chair Gittins is with us on the St. Croix.
Yeah.
No, the other one. Yeah. Oh, no, you can sit there. You can sit there. Yeah. We just switched the name tag.
Good. Should I just say?
Okay. Thank you very much. Commissioner Encarnacion, please proceed with the testimony. Yes. Oh, I'm sorry. Yes. St. Croix, can you please also identify yourself and your titles? Go ahead.
Okay. Good morning. Yvette Rodriguez, Caribbean Kidney Center, Executive Director.
Good morning. Dr. Walt Gardner, Caribbean Kidney Center.
Good morning. Dr. Tasneem Khan, Medical Director of VIH Care Foundation.
Good morning. Angel Rivera, dialysis support member and advocate.
Good morning.
Hold one second. Hold one second. On St. Croix, we're having a slight delay. Yvette, can we begin with you again, a little bit louder with the microphone media?
Good morning. Yvette Rodriguez, Executive Director, Caribbean Kidney Center.
Dr. Walter Gardner, Medical Director, Caribbean Kidney Center.
Dr. Tasneem Khan, Medical Director, Virgin Islands Healthcare Foundation.
Angel Rivera, dialysis support member and advocate.
Amina Salim, Board Member, Virgin Islands Healthcare Foundation.
Dr. Brittany Dawson, Vice Chair of the Virgin Islands Board of Nurse Licensure.
And just for the record, the name was Dr. Walter H. Gardner, owner of Caribbean Kidney Center. Thank you and welcome on St. Croix. Commissioner Encarnacion, you can proceed with your testimony.
Thank you, sir. And once again, good day. Honorable Senator Ray Fonseca, Chair of the Committee on Health, Hospital, and Human Services. Honorable Senator Kenneth L. Gittins, Vice Chair. Senate President Novell Francis Jr., other committee members, and all other members of the 35th Legislature of the Virgin Islands of the United States, and of course, the listening and viewing audience. I am Justa Ortita Encarnacion, Commissioner of the Virgin Islands Department of Health. I have with me today my Assistant Commissioners, Dr. Nicole Cragwell-Sims and Ruben Malloy, Chief Financial Officer Tatia Monell-Hewitt, Deputy Commissioner of Human Resources Joan Jean-Baptiste, Deputy Commissioner of Public Health Services, Mr. Renan Steele, and Chief Procurement Officer Doris Harley, who is in the audience, as well as other members of the Department of Health team joining via Teams. Today, we will provide an update on our department programs and services throughout the territory. Title 3, Title 19, Title 27 of the Virgin Island Code prescribes that the Virgin Islands Department of Health is responsible for providing public health services to the people of this territory, which involves protecting and improving the health of our community through health promotion and preventative initiatives. Preventative measures are widely recognized as key components of efforts to improve overall health and reduce health care costs, particularly related to chronic disease. The Department of Health functions as the state regulatory agency and territorial public health agency for the USVI. The department comprises the offices of the Commissioner, the 6 bureaus that oversees 26 programs, all of which are operational. Additionally, as the lead agency for Emergency Services Function 8, or ESF 8, the department also oversees hospitals during a declared emergency or disaster. As the COVID-19 pandemic continues to wane into endemicity, we continue to provide support and guidance to our GVI partners and public by providing essential health services. We want to thank our federal partners and will continue to collaborate with them on public health policies that address long COVID, a condition that has affected millions of Americans. Virgin Islands has also been affected. Public health initiatives are primarily aimed at reducing health disparities and improving quality of life for all individuals, regardless of their age, gender, socioeconomic status, or geographical location. The core functions of public health include assessment, which is identifying and analyzing health issues through surveillance and the systematic collection of data on the prevalence of severity and determinants of health problems. This enables public health professionals to prioritize needs and formulate appropriate strategies to address them. The Department's strategic plan, Community Health Assessment, Community Health Improvement Plan, and most recently, our 2022 EPI Annual Report can be found on our website at doh.vi.gov, reports and plans. Policy development, assurance, ensuring that all community members have access to high-quality, essential health services and protection, and continuous evaluation of their effectiveness and improvement. Exemplary performance by the Virgin Islands Department of Health team includes promoting preventive care. The department has been proactive in promoting preventive care, measuring, raising awareness about the importance of regular screening, vaccinations, and healthy lifestyle choices. Team, your initiatives have empowered individuals to take charge of their well-being and make informed decisions regarding to their health. And for that, I thank you. Community outreach education. The department's dedication to community engagement and education is commendable. Through various outreach programs, workshops, and informational campaigns, the department has effectively disseminated valued health information, fostering a culture of health literacy within our community. Emergency preparedness and response. The department has displayed exceptional preparedness and swift response during time of crisis, the hurricanes, the pandemic, local focused emergencies like ensuring safe transfer of patients from Wang Lui Hospital, Maine to JFL North. Other teams coordinate efforts, collaboration, and other agencies and strategic planning have been instrumental in ensuring the safety and well-being of our community during emergencies and public health crisis. Collaborations and partnerships. Continuous quality improvement. Through data-informed, people-driven decision-making, the department consistently strives to enhance service delivery and outcomes, ensuring that highest standard of care for our community is delivered. The Virgin Islands Department of Health works closely with the Office of Management and Budget to measure and improve identified key performance indicators. We address public health as well as population health. It is our responsibility as government leaders to policymakers and public health professionals to identify, investigate, and address the root causes of health disparities and work collaboratively to create a healthier, more equitable society. An overview of our division. The Office of Procurement and Contract Management and Reporting. The Office of Procurement and Contract Management and Reporting, or OPCMR, facilitates the procurement process for goods and services as well as leases for the department and ensures adherence to all of the established policies and procedures of the VI Department of Property and Procurement in a centralized manner. Since the establishment of the OPCMR, the department has participated in 8 GVI-wide contracts and various vendors for services including, but not limited to, janitorial, exterminating, purchases of household cleaning supplies, security systems, and/or guard services. The unit has coordinated efforts with DPP to approve agreements attached to monthly recurring charges for FY23, FY24. 20 agreements were fully executed. The same will be done for FY24, FY25. The coordinated effort also resulted in the execution of 62 contracts department-wide, 10 expired contracts in the first half of the calendar year 23, and 5 that will expire December 31, 2023. Some of the other agreements were 3 to 6 months. Some have expired but were nonetheless executed. Currently, there are 63 items on the list of pending agreements, solicitations, and 24 pending leases that the unit is working on. There are 11 executed leases, 4 on St. Thomas and 7 on St. Croix. The Bureau of Financial Services. The Department of Health FY 2023 general fund budget is $25,781,917. And our health revolving fund budget is $3,136. The Office of Federal Grants. The Office of Federal Grants Management is presently overseeing 65 projects with 84 single budgets, 18 since the pandemic. The department has been awarded 34 individual COVID-19 grants. The awarding programs are Epidemiology and Laboratory Capacity for Infectious Diseases, Ryan White Care Act, Title II, Immunization Vaccine Program, Maternal Child Health, MCH Program, Mental Health and Substance Abuse Services, Public Health Emergency Preparedness, and the National Initiative to Address COVID-19 Health Disparities among Population at High Risk and Underserved, including racial and ethnic minority populations and rural communities grant program. The total federal budget awarded to the department was $87,234,528. Bureau of Human Resources and Labor Relations. The Human Resources Division works to increase the level of efficiencies throughout the agencies by improving its functions. Our HR division is working collaboratively with the Department of Personnel and other external agencies to improve our process flow and yield improved outcomes. We'll continue to build the team territory-wide as we encourage and mentor our human resources team to prepare themselves for upward mobility within human resources. As we proceed with our work, we are actively engaging with the Office of Collective Bargaining, the PER, Public Employee Relations Board, the Department of Justice, and respective unions to address all labor relations cases. Currently, there are 12 ongoing labor relation cases as of May 31st. The documents that reflect the salary increase for the registered nurses have been recently completed and forwarded to OMB. Public health preparedness. This comes under the Bureau of Public Health Services. The Division of Public Health Preparedness is a fully federally funded division focused on enhancing the territory's public health and healthcare system capacity to prepare for and respond to public health emergencies. The Public Health Emergency Preparedness Cooperative Agreement and Hospital Preparedness Program Cooperative Agreement provide the national standards for building a resilient and prepared healthcare and public health system, respectively. Within the last year, Public Health Preparedness Division has collaborated locally with the VI Territorial Emergency Management Agency, or VITEMA, Federal Emergency Management Agency, FEMA, Administration of Preparedness and Response, or ASPR, and the Center for Disease Control and Prevention, CDC, along with other local partners to strengthen territories wide patient evacuation, patient movement annex, and medical special needs shelter plan. Through this collaboration, the division continues to work internally and externally with other government agencies to socialize the plan and ensure all stakeholders are aware of their responsibilities in ensuring success of the plan. The Public Health Preparedness Division manages the Departmental Emergency Operations Center, reviews and manages all departmental preparedness and response plan, and tracks the department's completion of the basic Incident Command System courses. Behavioral health. In 2021, the department joined the Office of Veterans Affairs and other districts as National Governors and Mayors Challenge members. In June of 2023, 7 behavioral health and communicable diseases staff members, in collaboration with the Office of the Veterans Affairs, will travel to DC to participate in the Governor's Challenge to the Prevent Suicide Among Service Members, Veterans, and Their Families Implementation Academy. This partnership with the Office of Veterans Affairs and SAMHSA, Substance Abuse and Mental Health Services Administration, began with the development of a strategic plan. An ILLOGIC model was created to identify the strengths, weaknesses, opportunities, and threats to the infrastructure, resources, and policies and practices that influence the effectiveness of services delivery to veterans and their family members. The VA's Director of Behavioral Health based in Puerto Rico and the VA National Guard are our newest members of the Family Implementation Academy. A total of 10 representatives from the U.S. Virgin Islands will join us at the Academy. Behavioral health outpatient clinics. Between November of 2022 and April of 2023, a total of 790 patients received services at outpatient clinics between St. Thomas, St. John, and St. Croix. Patients receive one-to-one therapy, case management, methadone services, medication management, clubhouse membership, and substance uses. Mental Health Awareness Month. During Mental Health Awareness Month in May of 2023, the community witnessed a range of activities emphasizing the significance of mental well-being focused on reducing emotional pain. Here are highlights of each event. In both districts, students were educated about substance use and the opioid epidemic, receiving valuable information on these topics. The entire division provided support to staff members by organizing art therapy sessions led by Ileana Schuster-Brown from Ileana B. Artistry. These sessions aim to prevent burnout among the staff. Close to 200 staff members participated in a territory-wide team meeting and shared their pictures. The Division of Behavioral Health, in collaboration with Michelle McGowan, a licensed clinical social worker at Synergy Fitness and Wellness Center, hosted a lunch with leaders. During this gathering, the community had the opportunity to learn about burnout preventive strategies. Residents at the Elder Shelterbrand facility engaged in a delightful game night and tie-dyeing activity joined by staff and visitors. The Division of Behavioral Health, in partnership with the Government Access Channel, the Office of the Gun Violence Prevention, and Ms. Aminity Phillip, the reigning Miss St. Croix Educational Complex, organized Mindfulness Mondays. These community conversations address various mental wellness topics such as suicide prevention, gun violence prevention, bullying, and healthy relationships. The month concluded with a night of music therapy in both districts, providing the community with a chance to explore the benefits of music therapy, including self-expression, motivation, and stress reduction. In 2022, the Division of Behavioral Health has led the charge with the Governor's Our Best Life initiative in multiple ways. In collaboration with the Department of Sports, Park, and Recreation, the division hosted Total Walk Wednesdays, in which Zumba fitness was used to promote physiological well-being, psychological health, help relieve stress, improve cognitive skills, and prevent cardiovascular disease. Zumba sessions were immediately followed by mindfulness meditation, in which a community was asked to connect their mind to their body, to calm the body, and bring awareness to the mind-body connection. Between 2022 and 2023, the division collaborated with the Department of Education, Human Services, Labor, Agriculture, and Licenses and Consumers Affairs to provide grief counseling, trauma interventions, substance use education, stress management interventions. Outreach and educational services were spread throughout St. Thomas, St. John, and St. Croix, with 3,874 contacts made with students from the Ivana Eudora Ken High School, Charlotte Amalie High School, Adelita Conkrine Middle School, Juanita Gardine School, St. Croix Educational Complex, John H. Woodson School, St. Croix Central High School, Purby Larson School, Eulalie Rivera and Lou Muckle Elementary Schools, and the University of the Virgin Islands. The outreach also included Gift Hill School on St. John, and youth participating in the Art Institute. In June of 2023, staff partnered with the Virgin Islands Department of Education to record 30-second ads on the radio that covered topics such as teen mental health, bully prevention, substance use prevention, safety, coping with stress. The ads are slated to run throughout the summer and into the 2023-2024 school year as a means of reaching the youth in our community and providing them with strategies to manage their mental health in a culture that still stigmatizes treatment and lacks resources. Currently, there are 25 individuals at the Elder Shelterman facility and 43 individuals in off-island care. 25 of the 43 individuals off-island are in forensic placements. 6 patients have been reunited with their families, returned to independent living from residential care, or had their court hearing closed in preparation for discharge this fiscal year. In December of 2022 and May of 2023, the division hosted multiple federal partners to include the Substance Use and Mental Health Services Administration, or SAMHSA, in the Addiction Technology Transfer Centers, Mental Health Technology Transfer Centers, Prevention Technology Transfer Centers. The purpose of the Technology Transfer Centers is to develop and strengthen the specialized behavioral health care and primary health care workforce, and provides prevention, treatment, and recovery support services for substance use disorder and mental illness. In April of 23, SAMHSA program monitor visited us and conducted an audit to validate compliance with mental health block grant requirements and services across the division. The auditor identified the significant improvement to services such since their last visit, which was in 2017, and the accomplishment of the program's SAMHSA representative also marked at the work being done with limited staff and limited resources while making strides in breaking the barriers of cultural stigma. The Behavioral Health, the VI Behavioral Health Act 8688. After several years of collaborative work with, and thanks to the Office of the Governor and the former Health, Hospital, and Human Services Committee Chair, Senate President Noel Francis, as well as recognizing Judge Harold Willax on the act, because we could not have done it without him. Now the act, Bill number 34027, is now an act. An amendment to restructure, reclassify, and adopt the territory's first comprehensive Virgin Islands Behavioral Health Act to provide services and interdepartmental coordination of agencies and organizations to provide a structure of support to individuals throughout the VI who suffer from behavioral health challenges or mental illness. A special thanks, like I said, and I want to repeat this, the fortitude and support from Judge Willax on the act gave the act strength. This act was served to streamline and pool resources of the GVI together to best serve our community. The Division of Behavioral Health has developed a work plan for the new law to implement the additional services and collaboration required to achieve the new objectives. We are prepared to speak at the upcoming 2023 Virgin Islands Judicial Conference, Leading Change Through Judicial Education, scheduled for later this month, where we will introduce and answer questions surrounding the act. We hired staff to fill the positions: 2 clinical therapists, 3 community outreach workers, 2 chauffeurs for the behavioral health vans, and 1 substance use outreach worker, 1 state prevention coordinator, 1 behavioral health services coordinator, 6 988 crisis line staff, 1 substance abuse outreach worker, and 1 clinical therapist. The Division of Communicable Disease Division. Under the theme 340, Getting to Zero, the Communicable Disease Division continued to promote ending the HIV epidemic and reducing sexually transmitted infections in the territory. The goal of the 340 Getting to Zero campaign are 90% of people living with HIV knowing their HIV status, 90% of the people who know their HIV status receiving treatment, and 90% of the people on treatment have suppressed viral loads. Last year, the Communicable Diseases Division partnered with the Public Health Lab to commence STI testing in the territory. With successful implementation, individuals have been able to receive their STI or sexually transmitted infection test results in less than a week, allowing them to get treated quickly and reducing the chances of complications due to STIs. Most minorities, including sexual and gender minorities, continue to face health and social disparities. The Communicable Diseases Division conducted an interactive LGBTQ+ culturally competence training with the Department of Health's officials and representatives of other health and supportive service entities. The division also hosted a roundtable workshop with commissioners and directors of other government agencies, including the Division of Personnel and the Department of Labor and Education, to better understand their needs for improving their culturally competent approach to LGBTQ persons, building staff capacity, and providing national exposure is a goal of the division. Most recently, the division's director led a delegation to the 2023 STD Engaged Conference under the theme, Coming Back Stronger. The CDD director also presented on panel with other national health leaders discussing DoxyPEP. DoxyPEP has been hailed as one of the most important innovations of the STI treatment in more than a decade. DoxyPEP, similar to the morning after pill, helps prevent STIs within hours of unprotected sex. DoxyPEP can prevent STIs. The division debuted its Ending HIV Epidemic and featuring the St. Croix 2022-2023 Festival Queen at the conference. That video hopefully will be played at the end of the conversation. Throughout the reporting period, the division actively engaged 50 outreach events offering STI and HIV testing. The division also launched a social media campaign, 340 Getting to Zero, at various events. To build awareness, we encourage individuals to take selfies in front of our banner and then share it on social media using the hashtag 340 Getting to Zero. The increased visibility of our instrumental in normalizing the acceptance of routine STI screening as a routine aspect of self-care. Having a robust surveillance system is key as the data is used to guide prevention and treatment strategies. The division was successful with over 90% of our newly diagnosed cases for 2022 linked care within days of obtaining a confirmatory test. In 2022, divisions identified 17 new HIV/AIDS cases, 626 chlamydia, 44 gonorrhea, 3 syphilis cases. Preliminary 2023 data to date indicates that there are 104 cases of chlamydia, 10 cases of gonorrhea, and 2 cases of syphilis. With everyone's support in the community, we will say 340 Getting to Zero as we meet the campaign objectives on our key performance indicators. The Bureau of Healthcare Quality. The Department of Health's regulatory oversight services include birth and death certificates, burial permits, funeral homes, tobacco control, medicinal marijuana control regulation, food safety, certificate of need, medical malpractice, clinician and allied health licensing, and professional boards and related health data collection. The Office of Emergency Medical Services. The Office of Emergency Medical Services, or EMS, regulatory plays a vital role in overseeing EMS professionals, instructors, vehicles, and services. Our responsibility encompasses licensures, inspections, and certification necessary for these entities to operate within the territory. Pending the review of the Mobile Integrated Healthcare Paramedicine, or MIHCP program, and the need to identify the appropriate funding source, we continue to provide care, treating 80 patients weekly. Since the program's inception in 2017, following the aftermath of Hurricane Irma and Maria, we have cared for 1,800 patients, which can also mean we prevented 1,800 admissions to the hospital. The primary objective of the MIHCP program is to prevent patients from unnecessarily calling 911 and returning to the hospital. Oftentimes, patients seek immediate transport to the emergency department for primary care issues, thereby straining the emergency system. The program strives to address these issues. EMS Regulatory also houses the Emergency Medical Services for Children. That's a grant that's funded, and it falls under the Office of EMS Regulatory. The program's main goals are to provide necessary training and equipment for the care of pediatric patients for both ambulances and hospitals. Environmental health and safety. The Division of Environmental has become the Division of Environmental and Safety. In addition to its vital role of safeguarding public health through the prevention and control of environmental health hazards, the division also assumed responsibility relative to security and safety. The core functions of the Division of Environmental Health and Safety include food safety, vector control, that's diseases carrying pests like mosquitoes and rodents are managed and controlled by the division to prevent transmission of infectious diseases, environmental health emergency response, physical security, emergency management, risk management, patient and staff safety, training and education, investigation and response. The Office of Professional Licensure and Health Planning. It continues the charge to maintain public health and safety through license regulations for 9 health professional boards and the administration of the Territory Certificate of Need and Allied Health programs. The current boards are chiropractic, dental, medical, optometry, pharmacy, physical therapy, podiatry, psychology, and veterinary. 15 different licenses types are currently vetted and expected to expand as access, technology, and resources improve. The VI Board of Nurse Licensure is one of the boards that the Department of Health collaborates with in ensuring full compliance based on the Nurse Practice Act and ensuring that policies and procedures are in alignment with the overall regulations of healthcare infrastructure, especially during state of emergencies. Immunization. The VI immunization program is charged with the responsibility of ensuring uninsured and underinsured population receive vaccination, prevent disease, disability, and death. The program develops protocols which are disseminated to providers, educators, and family members, and reviewed annually to ensure regulatory oversight of vaccine administration to children. The immunization program is 100% federally funded and works cohesively with the Center of Disease Control and Prevention to ensure vaccines in the territory are up to date and administered properly. Vital records and statistics. The Office of Vital Records and Statistics is mandated by the VI Code to register and preserve data relative to all vital events in the territory of the United States Virgin Islands. Vital Records and Statistics is responsible for registration, maintenance, and dissemination of the territory birth and death records. Vital Records and Statistics works closely with healthcare facilities, public health offices, funeral homes, courts, Social Security Administration, fraternity and child support, divisions, and other federal local agencies. Our main goal is to provide professional services with integrity, accuracy, and security of records. The Bureau of Health Promotion and Disease Prevention. This is one of our most productive units in terms of community outreach. The Bureau of Health Promotion and Disease Prevention includes Division of Chronic Disease, community health clinics, family planning program, infants and toddler program, maternal and child health, and children with special needs care needs programs. Primary care office, public health laboratory, and women's, infants, and children's program. Program directors and administrators in this unit manage over $28 million in local and federal funding, employing 118 clinical, allied health, and administrative support for professionals. Health promotion and disease prevention programs planned and participated in National Public Health Week and the Synchro Agriculture Fair outreach activities reaching over 300 persons with health screening and general health education messages. They are also participating in this week's The Week of the Child, sponsored by the Governor's Office. Community health workers. With a seed grant from Sigma Foundation, the division hired the first community health worker in May of 2022. And later onboarding 4 additional community health workers. We collaborated with COVID-19 Disparities Grant to pilot a training curriculum as a key step towards establishing a community health worker training program in the USVI. To date, the department employs 5 community health workers and 1 more is awaiting a NOPA. The goal is to expand the healthcare workforce using trained community health workers across the public and private health sectors. This week, the VI Department of Health will hold its first community health workers convening, bringing community and federal partners to collaborate in the development of this program. The Health Disparities Program received 100% funding from the Centers for Disease Control and Prevention. known as the National Initiative to Address COVID-19 Health Disparities Among Populations of High Risk and Underserved, including racial, ethnic, minority populations, and rural communities. The health disparities and program provides services to community members adversely affected by COVID-19 with spotlight on long COVID. Leveraging the expertise of our community health workers, our program has successfully carried out more than 80 targeted outreach initiatives, distributing personnel protective items to safeguard against and reduce the spread of COVID-19. Furthermore, we have successfully organized the inaugural Health Disparities Leadership Conference and 2 impactful summits, fostering open and active communications surrounding the vital subject of health equity within our region. The Chronic Disease Program includes several federal grants related to health promotion and disease prevention focused on chronic diseases. Grants include Diabetes and Tobacco Prevention and Control, Preventive Health and Health Services Block Grant includes sexual assault, cancer prevention and control, breast and cervical cancer early detection, comprehensive cancer control, and VI Cancer Central Cancer Registry. Rape prevention and surveillance, behavioral risk factor surveillance survey. These grants allow for the delivery of evidence-based programs that educate persons on ways to reduce the risk to chronic disease development and equip persons who have chronic diseases with tools to manage their conditions. The Cancer Registry and the Behavioral Health Risk Factor Surveillance Programs collect and report on chronic diseases and their risk factors such as alcohol and tobacco use, nutrition, physical activities, cancer, cardiovascular disease, and weight status, which have a substantial impact on individuals' health. Data is also used to inform public health program development and implementation in the territory. The Chronic Disease Division and also hosts the community-based Chronic Disease Advisory Group. Community health clinics serves as a critical access to care for many, offering primary care services by board-certified providers, adult vaccination, specialty care such as cardiology, and eye clinic, and care for persons with chronic conditions. The Family Planning Division focuses on providing comprehensive reproductive health care services and information to individual families. Their primary goal is to assist individuals in making informed decisions about their reproductive health, plan pregnancies, and ensure access to contraceptive methods. The Family Planning Program also has been continuously funded for the Title X grant from the Office of Population Affairs for over 50 years. Services include breast and cervical cancer screening, reproductive health services, and patient navigation services towards ensuring referrals to services when indicated for screening test results. Infants and toddlers. The Virgin Islands Infants and Toddlers Program is a family-centered, multidisciplinary system of early intervention services for infants and toddlers from birth through 2 years of age who have disabilities or developmental delays. The program is fully funded by Part C of the Individuals with Disability Education Act. Maternal Child Health Division. The MCH and Child with Special Health Care Needs program is fully federally funded and supports the Virgin Islands Department of Health's mission to enhance the health of mothers, infants, children, and adolescents, including those with special health care needs. The program's overarching vision is to ensure that all children and families have the right to receive high-quality, comprehensive care. This program serves more than 4,500 clients territory-wide annually. The Maternal and Child Health Division offers various programs and services, including early health hearing screen detection, maternal, infant, and early childhood home visiting program, Project Launch, geared towards identifying and treating behavioral health challenges, Virgin Islands Child Psychiatry Access Program, and pediatric care, childhood immunizations, and outreach services. The Primary Care Office. The USVI Primary Care Office increases access to quality health care through assessment, collaboration, and workforce development. It is 100% federal funded. $150,464 through a cooperative agreement with the Health Resources and Services Administration. Women, infants, and toddlers, and children. The Virgin Islands Special Supplemental Nutrition Program for Women, Infants, and Children, better known as WIC, is a 100% federally funded nutrition program of the Food and Nutrition Service of the U.S. Department of Agriculture. The USVI WIC program has been recognized nationally as achieving the highest breastfeeding rates among WIC programs across the nation. WIC serves approximately 2,600 customers per month territory-wide. Territorial Public Health Laboratory. The Territory Public Health Laboratory continues to provide efficient testing for diseases of public health importance. The laboratory recently completed a federal inspection and successfully renewed the Certificate of High Complexity Testing. The average time for receiving a specimen for providing the test result is 24 hours, and a significant improvement for tests that may have had to be sent off island. Bureau of Epidemiology. The Epidemiology Division collects surveillance data to identify, prevent, and respond to current, emerging, and unknown public health threats. As a bureau within the VA Department of Health, epidemiology has helped partners detect and respond to various public health issues, including dengue, chikungunya, Zika, norovirus, and bacterial special pathogen surveillance. Since the increased surveillance conducted after Hurricanes Irma and Maria, the EPI team found cases of leptospirosis and melioidosis in the territory. Over the past year, epidemiology has been conducting enhanced surveillance for leptospirosis and the Freedom from Rabies project. In 2023, our COVID-19 numbers have been low, with our highest new case per week being January of this year, with 222 new cases in a single week, compared to January of 2022, where our new case per week exceeded 2,000 as we are doing well now. The week of May 30th, there were 36 new cases. Health Information Technology. The Health Information Technology Division oversees, develops, and maintains the Department's technology infrastructure. Its primary focus is to meet the agency's increasing demand for efficient and secure communication, collaboration, and connection with both public and private health resources. The DOH HIT Division works in close partnership with the Bureau of Information Technology, or BIT, GVI Technology Strategic Framework, to enhance, support, and implement current and advanced technological systems and integrated solutions for the Department of Health. Facilities Management. The Facilities Management Division provides housing and housekeeping and facilities maintenance for 23 GVI-owned buildings and other leased locations. The security section provides security and protection for visitors and employees of the department's operational location. Project Management and Capital Projects. The Project Management Office oversees and coordinates the execution of capital projects, including disaster recovery projects within the Department of Health's infrastructure. This work involves collaboration with disaster recovery funding and management agencies such as FEMA, VITEMA, Community Development Block Grant Disaster Recovery, the Office of Disaster Recovery, and other subject matter experts. The department has formally established the Project Management and Capital Projects Division, whose key performance indicators has been officially approved through the Office of Management and Budget. One of our major projects is to rebuild Charles Howard Memorial Center on St. Croix. The project with most progress, with a completion date of July 2023, is the Wick Nude Hansen project. I would like to express my sincere gratitude to the dedicated staff at the Virgin Islands Department of Health for their unwavering support in spearheading public health initiatives within our community. I would like to recognize our 2023 Employees of the Year for their exceptional work in supporting our goals and objectives. Ms. Talisa Barnes in St. Croix District, who serves as our laboratory supervisor, and Ms. Jennifer Williams in St. Thomas, St. John District, who serves as our nutritional aide on St. John. Thank you for all you do. You are truly appreciated. In closing, Senator Fonseca, the Department of Health remains steadfast in fulfilling our mission to reduce health risk, increase access to quality health care, and enforce health standards in a culturally competent, equitable manner. We are fully devoted to sustaining our collaborative endeavors with the members of the 35th Legislature, and we deeply appreciate the support you provide in our ongoing mission to enhance health care within our community. My team and I are available to address any questions you have. Again, I thank you.
Thank you, Commissioner Justa Encarnacion, for that detailed presentation. The Committee on Health, Hospitals, and Human Services will be in recess for 2 minutes. The Committee on Health, Hospitals, and Human Services is out of recess. I'd like to recognize the presence on St. Croix of Senator Maurice James. Welcome, Senator James, and also Senator Donna Fred Gregory. Welcome. Also, I'd like to recognize there is 2 additional testifiers on St. Croix that I understand did not put their name and position on the record. You can proceed putting your name and position on the record at this time. St. Croix?
Everybody did.
Everyone.
We're having an audio difficulty. I can't hear them over here.
I believe everyone was able to introduce themselves. This is Dr. Dawson.
Okay, thank you. Also, I'd like to introduce our summer intern student from Eudora Ken, Miss Ayana Fret. I thought she was here. I think she's downstairs. Okay, so at this time, we will go to the next testifier, Mrs. Josh Springett, Collective Bargaining. You may proceed. Oh, yes, and please play the videos while the testimony is proceeding. Thank you very much. Ms. Springett, you're recognized.
Good day, Honorable Senator Ray Fonseca, Chairman of the Health and Hospitals and Human Services Committee, Vice Chairman Senator Kenneth L. Gittins, other committee members, Senator Novell E. Francis Jr., Marvin A. Blyden, Diane T. Capehart, Samuel Carrion, Donna A. Fred Gregory, Maurice E. James, and Milton E. Potter, and any other non-committee members present. My name is Josh Springett, and I'm the Chief Negotiator at the Office of Collective Bargaining. In response to your invitation, I am here to testify on the status of the collective bargaining agreements for the Registered Nurses Leadership Union, or RNLU, Virgin Islands State Nurses Association, or VISNA, Licensed Practical Nurses Association, or LPNA, and the Public Health Physicians represented by the Seafarers International Union, or SIU. All nurses unions discussed today represent nurses with various levels of expertise who are employed at the Department of Health and our hospitals. The RNLU represents registered nurses in leadership positions. Their last CBA expired on September 30th, 2020, and is on a day-to-day extension while negotiations are ongoing. VISNA represents non-supervisory registered nurses. Negotiations were completed for this bargaining unit in April. Negotiations for the licensed practical nurses was completed in January. The Public Health Physicians Bargaining Unit consists of physicians at the Department of Health. Their CBA expired in 2010 and has been on a day-to-day basis since then. We are tentatively scheduled to begin negotiations in July. Senator, this completes my testimony, and I am available to answer any questions that you may have. Thank you.
Thank you very much, Chief Negotiator, Attorney Josh Springett. Of course, congratulations for those negotiations, those successful negotiations with the nurses union. I'm hearing a whole lot of good things about that.
Thank you, Senator.
Next, we will go to St. Croix. Ms. Salim, you're recognized. You may proceed with your testimony.
Good morning, Honorable Senator Ray Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, other senators present, colleagues, and listening audience. My name is Amina Salim. I am the Secretary on the Virgin Islands Healthcare Foundation Board. I am honored to be here today to testify concerning the operational status of the Virgin Islands Healthcare Foundation dialysis units and the crises in dialysis today. The Virgin Islands Healthcare Foundation is a 501c3 nonprofit organization. My involvement in dialysis came about as a caregiver for my late husband, Abdullah Salim, who was on dialysis for 4 years and passed away in 2009. As we say, who feels it knows it. I have felt the pain of the patients and the caregivers of those who suffer from end-stage kidney disease. I also happen to know it can happen to any one of us, you or me. I am here today with my colleagues, Dr. Tasneem Khan, who is the medical director for the Virgin Islands Healthcare Foundation, and Angel Rivera, who is the dialysis patient advocate. We are here today to talk about what we feel is a crisis in dialysis, and we would like everyone to know. I'd first like Dr. Khan to speak, and then it will be Angel Rivera, and then I will finish with our testimony. Dr. Khan?
Thank you, Amina.
Yes, you may proceed, Dr. Khan.
Pardon?
You may proceed.
Oh, thank you so much, Senator. Good morning, Honorable Chair, Senator Fonseca, Honorable Vice Chair, Senator Gittins, respected senators and members of the 35th Legislature. Good morning to all present here and the viewing public. Thank you for inviting me to give testimony on behalf of the Virgin Islands Healthcare Foundation, VIHCF, on the status of hemodialysis on St. Croix. Thank you all also for taking the time and making the effort to visit and tour our facility on June 3rd, 2023. Dialysis has been a heated and volatile subject discussed on the Senate floor many times over the years. I last testified on this topic at the 33rd Legislature in October 2018. As I put pen to paper for this testimony, I struggled on how I might convey the importance and urgency that must be recognized. Dialysis is now on the brink of deteriorating into a humanitarian crisis. I hope today that this harsh reality might awaken in the hearts and minds of those with power a purpose to make the difference between life or death for the patients suffering with end-stage kidney failure. I was asked by the Senate to provide basic information on kidney disease and dialysis. Kidneys perform many complex vital functions that keep us alive. They remove toxins and excess fluid from our body, maintain our red cell function, make hormones and vitamins, and regulate the balance of electrolytes in our blood. Without kidney function, a person dies within a matter of days. In most cases, the cause of kidney disease is diabetes and high blood pressure. As kidney disease worsens, waste and fluid build up and lead to swelling, shortness of breath, high blood pressure, low blood counts, weak bones, and life-threatening electrolyte imbalances of the blood. When the kidneys completely fail, one requires dialysis or transplantation to stay alive. Hemodialysis provides artificial life support. The dialysis machine and a special filter called an artificial kidney or dialyzer is used to clean the blood. Dialysis takes over the functions of the failed kidneys to remove the toxins and fluids and balance electrolytes. What the kidneys do every minute of every day to maintain life is now done on a dialysis treatment over 3 to 4 hours, 3 times a week for the rest of your life. During that treatment, you also receive medications and hormones that the kidneys normally produce. To get blood into the dialyzer, an access is created in the blood vessels with minor surgery, usually on the arm, but in emergencies, a large catheter in the neck vein is used when no usable arm access is present. Dialysis on St. Croix since the hurricanes. As you are now aware, if you do not receive treatment within days, you risk death. The Governor Juan F. Louis Hospital dialysis unit was destroyed and closed in the aftermath of the hurricanes of September 2017. CMS mandated immediate evacuation of all dialysis patients to the mainland for patient safety. It was an indescribably traumatic time for our displaced patients. Their lives were ripped from the roots. Away from their families and their home, they were thrown into an isolated, lonely, suspended existence between their hotel room and dialysis treatments. They had no choice but to endure, just to be able to get safe dialysis treatments to keep them alive. Several of our patients died during that time. Most were unable to return home for over a year. Meanwhile, St. Croix struggled to find a stable solution to bring patients home. It took over 1 year to secure and outfit 2 temporary trailers that were eventually certified by CMS in a limited special consideration capacity as a special purpose renal dialysis facility. It was not until late 2018 that we started to bring patients back home. The estimated cost to the federal and local government summed up to $40 million. However, the cost of lives was incalculable. To this day, they continue to receive dialysis treatments in a single functioning south trailer. Can you show the photos of the trailer, please? In 2019, COVID-19 emerged as a new threat to life for this most vulnerable population. In the event of another hurricane, evacuation during COVID was no longer an option due to the restrictions of travel and the grim reality that all medical facilities stateside were overwhelmed and not accepting patients for critical care, let alone for chronic dialysis.
One moment,
To be
Dr. Khan.
clear-
Media, you have the video of Dr. Khan's testimony with the trailer. Please proceed with the video.
It's
Go
a
ahead,
picture.
Dr. Khan.
Thank you, sir. In 2019, COVID-19 emerged as a new threat to life for this most vulnerable population. In the event of another hurricane, evacuation during COVID was no longer an option due to travel restrictions and the grim reality that all medical facilities stateside were overwhelmed and not accepting patients for critical care, let alone chronic dialysis. To be clear, this would mean that without a functioning dialysis unit on island, and the inability to transfer off island, the survival chances of a dialysis patient are very slim to none. The risk of this scenario is dramatically increased if there's only one unit on the island. There are over 110 dialysis patients right now on St. Croix alone, several more on dialysis stateside waiting to come home. We have patients in CKD clinics with advanced stages of renal failure, waiting for increased capacity, but ready to travel to the mainland if dialysis is needed before then. We must also consider those patients who present to the emergency room at the end-stage kidney failure and must start dialysis emergently. For this reason, the patient advocacy group has always endorsed that there must be a minimum of 2 units on the island. It is a CMS requirement to have options of care for patients. With our growing ESRD population, we need additional capacity and choice available on St. Croix. Patients have had to tolerate disaster conditions, and the staff have had to make it work with whatever resources were available in only one trailer. The Dialysis Patient Advocacy Group, which was founded to represent and give voice to all dialysis patients on St. Croix, has been increasingly vocal of the concerns about the current situations and the future of dialysis care on St. Croix. The patient group reached out to us at the Virgin Islands Healthcare Foundation about the need for a permanent solution, options on St. Croix, including having a second unit in case of a disaster or pandemic, as well as a broader spectrum of renal replacement treatments currently not available in the territory. The Virgin Islands Healthcare Foundation is a 501c3 nonprofit established in 2018 to facilitate healthcare initiatives that empower, educate, and enhance the lives of the most vulnerable in the Virgin Islands community. We believe that a comprehensive and tailored multidisciplinary approach addressing all the resource needs should be a standard part of providing quality, affordable, and accessible care. When the Dialysis Patient Advocacy Group approached us, they made it clear that patients had unanimously refused to transfer to the Caribbean Kidney Center under any circumstances. A signature list from all the patients receiving care in the trailer at the time stating their refusal was presented to us. The dialysis community asked for a solid construction facility, safe, protected, and resilient against the forces of nature. Number 2, avoiding evacuation for dialysis, the ability to resume operation after a catastrophic event. Number 3, water systems and backup power generators that are functional and maintained. Number 4, clean, comfortable, and efficient dialysis care. Number 5, Staff, well-trained, knowledgeable, supported, confident, and compassionate caregivers. Number 6, options for renal care, including peritoneal dialysis and transplantation. Number 7, access to preventative programs and ancillary medical care. Number 8, renal care for patients in the community who need it. Dialysis Clinics Incorporated, DCI. Several of our patients were evacuated to DCI, Dialysis Clinics Incorporated hemodialysis units stateside. Founded in Nashville, Tennessee in 1971, DCI now has more than 250 outpatient dialysis clinics in 30 states. DCI employs approximately 5,000 people and serves over 15,000 dialysis patients. DCI is the third largest dialysis provider in the United States, and it is the largest non-for-profit organization. The staff of DCI's dialysis units were trying to coordinate transfers home after the hurricanes and were alarmed that the patients could not return home due to the lack of dialysis capabilities. They petitioned the founders of DCI to visit USVI and help find a solution. DCI submitted a letter of intent to the Department of Health and to the hospital administrations, offering to stabilize and manage dialysis operations for them in the territory. On St. Croix, DCI's proposal was also to assist in planning and build out, and then to manage a state-of-the-art hemodialysis center. I would like to highlight a few of the innumerable benefits to the dialysis community of contracting with this respected and established nationwide non-for-profit dialysis provider. Smooth transition and continuity of care when patients travel to and from the mainland. Lower costs, taking advantage of bulk purchasing rates for medications and supplies. Compliance with CMS conditions for coverage and maintenance of safety standards. Patient access and outreach to prevention, education to reduce morbidity and mortality. Access to peritoneal dialysis and kidney transplantation. Staff education, workshops, forums, and opportunities for growth and improvement in their training and experiences. In 2019, JFL published a public request for proposal, RFP, to outsource their dialysis operations. The foundation, in collaboration with DCI, responded to this RFP. The RFP was awarded to CKC. The patient advocacy group spoke out on behalf of all dialysis patients about not having informed patients before the decision was made. An attempt was made to transfer the patients, but the patients refused and presented their written refusal to the hospital administration. The advocacy group pleaded with VIHCF to act swiftly. VIHCF DCI Dialysis Unit, St. Croix. The foundation secured and leased a space in Sunny Isles and applied for federal grants from the FCC, Federal Communications Commission, and American Rescue Plan Act, ARPA, to build a new state-of-the-art dialysis facility. VIHCF was awarded the FCC grant to provide telemedicine capabilities. This would allow for ongoing real-time monitoring of the patients receiving treatment during normal time, as well as during hurricane and pandemic. The foundation was also approved for ARPA funds. However, there were over 6 months of delays for a 12-month project in disbursements of the ARPA funds after the ARPA grant was awarded in November of 2021. By then, all initial proposals were invalid, and new proposals had to be requested from vendors. This came while the supply chains broke down worldwide and the costs and delivery times increased dramatically. Usually, water from a source is already potable, but it's tested and then treated to be ultra clean and suitably safe for dialysis. The tests of the water supply to the building could not be performed until the plumbing to the building was completed. When we were finally able to sample the water was orange and heavy with sediment. The tests confirmed our fears that the water entering the building was not suitable to enter our water system treatment. It would have destroyed the entire water treatment equipment. If you could show the photos of the water from WAPA, please. We realized that the additional water filtration
Dr. Khan, we have a
Yes.
technical difficulty with those photos, so you can proceed.
Okay, thank you so much, sir. We realized that additional water filtration systems and water storage were required to transform the discolored water entering the building into potable water. That also required leasing additional space. All this needed to be done to create potable water that can enter the reverse osmosis systems to be turned into ultra-clean water. Ultra-clean water can then be in contact with the patient's blood safely without contaminating the person and putting the patient's life at risk. With ongoing support from DCI, their teams of engineers, water specialists, architects, and water treatment specialists, we developed a new water treatment design that would meet CMS standards for life safety. This plan, requiring additional funding, was presented to the administration with a detailed description for justification of additional ARPA funds. This request was made in August of 2022 and subsequently approved by the governor. We have made several urgent requests for disbursement to finish the project and for the unit to be operational before hurricane season. However, we have yet to receive any of the additional funding. Had we received the additional funding, the plan would have been executed and the unit would have been operational by the first quarter of 2023. The foundation has been aggressively involved in alternate sources for fundraising and grant writing. However, these resources take time. The critical need is now. Time is not on our side as we enter what is predicted to be quite an active hurricane season. Even if we are not open for this hurricane season, it is mission critical to securely get the machines, chairs, and supplies on island now, before another hurricane disaster. If another hurricane hits and patients must be evacuated again, having the resources to finish the dialysis unit as soon as possible means we can bring everybody home within a few months and have an increased capacity to provide dialysis territory-wide. In conclusion, our sincere hope is that we can put our differences, judgments, and agendas aside and really come together as a community of the Virgin Islands to answer this plea for help. Let us not be detached from our fellow human beings because we may feel that this is not our suffering. Unless one lives with dialysis, either personally or as a family member or friend, one has no idea of the full extent of what is being endured. We can and should strive to fulfill a higher purpose with the privileged roles each of us is blessed to be placed in. God forbid this should be anyone's fate, but fate is the only veil that separates us from them. This is personal to every patient, to their parents, to their children, to siblings, to caregivers, and to the community. This must become personal for all of us. We must not fail this vulnerable part of our community, and we cannot allow another Virgin Islander's life to be put at risk. Thank you for your kind attention. I'm happy to answer any questions you might have.
Thank you, Dr. Tasmin Khan. Next, we'll have testimony from patient advocate Angel Rivera. Mr. Rivera, you may proceed.
Good morning, everyone. Good morning, honorable members of the Committee on Health, Hospital, and Human Services, senators, and members of the 35th Legislature. My name is Angel Rivera. I am a dialysis patient here on St. Croix. I also serve as a dialysis patient advocate for our island and have been in this role since 2018. With VIHCF, I am a volunteer. I have been closely involved with the design and construction progress of the VIHCS dialysis clinic. Also, a good morning to our audience members and those virtually joining us. I thank you for the opportunity to share my testimony and as another
Another
voice of the Virgin Islands Healthcare Foundation. I would like to begin by thanking those senator members and committee who came to visit our dialysis clinic this past weekend. As you saw, the clinic is 95% fully constructed. We are so close. Your presence means a lot to our team and personally to
we have technical difficulty on St. Croix. Media, while we're having that difficulty, is it possible to display the photos for Dr. Khan? And Dr. Khan, can you do a narrative of those photos while we resolve the microphone of Angel Rivera?
Yes, sir.
You may proceed.
Thank you.
Media, you may proceed with the photos.
This photo shows the current trailer for dialysis. It is the south trailer. On the right side of it is a north trailer, which was barely used and had to be closed. The south trailer, on the right of it, you'll see a ramp. The patients have to go up that ramp, turn left onto another ramp, and then enter the trailer from there. The trailer has 7 seats, and on the behind you can see a generator. That is the generator for power outages. Next. This is this is the back end of the trailer. We're looking at it from the other side. And basically it shows the ventilation systems and the air conditioning unit. There's a electrical and water housing on the left. That is the wooden structure. You can see at the base of the trailer, it is supported on stilts that are on the concrete, and it is supported with various methods to keep it upright. It has functioned reasonably well over the last few years, but it has had issues, especially with the air conditioning systems, with the generator, automatic transfer switch, and with some water leakage issues. You can see that time has taken a toll on this poor little trailer, but it continues to function. This is in the parking lot of this trailer is in the parking lot, which used to be the old previous doctor's parking lot of the Governor Juan F. Louis Hospital. This is the same picture showing the air conditioning systems and the electrical systems supplying the trailer. Next. This is inside the trailer. There are 7 chairs. You can see how narrow the trailer itself really is on the inside. That's a typical dialysis chair. And you can see that the floor has been expanded. What you see on the outside of the trailer, the floor has been expanded. And the floor has had problems and has been repaired. The brown areas are the repair areas of the floor of the trailer. And on the very end of that picture, you can see what is the air conditioning, massive air conditioning duct that is inside the trailer. Next. This is a dialysis machine. Again, you can see that this is how they're doing dialysis right now. Considering what they have to work with, the staff has done a phenomenal job at the hospital of maintaining life safety and taking care of those patients.
Okay, thank you very much, Dr. Khan. Mr. Rivera, you can proceed with the rest of your testimony.
Thank you, Senator. We'll continue. Your presence means a lot to our team and personally to me. As a constituent of the people that you serve. Some of you may remember me from 2019 when I came before the legislature to share my concerns about the treatment of dialysis patients in our community. I come again to you today with many of the same concerns. I am urgently asking that my voice and the voice of other dialysis patients be heard today. I would like to share about my experience and experience of many other dialysis patients, particularly about the quality of care and the importance of what the Foundation Dialysis Clinic can bring to us and our community as a whole. I feel it's critical you all hear my perspective on what we need as patients in our community. As I mentioned, I currently receive dialysis treatment in the trailer. This is not a place to receive care for years on end. While I have many concerns about basic safety in my treatment, I am left to remain silent, unsure of my treatment is not terminated. This has been a threat that I have received by making complaints and a fear that many dialysis patients in our community have expressed to me. They want to express their concerns, but receiving care is more important. We deserve better. We as a community can be better. As dialysis patients, we have been silenced. It's no longer acceptable that we need our help, that we need your help. The temporary trailers was set in place to be a temporary solution. Simply put, it's gone on too long. In my ongoing conversations with CMS, they agree that we need forward movement. VIHCF has provided dialysis patients with a comprehensive solution to a government and community problem. Just as FEMA shared in their assessment of what was needed in the Virgin Islands, the government cannot be the only resolution for a community problem. There must be collaboration with the public and private entities. VIHCF is a nonprofit agency that has come to the community with a quality care solution. In recent months, I received a letter from the hospital intent on having an outpatient dialysis unit, but when it will be happening. The hospital build out of the unit is not something coming anytime soon. It takes time, and I, along with many other patients, do not have time. Can you see the urgency, senators? Please hear me today, because I have not felt heard since 2019. That's 5 years ago. Nothing has changed in terms of receiving quality care we deserve. We are a vulnerable population who has been and continue to be neglected. One of the issues I have extreme concern about today is knowing that there is a plan for us as we enter into hurricane season. The water, the airs are getting warmer. Members, this means we will have an active hurricane season. We must prepare. And when I ask questions about what is the plan is for us, a vulnerable population, I get no clear answers. I have patients asking me almost daily about situation of the dialysis clinic because they want better care and for some to be home. I have to just keep telling them, we are waiting funding. We are waiting for our government to understand the desperate conditions we are under. Senators, I need you to stand up and stand up for us and make people be accountable for addressing a crisis of our people. A dialysis patient, we go through a lot as it is. We have been through too much. Please do not make me, my family, and my other patients keep needing to survive on substandard conditions and treatment. Instead, being able to live our best and most comfortable lives in quality care, we deserve life too. Do you understand what I'm saying here? I ask you, reach out to our dialysis patients in confidence. What I am sharing with you is not my story. It's a collaborative story. I am just one. I am just not afraid to speak. In our history of keeping voices heard, I will not go down easily like some want. I am here. I am not leaving. We cannot keep waiting for Senate members. I urge you to hear our cry for help. Get us the financial emergency funding resources that are there so that we can urgently need to address our crisis. Today, we need your help to finish open the dialysis clinic that we could have several months ago, that we should have had several months ago. The holdups are unacceptable and are costing the patients suffering daily with stress, and that could be alleviated. It's not a want, it's a critical need. Lastly, I want you to know that we recently lost an important member of our team, Mr. Wallace Fair. Was the heart and soul of our efforts. He passed last month stateside. His dream was to see this dialysis clinic open, to see a quality care come to St. Croix. He always stressed not to give up, keep fighting. I am here today in his honor and ask for you to hear his voice as well. Please do not leave us neglected any longer. Thank you.
Thank you, Mr. Angel Rivera, dialysis patient advocate, and just recently the Committee on Health, Hospitals, and Human Services traveled to St. Croix to witness firsthand the conditions of the dialysis patients. And we definitely hear your voice, and thank you very much, and rest assured I can vouch that the legislature is taking this dialysis matter very seriously. We know about the millions of dollars the community spent after the hurricanes to transport patients. Some went to Puerto Rico, some ended up in Atlanta. Unfortunately, many never made it back to the Virgin Islands. So we definitely have that as a priority. And thank you very much. Next, we will go to the testimony of Dr. Walter H. Gardner, Caribbean.
Excuse me, Senator.
Yes.
This is Amina Salim. We want to just conclude. I have my testimony to read also.
Okay. Okay, you may proceed because you're with the same group. You may proceed, yes. Ms. Salim.
As you have heard from my colleagues, we are passionate volunteers, advocates for a cause that is close to our hearts, a cause that is a matter of life and death for a significantly growing number of Virgin Islands residents. It is now a crisis, and we are offering solutions. This is a crisis right now. Dialysis is a crisis in the Virgin Islands, but it's a very big crisis in St. Croix right now. People don't want to talk about the crisis. They like to talk about nice things. I believe COVID was easy for everyone because it was in your face. But just because this is not in everyone's face, it's still a crisis. Crisis number one, the Virgin Islands Healthcare Foundation dialysis unit. The build out of the Virgin Islands Healthcare dialysis unit is 95% complete. It will accommodate 78 patients on 3 shifts in a brand new, safe, and CMS compliant environment. Although we appreciate being awarded $1 million in March of 2022 and have used those funds wisely to totally renovate the building out of the unit, we still need an additional $941,476 of ARPA funds to complete this project. This additional funding was initially approved by the governor, which included the cost for an additional build out due to increased prices in materials and labor, water purification costs. As you see, the color of our water was brown, the purchase of dialysis chairs and machines. We also are working to raise another $750,000, which is for the initial operating costs. The operating costs are needed for the first 6 months until our medical insurance, Medicare, and Medicaid payments are reimbursed. After we start receiving our payments through billing, we will not need any more funds from the government. We will be self-reliant. These operational funds are required by our management partners, the nationally recognized 501c3 nonprofit, the Dialysis Center Incorporated, who have over 250 dialysis units nationwide. What is the issue? The issue is this: the Virgin Islands Healthcare Foundation dialysis unit cannot open during this hurricane season due to delays in funding. We have been waiting for funding and we're not going to make it. If we were open, we could house at least 78 patients. The Juan Luis Hospital units would be able to shut down the trailer, and the patients would feel comfort in knowing that there are 2 dialysis units, the Virgin Islands Healthcare Foundation dialysis unit, and the Caribbean Kidney Center unit that could negate the need for separation from home, family, and friends after disaster. We have recommendations. We ask the senators to please assist us in getting the $941,476 of ARPA grant funding from OMB. We have submitted, we are gratefully to accept any recommendations also that you may have that will assist us in raising the $750,000 in operational and staffing costs. Once we get these funds, we anticipate opening in October of 23. Why did we take on such a project? Because it's a need. This unit, by the time it ends, would cost us about $4 million. We have already put in about $2 million and $2.5 million from what we got donated before and what we got from ARPA. But we need help, and this is a public service. Crisis number 2, the Juan Luis Hospital dialysis unit trailers. The 2 temporary trailers certified by CMS officially as special purpose renal dialysis facilities in late 2018 are now 5 years later in dilapidated condition with only 1 trailer still functioning. That 1 trailer has to be approved monthly by CMS to use. Issue. What is the issue? In the condition of the trailer is now in, and you saw the pictures. One bad tropical storm or Category 1 hurricane could destroy it. This scenario could leave 40 dialysis patients presently served by Juan Louis Hospital dialysis unit with only one choice for dialysis, the Caribbean Kidney Center, which cannot accommodate additional 40 patients. This is the only option since the new modular hospital does not include outpatient dialysis service. We also understand that the Kidney Center has told some staff and patients that they are closing soon, creating anxiety for all patients and causing crisis number 3. Recommendations: assist the Virgin Islands Healthcare Foundation in getting ARPA funds approved. We have submitted everything to OMB. It is months now, and we cannot get that money. Another request. We request, and this is a big one for us, we are requesting that the senators try to make everyone work together. We request that all the dialysis unit stakeholders on St. Croix meet and work together as partners within the next 30 days. Schedule a legislative hearing for the week of July 10th. And at that hearing, have all the stakeholders testify on the results and solutions for dealing with the crisis. This is a crisis. Everyone needs to work together. There are no enemies. We all have to be partners. Crisis number 3, the Kidney Center. And I know Dr. Gardner is here and he will talk about it, but from what we hear, and I want you to know we're here advocating for them also, the Caribbean Kidney Center is privately run dialysis unit by Dr. Walter Gardner, that Dr. Walter Gardner owns. It presently has approximately 60 plus dialysis units. The issue, we have heard from many, that Dr. Gardner and the Caribbean Kidney Center has threatened to close its unit due to increase of nursing staff, the increase for nursing staff at the current rate. We understand their negotiations with Dr. Gardner about possible ways to avoid an humanitarian crisis that would occur if he were to close. That would be a disaster. There would be no place on the island that for those 60 patients presently being served there to go for dialysis. However, if the Kidney Center remains open and the hospital trailers closed down, there's still not enough capacity for all the dialysis patients on St. Croix, plus those waiting to be placed on dialysis and off-island waiting to return. Recommendation: we need 2 fully functioning long-term dialysis units in St. Croix. Patients deserve to choose who they want to go to for their health care provider. If there is only one dialysis unit and disaster hits, either natural or man-made, unless it is declared a federal disaster, the responsibility for getting all of those over 100 dialysis patients off St. Croix is the financial responsibility of the Virgin Islands government. This would be a real disaster for the Virgin Islands government, who would have to pay from the general fund for the relocation. As it cost FEMA in 2017 and 2018 $40 million to send patients all over the country and pay for dialysis and housing for over a year. Residents and patients need to be able to choose where they want to go for dialysis. They can't fly off the island 3 times a week for dialysis. Also, one unit has to be able to support the other in case of emergency or disaster through a memorandum of understanding. We request, once again, that all the senators help us and that all dialysis unit stakeholders in St. Croix meet and work together as partners within the next 30 days. Schedule another legislative hearing for the week of July 10th. At that hearing, have all of the stakeholders testify and the results and deal with the crisis. This is only going to happen if we all work together. If, as Angel Rivera said, and Dr. Khan, in 2018 and 2019, we talked in front of the senators for a problem. They are still in the trailers now, 5 years later. If you don't keep on people to do what they have to do, we're going to be right here again, and you're going to have a huge disaster. In conclusion, we appeal to you as leaders. Time is of the essence. Each delay is due to a lack of funding, pushes us back further, and lives are at stake. This appeal is a humanitarian effort for dialysis patients. We cannot move forward without your assistance. Thank you for the opportunity for coming here before you today. We urge the government, who has a tendency to be penny wise and pound foolish. Let us not wait till a real disaster comes and we have to send patients off this island once again. Thank you.
Thank you, Ms. Amina Salim, and my condolences to you once again. Your husband, Abdullah Salim, I worked with him for many, many years while I was at the Housing Authority. A real gentleman. And definitely we know that it cost the territory $40 million after the hurricane to transport those dialysis patients off island. And you're telling me that was just for 1 year. That was $40 million. Okay, thank you very much for your testimony. Next, we will go to Dr. Walter H. Gardner from the Caribbean Kidney Center. Dr. Gardner, you're recognized for your testimony.
Good morning, Senator Fonseca, Chairman of the Committee of Health, Hospital, and Human Services, Vice Chairman Senator Gittins, Committee members Novell Francis, Marvin Blyden, Diane Kivart, Samuel Carrion, Donna Fred Gregory, Louise James, and Milton Potter. Non-committee members, invited testifiers, viewing and listening audience. I am Dr. Walter Gardner. I am the Medical Director and Managing Member of HealthQuest LLC, the parent company of Caribbean Kidney Center, CKC. Accompanying me today is Ms. Yvette Rodriguez, the Executive Director of CKC, who you'll hear from shortly. Thank you for your time, your indulgence, and attention. Senators, your presence here this morning is tangible evidence of your commitment to ensuring the well-being of every Virgin Islands resident, and especially those residents who require dialysis services. We share that in common. Before coming to the Virgin Islands 28 years ago, I dedicated my life to serving patients with kidney disease. That remains my passion and my raison d'etre. I would like to provide the committee with a brief historical background to give us all perspective. Prior to my arrival in St. Croix in 1995, hemodialysis was provided to residents starting approximately 1984 without Medicare certification and subsidization by the Department of the Interior. The JFL hemodialysis service on St. Croix was not Medicare certified until May 1995. After I assumed the directorship of that facility, upon my appointment, I made Medicare certification a priority and achieved it after 5 months. When I assumed the directorship, JFL was treating 24 patients. Many patients with kidney disease sought care off-island. The prevailing attitude on St. Croix then was dialysis was a death sentence at JFL. This misconception was my next challenge, and target. With the support of Mr. George McCoy, then the JFL CEO, I mounted a public relations campaign to raise funds to replace aging, obsolete dialysis machines, and new machines, and several internal changes were initiated, including going from 6 days per week treatment schedule instead of 5, initiating an on-call schedule for nurses so patients presenting in extremis at nights or weekends could be treated emergently, changing from acetate to bicarbonate dialysate, and many other upgrades. These changes were not revolutionary or radical, but were standard in the industry at the time. Nevertheless, they surprisingly stirred great upheaval among the staff of the facility, leading to poor morale. I made this morale issue my next target, addressing it through education of the staff, of patients, and the community. Many meetings took place in churches, schools, and civic organizations. At the end of my first 2 years at JFL, at the end of my first 2 years, the JFL facility had made substantial strides, reversing the fear of dialysis in the community and improving staff morale, and increasing the patient census to 55 patients, 130% growth. Patients were receiving care on island rather than being shipped elsewhere. Today, the JFL census is approximately 40 patients. I left JFL after 2 years as director of the hemodialysis services because of politics. Over the next several years, the JFL facility was cited for a variety of Medicare violations, including related to quality of care and environmental issues, and threatened with sanctions. In 2011, Medicare sanctioned JFL by involuntarily decreasing its patient census and ordering that some of its patients to be transferred to CKC. 20 patients were transferred to CKC for care, and JFL was barred from admitting new patients until corrective measures were taken. Perhaps because of the sanctions or continued threat of sanctions, in 2012, JFL issues a request for proposal, RFP, for outsourcing its hemodialysis services. The RFP was awarded to 2 nephrologists who had recently moved to St. Croix. However, for reasons unknown to me, they were never able to effectuate the award. In November 2013, CKC established a hemodialysis facility on St. Thomas, steps away from the hospital, and large enough to treat the entire hemodialysis population in St. Thomas. At that time, and to permit for reasonable growth. It remains operational today. 2014, Royal Leicester Snyder Hospital, RLSH, on St. Thomas also issued an RFP for outsourcing its hemodialysis services. The RFP was awarded to DaVita, a North American large dialysis organization. DaVita, however, eventually withdrew from the venture. RLS, Roy Schneider Hospital, continues to provide hemodialysis services. In 2015, another hemodialysis facility, the St. Thomas Dialysis Unit, opened in St. Thomas. After a little more than a year of operation, it closed its doors in 2017, and all its patients were transferred to CKC. 2017, following hurricanes that ravaged both islands, a governmental decision was taken to evacuate all hemodialysis patients, initially to Puerto Rico and later to the mainland. A few patients in St. Croix chose not to be evacuated and were treated at CKC, whose facilities suffered only minor damage. CKC never ceased operation, and no patients missed a single treatment for more than a year that the evacuation lasted. Eventually, when the decision was taken to return the patients to the territory, CKC facilities were the facilities to accept returning patients and did so without reservation. In 2019, JFL resumed hemodialysis services in temporary facilities, the trailers that were referred to earlier. Effective September 15th, 2020, however, the trailers were deemed no longer appropriate for providing hemodialysis services. However, to continue providing services until appropriate arrangements could be completed for long-term care of his patients, JFL was granted multiple 30-day extensions of certification. In September 2020, JFL again issued another RFP for outsourcing its hemodialysis services. After several contrived delays, CKC won the RFP. However, the terms of the RFP were never honored by JFL, and none of the patients ever received any of their treatments at CKC. This brief overview is presented to show that since 2003, when CKC was established under my leadership, it has been the single stable source of hemodialysis in the territory, the facility of last resort without regard for the cause of the disruption of services here. I have been in the practice of nephrology since 1978, when I was engaged as assistant professor in the Department of Internal Medicine and chief of nephrology at the nation's oldest and largest black medical school, Meharry Medical School. I remain the most experienced nephrologist in the territory, and I have demonstrated time after time a commitment to supporting the territory's health needs while elevating healthcare outcomes. It was during my tenure in Nashville when I was introduced to DCI, the folks behind the other folks. Meharry was a black institution across the tracks. Vanderbilt was the big university where DCI was based. I was convinced that Meharry, where a significant number of the country's black physicians were being trained, should train its doctors in the provision of dialysis. I therefore naively went to Vanderbilt and DCI requesting their affiliation. We are requesting some affiliation and partnership to establish hemodialysis at the Meharry Hospital. I was politely ignored. Committed to that objective, I then turned to the institution where I trained and sought help from my mentor, who was affiliated with at the time, a large dialysis organization in America called Biomedical Application, BMA. BMA willingly accepted the challenge, and BMA of Nashville was established. The fallout, however, was predictable, but certainly not anticipated by me. How dare I bring a major competitor into DCI's backyard? This was my introduction to politics and medicine. DCI was not happy, and that unhappiness now finds itself being played out here in the Virgin Islands. One of the most challenging aspects of operating a hemodialysis facility is the recruiting and retention of qualified clinical staff, registered nurses, and patient care technicians. And this has only become increasingly more difficult and costly. The COVID pandemic aggravated this vexing issue immeasurably. The COVID-19 emergency declaration made federal funding available to the Virgin Islands. And through the good auspices of the Department of Health and the local government, CKC clinical staffing needs were supplemented. On May 11, 2023, when the COVID emergency declaration ended, so did the federal funds, and with it, the assistance from the Virgin Islands government. There is an impression circulating that because CKC received assistance from the local government, CKC made windfall profits. Nothing is further from the truth. Without the help from the Virgin Islands government, CKC would have faced the same crisis it faces today, just much earlier. On March 9th, Mr. Douglas Koch, JFL CEO, approached CKC, and since then, Mr. Finch, Chairman of the Territorial Board and Government Hospital and Health Facilities Corporation, GHHFC, and Ms. Commission, the CEO of our Royal Leicester Schneider Hospital, have joined the discussion, and there has been ongoing dialogue with JFL, RLS Schneider, and the Government Health and Hospital Foundation leadership to work a fair transaction so that GHHFC can have access to my facilities and provide long-term stable care for ESID patients in both islands. Some of this has been reported in the news, even though we have a confidentiality agreement, and others have attempted to use this information to their advantage. CKC entered into a short-term agreement with a recruiting company to continue to provide clinical staff effective May the 12th to allow for the completion of negotiation with the Virgin Islands government. CKC received its first invoice for staffing services for the period May 12th through May 27th, a 2-week period. The bill was $72,492.08. This is a period without holidays and, fortunately, no overtime hours. This cost is prohibitive and unsustainable. I therefore find myself in an economically untenable position. I recognize the difficulty posed by the sudden termination of hemodialysis services, both to parents, patients, the staff, and the community, an issue which will be addressed further by Ms. Rodriguez. I am therefore desperately working to find a viable solution. To that end, I am requesting the Senate that the Senate appropriate funding to cover these extra staffing costs, while CKC and the Government Hospital, Health and Hospital Foundation Corporation expeditiously work out a fair deal to transfer my fully built out and equipped building, which has withstood several major hurricanes. So the government is in a position to provide care to all the JFL, Royal Leicester Schneider patients, and to all the patients, all of my patients, in a singularly durable location on each island. Senators, closure of CKC is imminent without your intervention. Patients will die, employees will suddenly find themselves without income, and there will be chaos. 20 years of hard work will rapidly be for naught. I therefore plead to you to act and act quickly. I make the same request of the Government Health and Hospital Finance Corporation to complete negotiations so that dialysis patients may again receive their care in an environment of comfort, clinical competence, reliability, and with a sense of security. I can only now reiterate the need for urgency regarding any actions you may choose. As Ms. Salim mentioned, and I heartily endorse, time is of the essence. Thank you.
Yes, thank you very much, Dr. Gardner. I just wanted to, before I go to your CEO, Ms. Rodriguez, I just wanted to be clear. You're saying that the Pafford staffing expired May 11th, and you're needing approximately $72,500 every 2 weeks to continue operation. Is that what your testimony is saying?
Essentially, yes. Yes, Senator.
Okay, thank you very much. We'll go now to Ms. Yvette Rodriguez, CFO. Ms. Rodriguez, you may proceed with your testimony.
Thank you, Chairman Fonseca, Vice Chairman Giddens, and members of the Committee on Health, Hospitals, and Human Services for inviting me and Dr. Walter Gardner to provide testimony on the critical topics of dialysis services and care, and I'm hoping that your commitment to advancing solutions will lead to progress. I am Yvette Rodriguez, Executive Director at Caribbean Kidney Center. I testify today not only as someone who has spent more than 20 years serving the U.S. Virgin Islands dialysis patients, but also as someone who has personally witnessed the impacts of chronic kidney disease on my family, friends, and greater community. Caribbean Kidney Center has been providing essential and much needed access to dialysis services for patients services for patients close to home here in the U.S. Virgin Islands for more than 20 years. We provide compassionate care in 2 locations, one on St. Croix and another location on St. Thomas. We're large enough to serve our territory and small enough to care for the Reno community. We're dedicated to our mission in improving the lives of our patients. Behind the scenes, we have consistently improved and saved the lives of hundreds of Virgin Islanders suffering from chronic kidney disease because when care is provided in the best possible way, there are fewer medical complications. Every day at the Kidney Center is a day of miracles. Our success so far can largely be attributed to the incredible strength of our team with exceeding levels of engagement and unity. Perhaps one of the greatest demonstrations of our passion is that in our 2 decades of existence, there have been many circumstances in which our presence has meant the difference between major catastrophes and continued survival of our dialysis community here in the U.S. Virgin Islands. In September 2010, the Governor Juan F. Louis Hospital and Medical Center outpatient dialysis facility was under a Centers for Medicare and Medicaid Services settlement agreement, in which CMS detailed the list of measures and requirements to avoid termination of the outpatient dialysis services. And one of the many requirements was, in fact, to transfer 33% of their patient census to the Caribbean Kidney Center St. Croix for care until Governor Juan F. Louis Hospital improved their standards of care to the renal patients. In 2012, the Roy Lester Schneider Hospital and Regional Medical Center's dialysis facility was at capacity and unable to receive any newly diagnosed patients, and a group of our Centomians brothers and sisters were receiving dialysis treatments in the emergency room. And when I say receiving treatments via the emergency room, many of them were only receiving 2 treatments rather than the normal 3 treatments each week. Many of these patients moved to other locations to receive their life-saving procedure. As a result, Caribbean Kidney Center St. Thomas was established in 2013 because for the Kidney Center, doing nothing while patients suffered, deteriorated, and died was not an option. In August of 2017, a month before the 2017 hurricanes, the St. Thomas Dialysis Center, LLC, informed the Kidney Center's management team with only 1 day's notice they were temporarily closing their dialysis facility and needed to transfer a number of patients to the Kidney Center. We accepted all patients. The St. Thomas Dialysis Center has never reopened. Afterwards, we were all impacted by the 2017 hurricanes, and dialysis patients were evacuated. The Kidney Center on St. Croix provided uninterrupted dialysis treatment to those patients who refused to transfer off island. We've all heard in the news the horrific conditions our patients faced and the many patients who suffered and died away from their families and from home. Following this, the Kidney Center was contacted once again by the Centers for Medicare and Medicaid in December of 2017 with efforts to return dialysis patients to the U.S. Virgin Islands. And once again, the Kidney Center worked closely with CMS and Quality Insights Renal Network 3 to return patients home and provide access to dialysis care, not only to the Kidney Center patients, but to all VI renal patients. My testimony and that of Dr. Walter Gardner will identify obstacles of access to dialysis care in the territory. Today, the Kidney Center's ability to continue caring for dialysis patients and providing essential dialysis services to the U.S. Virgin Islands is being threatened. We're deeply concerned, particularly about the ongoing challenges of hiring and retaining skilled dialysis nursing staff and having to contract with a nursing organization with associated increase of personal cost and an impact on the quality of care, making the situation simply unsustainable. Unfortunately, Medicare's existing payment rates for Puerto Rico and the U.S. Virgin Islands are unable to sustain the rise in labor costs, high inflation, cost of medication, and supplies. Both Medicare and Medicaid reimburse less than the cost of providing dialysis services. The shortage of skilled dialysis nursing staff has detrimental effects on the overall health of our dialysis population. Recruitment and retention of dialysis skilled staff has long been a persistent challenge for us. Shortages and increased labor expenses resulting from the pandemic have placed additional financial pressures. To mitigate the closure of our facilities, we're continuing to explore strategies to allow us to remain viable within the community. Please understand that if the Kidney Center closes, the local economy suffers as many local healthcare jobs will be lost, dialysis patients will be forced to travel and move out of the U.S. Virgin Islands to seek dialysis care, and the dialysis patient's mortality rate will increase. The remaining resources available at Roy Schneider Hospital and Medical Center and Governor Juan F. Lewis Hospital dialysis units do not have the capacity to treat the additional patients from the Kidney Center. In closing, the Kidney Center has always served a higher purpose, and its perseverance is crucial to the nearly 130 patients and their families we serve across the U.S. Virgin Islands, and the many more other Virgin Islanders suffering from pre-dialysis stage of chronic kidney disease, and also many patients and families visiting our majestic islands. We want to continue to serve our community and ensure the best patient outcomes, but if we close, it will be medically and economically devastating for our community, and your assistance is needed to address the magnitude of the crisis we're facing today. We thank the Senate Committee on Health, Hospital, and Human Services for listening to our concerns, and thank you for assisting us to maintain life-sustaining dialysis care here in the territory. I'm available to respond to any questions. Thank you.
Thank you very much, Ms. Rodriguez. And as I said earlier, the Committee on Health, Hospitals, and Human Services, we toured your facility, and I understand you have about 62 patients, more or less, at the facility?
Correct.
Okay.
Correct.
Okay, thank you very much. Next, I've gotten a special request from our esteemed President, President Francis of the 35th Legislature. So I would allow some comments from a very distinguished individual in our community, former Commissioner of Health. She's also the former Commissioner of Human Services, and she served as Director of the Frederiksted Health Center on St. Croix, and also her mom was a dialysis patient, and her husband was a dialysis patient. So, Commissioner Vivian Epson Flood, you're recognized for your statements. Please recognize the mic.
Good morning. Good morning, Chairman Fonseca.
Good morning.
Vice Chairman Kevin.
Afternoon,
Senate
right?
President Norvell Francis. Actually, good afternoon. Senate President Norvell Francis, all of the members of the Health, Hospital, and Human Services Committee. This morning, this is real deja vu. But I felt it, and I think I have to thank my friend Amina Salim. When I was listening and I heard you say, who feels it knows it. And I think I bring a vast amount of experiences, but as public servants and public leaders in present, past, and whatever future roles they may be, we have an obligation to speak our piece and to tell our truth. And I see Ms. Dawson who sits there, and I wear many hats. And Chairman Fonseca, I want to thank you because you've got a lot of them there. And I'm a nurse by education, so I add something else to that. But when I heard, and I have no written testimony, what I have is a passion testimony. And true, Amina, who feels it, knows it. I have walked the walk as Commissioner of Health with a need to address dialysis needs in the territory, to expand CONs and create more chairs. That was in 2007 and 2008. At the time, after you are in a role and you serve and you don't know why you do what you do, but you sign a CON to create additional chairs, not a year later, we were faced with a spouse who is being told was in kidney failure. For no reason, to this day, we don't know. We just know it's idiopathic. And so we were on the roll of being dialyzed. And I remember sitting outside a dialysis unit at JFL saying that a year ago when I signed this CON, I didn't know that my spouse would be sitting in one of those chairs. And we did that. We were blessed for our husband to be transplanted by a non-related living donor. We got that done. We achieved that, and he's been successful for the last 11 years, and we give thanks for every day that that donor decided to donate. I see Dr. Khan, because I know that you took care of him as well. Dr. Ramesh Lakram walked the road with us. So I feel like I'm at home and can be frank and really speak my truth. Just recently, I had an 89-year-old mom who had to be started on dialysis. JFL, at the time with CMS mandates, could not admit any more patients. And so we had the opportunity and the choice of going to CKC. I am friends with everyone that sits here. Mr. Richards, the advocate, you're probably the only person that I don't know. Brittany, I've seen your advocacy publicly, so I know you got energy, and I know that's the nurse in you. But I've been here and I've walked the road, and who feels it knows it. At 89 years old, to have an elder parent in need to be dialyzed 3 days a week. She made 90 at that facility. We recently, her work on earth is done, and we had to lay her to rest. But what I'm here today to speak about is not all my accolades, not the roads I've held, not the work that I've done, but the fact that this body and all the testifiers, the fact that these services don't exist, we have a major problem. And it's not overnight. I know what the new facility is being put on board to do and what your plans are and what your vision is. I think every patient should have choice as to where they want to go. We may have thought that JFL would have been ideal, but when we looked at where we lived, CKC was closer. And at 89 years old, getting up 3 days a week, 3.5 hours to 4 hours per day, the closer you are, the better it is. For those of you that have lived it and have had the experience. As a caregiver, I can speak as well, because we know that, yes, it's about the client who's going through the service, but it upheaves the world of the caregiver. Nothing is ever again normal. It is, you eat what they eat, you drink what they drink, you feel what they feel. And I can tell you, even after being transplanted, that doesn't make it go away. Because now you have the caregivers and the providers telling you, listen, they're a normal patient. You have more stress on a transplanted patient than the patient with the transplant. Because every day you live it to make sure that that organ lasts. We cannot keep up with the need that's there. And the need is there. And as a former commissioner of health and as a nurse, our real issue here in the territory is prevention. That's the key. We'll never be able to keep up with as many transplants and dialysis chairs as we need. We noticed that the pharmaceutical industry has changed, and now you've got Jardian, and you've got all these things that prevent you from absorbing more sugar to prevent kidney damage and propose you getting to end-stage renal disease. But when I heard Amina this morning, I said, you're obligated to say something. I cannot complain about the care we received at CKC. If I did that, I would be not telling you the truth. I cannot say that there's days that we may not have bump heads with Dr. Gardner, but that's his role as a provider. He's the provider, my mom's the patient, I'm the caregiver. And then when you go in with a little bit more knowledge of healthcare, you kind of become a little bit more dangerous because you think you know everything. But I can tell you, walking into a facility, the services we received from the day that we entered to the day that my mom no longer had to go there. My mom was dialyzed the Friday, and she passed the Sunday. She was prepared. She told the staff, I'll see you on Monday. She didn't make it to Monday. But I can tell you that when I picked up the phone that night, at 7 o'clock heading to the OR, to the emergency room with my mom, and I called Dr. Gardner and I said, it don't look good. And he stayed with me on the phone all the way there. I think that, yes, our personalities may not gel, but what I implore all of us, our elected officials, our advocates, our caregivers, this is about the patient. It is not about us. It is not, I can tell you on the Friday, this Friday that my mom was going for dialysis, she said, I wish you guys were on dialysis. And I knew that it wasn't malicious. Mm-hmm. She says, then you would feel what I feel like. Mm-hmm. This was myself and my brother she made that statement to. Mm-hmm. And she said, then you would know what it feels like to sit for 3.5 hours. And you tell her you have the TV, you can look at the TV, you can look at the news. It is trying, it is difficult. But I can't imagine if I had to take my mom away from here. I can't imagine if we had to fly my mom away from here. We lived through when my mom started dialysis at JFL. We lived through COVID. She was 89. And you couldn't see her every day in a family that you see her every day, 24 hours a day, 7 days a week. And you would talk to her on a cell phone. She's 89, she ain't worrying about no cell phone. You'd get her the cell phone, she's ready to come home. But I will never forget the day when she came home. She started that process without any of us there. And not that the staff, that there was an issue, because I think everybody she met, she acclimated to, and they just loved her from beginning to end. But my mom, her herself, I need to say, was a retired nurse. So her expectations of the healthcare system were very high. At 90, she was blessed with all her faculties, and I pray to be that straight at 90. Mm-hmm. She was our Rolodex. Mm-hmm. If I said I need to call Amina tomorrow at 9, at 8:59, she said, remember, you got to call Amina. So she was blessed with that. But when she started that process and I went to pick her up, when we couldn't visit because of COVID, it's like a parent and a child when individuals say you could always know the voice of your child in a crowd of 1 million people. And I heard my mom say, Vivi. And when I turned, it was her. I started crying, she started crying, and she said, I thought you abandoned me. At 89. And I said, never in the world. And I said, never again would it happen. But I passionately say, I ask this body, that CKC may be a for-profit. JFL may exist with all its needs. The up-and-coming unit may be there. But don't let it ever be forgotten that it's about the patients that we are obligated to serve. And I say that in my personal hat, in my healthcare professional hat, in my former leadership hat, but sometimes you don't always have to lead from the front. Mm-hmm. A leader knows which role you play. It's like the story of the ants. Sometimes you lead in the front. When you get tired, you drop back and you let somebody else lead. Because it ain't about The message is about the messenger. But I want to thank you for who feels it knows it. I say that whatever the requirements are, I think we are bright enough to figure it out. I always believe Senator Gittins, Senator Francis, this ain't our first rodeo. You guys have been it a long time. But I also know your passion, and I also know your abilities, and I also know the expectations that you hold. Because I've been on the other side when our conversations might not have been friendly, but they worked because they were about being accountable. I think that everyone has their ability and they do things a certain way. The structure of JFL is as it's structured, their government responsibilities. The structure of the new foundation entity, the structure of CKC. The issue is the 62 patients, the others that are at the hospital, and the ones who today, before this day is over, will be in need of dialysis and have to find somewhere to go tomorrow morning. The paperwork that's probably right now going between JFL and CKC. What happens to that patient? I think, Mr. Rodriguez, I do believe you are an advocate, but I do believe you're a patient. Rivera, I'm just changing your name, I'm sorry. That's Yvette, I'm sorry. You've lived it. Amina and I have lived it on the other side of supporting a spouse. Dr. Khan, Dr. Gardner, you guys have treated these patients. Brittany, I know you've seen your share of persons who are on the edge and need to get there and try to prevent them from getting there. And I name out everyone because we all sit here with a responsibility. It is not about personalities. It's not about your feelings may have been hurt. And there's things that we all have to correct about ourselves. That's just us as human beings. But I think what the greater responsibility is today is that how all of us sitting here make sure that the persons who have less of a voice than us, that we make sure something is in place for them to get care. I have a relative that was one of the individuals who was transported off island after Irma and Maria, longs to come home, wants to be home. Because we all know that you can go and you can visit. It could be your sister, your brother, your cousins, the best of friends, but there's a time limit. As they say, come visit me and come live with me is two different things.
2 different things.
And when you don't feel good, you want to come home. You want to be home. You want to have access to the service. So I just felt that I would have been wrong to not be here, to not give you that personal testimony and the experience. Because even when my husband had to be on dialysis and be transplanted, you started to wonder, what is your life going to be like? It changes. When we got the news that my mom needed to be on dialysis and the day we had to start, it's one thing when you hear it, and it's when you start, it's something different. It's the monitoring that's necessary that you want to do around relatives and around friends and around people who know you. And some of the days ain't easy. Some of the days they don't want to go. Some of the days you know they have to go. But the issue is, the big question is, where do they go? And where do we go tomorrow when we have an issue of a unit being constructed, when we have the limitations of JSL? We all are a part of this puzzle. It is a creative puzzle. It's like graduate school. And I think the one thing about graduate school is when you have to figure out how do you work as a team. We all work solo very well. The hardest part is that group project. And the issue is, where do we have the discussions of that group project, whether it's publicly or privately at the table, to figure out how we keep the patients in the middle. So I end my passionate statement by thanking the chairman, the vice chairman, Chairman Fonseca, Vice Chairman Gittins, Senate President Francis, those of you that are here in the chamber and charged with. We have been on the side as well as where we were at CKC and we were sent to Pleasant to Dr. Tawakal to access a fistula to make sure that it's working. So I know the team can work together. I've seen it, been there. But I say passionately to each of you, please do not let us forget the people who we are charged, the persons who are between any age group, because right now I had seen young faces at CKC. I think my mom may have been the oldest patient. She made 90. That was going there 3 days a week. But that doesn't mean it stops. And the obligation that we have, myself as a private citizen, somebody who has lived the experience, and know that we can make this work. We funded many other things. Many other things we funded. And so this to me is a priority. And I implore you and I ask you for the support that's needed to continue and think on that patient who today is hearing from their provider, you need to start dialysis. Chairman Fonseca, Vice Chairman Gittens, Senate President Francis, all the other senators that are present and committee members, the viewing and listening audience, I want to thank you for the opportunity and know that I sit here today to say two things, that my mom's time on this earth was not spent in vain, but it was spent for a day like today to speak on behalf of individuals who went through what she went through. So for that, I thank you.
Thank you very much, Commissioner Flood. You know, I forgot to mention she was my boss when she was a Commissioner of Health. We used to be right here in the legislature, you know, trembling and stuff, giving testimony in front of Senator White and Berry and that posse group. But don't go nowhere, because I'm asking you that in Block 2, we're going to have East End Medical Center, and your expertise is going to be needed. And thank you very much. Thank you very much. Before we go to the Board of Nurse Licensure, I just wanted Dr. Gardner to just put on the record, because you're telling me about this $72,490 that you're paying every 2 weeks. Tell us the rates you having to pay for these nurses, Dr. Gardner. Go ahead and tell us quickly the rates you are paying for the nurses.
We are currently paying $130 an hour for an RN, between $120 and $130 an hour for an RN.
Thank you very much. Next, we will receive testimony from Ms. Penn, the chairwoman of the VI Board of Nurse Licensure, and then we will have a quick lunch break. Ms. Penn, you're recognized for your testimony. Media, please recognize the mic of Ms. Penn. Oh, yes, while we have this time, yes, I'd like to recognize the presence of Javon James, Sr., committee member. Welcome, Senator. Ms. Penn, you're recognized. Please proceed.
Good afternoon. My name is Tanisha Penn. Good afternoon, Honorable Senator Ray Fonseca, Chair of Health, Hospital, and Human Services, Vice Chair Senator Kenny Giddens, Senate President Senator Norval Francis, other committee members, along with all other members of the Senate staff and listening audiences. I am Tanisha Penn, Chairwoman of Virgin Islands Board of Nurse Licensure. Today with me, I have Dr. Brittany Dawson. She is on the St. Croix campus via virtual. Mrs. Carmen Vanterpool Romney, our Executive Director, and Mrs. Joycelyn McFarling, our Operations Director. For decades, nursing boards have been tasked with a unique role of protecting the public, overseeing practices and insurance compliance within its jurisdiction. The Virgin Islands Board of Nurse Licensure was established more than 4 decades ago to do this. As the regulatory organization for nurses and nursing practice, Our mission is to identify and promote policies and standards for nurses and nursing education that would safely guard the practice, the principle, and the discipline. The practice of nursing is governed by the Virgin Islands Nurse Practice Act, Act number 4666, Section 415, Title 3 of Virgin Islands Code, subchapter 4, Section 100. This designates the Virgin Islands Board of Nurse Licensure as the body with regulatory oversight for advanced practice registered nurses, licensed practical nurses, and certified nursing assistants to ensure the healthcare within the territory is provided by safe, competent, and trained providers. The VIBNL is a member of the National Council of State Boards of Nursing. With this membership comes benefits and responsibilities, all of which this board is held to. Here, there are high ethical and professional practices that are considered important for proper licensing of nurses, the improvement of policy, and nursing education. The state nursing boards and other healthcare-related boards operate with a certain level of independence and autonomy from general state agencies responsible for healthcare or public health safety. It should be understood and accepted that it would be a conflict of interest to hire, supervise, and deploy, while being such responsible for vetting, licensing, and professional sanctioning these individuals. The VIBNL, through Title 27 and the Nurse Practice Act, is the only entity in the Virgin Islands with this responsibility. We take our responsibility seriously, and for this responsibility to fall within any other government leadership is a conflict of interest and major safety concern. To reduce the likelihood of conflict, the board, as indicated in the Nurse Practice Act and its rules and regulations, should be the only entity handling its human resources, fiscal, and procurement responsibilities. The law, as it is set forth in Title 27, is quite vague, and it carries much difficulty to many departments. Legally, we have been told the law, as written, may be left up to interpretation. Our goal at the board is to eliminate this concern in the future. To do this, the VIBNL has begun the process of updating our Nurse Practice Act to meet our national regulatory body standards. We will move our laws and our practice, with your support, into the 21st century. Here in the Virgin Islands of the United States, we are looked at on the world stage as behind the times. VIBNL plans, in partnership with other government agencies, to move nurse licensure and its regulations forward, keeping safety and efficiency at the forefront. This board has a unique mission, which is to improve nursing practice in the territory. Bill number 34-0133, sponsored and passed under the 34th legislature by Senator Donna Fred Gregory, Senate President at the time, and Senator Kurt Vealie, Chair of Finance Committee at the time. This act was legislative to provide appropriation for the operating expenses for the board. All of this bill was created to clarify the operations of the board. Inconsistency on the provision on how, where, and when funds are allocated and spent are not inconclusive. Currently, the law is outdated, and VI Title Code needs to be revisited for amendments, making clear the board's power and its duties. Thus, the VIBNL has been plagued with many challenges. These are a few of our challenges. Authorization of the board of its operations and financial duties. The board has been excluded from authorization of the Enterprise Resource Planning System. Due to this misinterpretation of the law as it relates to the function of the board, it encounters a delay in executing contracts, expending funds, approving invoices, requisitions, NOPAs, payrolls, and so forth. It impedes the transparent workflow within the board. Inability to provide testing for nurse assistants consistently. VIBNL lacks training centers which contributes to delays in testing and a backlog of nursing assistant exams. Presently, right now, we have one external proctor who is unavailable. We also have 2 VIBNL staff, which consists of the executive director and the administrative specialist who steps in at times to fill in as proctors. The unavailability of an official standardized testing site makes it difficult to offer regular scheduled examinations for CNAs. It is imperative that the board seeks to secure a site that enables testing based on national standards such as facility requirements, which would include, is not limited to, storage, lockable storage, parking accessibility, separate examination room check-in from the examination room itself. It includes technical requirements, IT, and photo and secure detection and surveillances. Another challenge the board has been having right now is criminal background checks. Is not practical at this time. Any further clarification that's required for this information, we should contact Department of Health of Virgin Islands Police Department. Currently, right now, we have 3 vacant board vacancies. We have 1 nurse educator, 1 licensed practical nurse for St. Thomas, and a consumer vacancy on St. Croix. Staffing, we currently try and continue to do as much as possible within our ceiling, but may be able to contribute more if given a supplemental budget. As nursing expands, so do the requirements for the board's responsibilities. It would be helpful to add 2 additional staff. Additional funding is helpful in addressing barriers and improving board standards while we are attempting to accomplish here in the territory. Our much-needed compliance officer position has been produced, multiple regulatory interventions with licensures within our organization and nurses trying to gain practice authority here. This position was added through a supplementary funding and has sworn itself to be quite viable in nature due to the halt in the personal requisition forms. The board was unable to proceed with the RFP. Applicants, however, were reviewed and screened, and as soon as the RFP is open, we will be interviewing these applicants. The board is looking forward to our meeting with Department of Health that is scheduled for June 12th to discuss any issues or concerns that we may have at that time. I would like to thank all the VIBNL board members and the staff for their hard work and dedication, and I would like to also thank the Committee of Health, Hospitals, and Human Services for allowing us this time to discuss our challenges. If you have any questions, we are open to answer. Thank you.
Thank you very much, Ms. Penn. The Committee on Health, Hospitals, and Human Resources will stand in recess for 20 minutes.
the nature of man. It's the earth man. Rasta man. I listen to the first.
What is a Rasta man? The man we set the plan. The man we touch the street. Love and bless up everyone. No skip a beat, the Rasta man unique. We now go take defeat, the mission not be complete. And through the humble and the meek. My lyrics is my gun. No boy can't tell me no. She rise above the rest. Empress no beg no friend, real empress no bend.
The Committee on Health, Hospital, and Human Services is back in session. Thanks to everybody for all the testimony. As you can see, there's a lot of important issues that's facing the territory, and I just wanted to emphasize the diabetes potential emergency situation, and I think there's a lot of commitment from the government. Yesterday, I had a discussion with the OMB director and also the Senate President, Mr. Francis, and there's commitment to make certain that, first of all, that Dr. Gardner's Center on St. Croix is not closed, and so I think we can work it out. We just need to remember that it's a sense of urgency, because for those patients that have dialysis, that have to be on the dialysis machine, it's a life and death, and if your family is affected with it, or your spouse, then like Commissioner Flood and some of the other testifiers said, who feels it knows it. So what we're going to do is we're going to have a 6-minute round of questions from all the senators, and we're going to be starting with Senator Blyden, then we will go to Senator Francis, Senator Caput, Vice Chairman Gittins, Donna Fred, and Maurice James. Senator Marvin Blyden is not feeling well, and so he's he had to take a little time out. Okay, so Commissioner Encarnacion, I had a couple questions for you that we wanted to follow up on. Okay, regarding the medication buprenorphine, I wanted to have a conversation on how it's going to facilitate doctors prescribing this medication, that drug users, opioid, etc. is going. And also, I wanted your concerns regarding permitting fentanyl drug testing equipment and to decriminalize possession for the testing equipment, because that's a very potent drug. You can lose your life, and right now it's I understand it's illegal. The drug is illegal, but also the testing equipment is illegal, and I think there's movement to permit the testing so that unfortunately it happens and people are using the drug, so we want to make sure that they can test to make sure that it's not some poison. I think the goal is to save lives. So give me your thoughts on those two.
Good afternoon again, everyone. I'll begin, but then I'll also refer it over to Deputy Commissioner Steele. I have to tell you that you did send some query over to the Department of Health. So Dr. Hunt, Dr. Sims, of course, Deputy Commissioner Steele, and his team has already worked on that. It's something that we've been working on for a while. So I'll have DC Steele speak to you about what we're doing in reference to the opioid treatment and preventative measures. We're also, as we sit here, Dr. Sims has been working on developing a process. So to really look at the opioid crisis nationally, I'm pleased to say we haven't had to deal with the opioid crisis locally. We did have some incidences. We had 2 deaths about 2 years ago. And so prevention truly is the best method, but tracking and data collection, as we've established, is one of the ways in which we can actually prevent. So DC Steele, can you speak to the plan?
Yes, good afternoon, Renan Steele, Deputy Commissioner of Public Health. So part of that, we already were discussing for quite some time now the transition of our current OTP program, which is our opioid treatment program. We currently prescribe methadone. The plan has been to transition to newer forms of MAT, meaning that we was going to add buprenorphine and Vivitrol, which is also 2 different forms of treatment, but has shown a lot more significance in far as more success rates with those who receive that form of treatment. So that was already part of the plan when we moved the program from the Harwood over to the current building location, our temporary location in Golden Rock. So we've submitted the request already over to both SAMHSA, Substance Abuse and Mental Health Service Administration, as well as to the DA office to move that program over with the plan of transitioning to newer methods of treatment. So the time was perfect when we had a discussion with your office as well.
Okay, thank you very much. And also, Commissioner, 2 other questions. The Narcan, N-A-R-C-N, being available without a prescription, that's the same thing. It's a nasal spray. Basically, it can help save a life, overdose, and also the naloxone, N-A-L-O-X-O-M-E, which is also can, help, and having that more available. Give me your positions on those 2 as well.
Narcan and naloxone is the same drug. And so it is used to combat the effects of opioid. And so that's one of the drugs that is readily available in EMS. It's also available in VIPD. So DC Steel can also speak to that, as the program that we have allows for distribution of that. So DC Steel?
Yes, Red and Steel Deputy Commissioner. As Commissioner mentioned, we've been actually running about 8-9 months ago. We started working closely with the EMS team, even before the transition out of health, to actually train law enforcement and several other agencies in the Narcan and naloxone treatment. And we actually provided each member who completed training, after that training, received a kit, which actually had 2 nasal sprays and have access to that. The Department of Health also currently has an inventory of Narcan available separate from the EMS team. For when we conduct trainings, we do pass out that. And in our new funding source going forward for our opioid funding through our state opioid response for SAMHSA funding, we are requesting additional Narcan to see if we could get it more widely distributed, to at least make sure every law enforcement vehicle will have the Narcan available in it, in the field.
Okay.
So we've started that process already, sir.
Thank you. Go ahead, Commissioner.
If I may, one of the things that I think we failed to answer is in reference to tracking and what we plan to do. So we do have some funding that we are seeking to get approved for, and that is trying to look at the drug prescription program. And so that's not only going to help us with the opioid problem, but it allow us to really track every prescription that actually is prescribed and how it is. We're also working with hospitals, because it's not just that we're looking at the prescriptions, but we're looking at actually the effects of opioids. So we're asking both hospitals to, as well as the morgue, and that would be DOJ as well, to help us track any deaths, any illnesses as a result of the possibility of an overdose.
Okay, one final follow-up question. I noticed that it's available without a prescription in certain jurisdictions. Is that the case in the Virgin Islands?
Not so. It requires an act for it to be non-prescriptive, and so that's something that we can work with your office on.
Yes, please. I'll be very interested, because this medication, it rapidly reverses the effects of opioid overdose, and it's a standard treatment for opioid overdose.
If I may also to add to that, our acting director, our director of regulatory, Jackie, she is also working with that. So she actually does a lot of education on that as well, and our EMS team. So it would be Director Greenwich as well as Assistant Director Lyle Evelyn. That's as a team, and we work very cohesively together to make sure that that process is being followed.
Thank you, Commissioner. Senator Blyden, you're recognized for your 6 minutes.
Thank you. Thank you so much, Mr. Chair. Good afternoon to my colleagues, the viewing listening audiences, staff, central staff, and good afternoon to all of the testifiers, and thank you so much for your testimonies. I want to start by saying who feels it definitely knows it. And the tour we did this weekend on Isle of St. Croix, it really was an eye-opener for me. I must say that I'm put on the record, based on the testimony, the $40 million we spent after the hurricane for 1 year. I remember going to Atlanta and doing that tour at that time for those individuals from the territory who were at different hospitals. And it's important that we remember, what's the cost of one life? What's the worth of one's life? And to make a one-time investment in our people, to me, it's priceless. It really don't matter to me. We support a lot of different initiatives, a lot of different investments, etc. But one life is the most important investment that one can make. And I must say that to make this investment, to me, is a lifeline on behalf of our people. And one thing that we need to talk more of, though, is preventative measures in respect to those who are on the borderline going on dialysis. We need to find a way to really work on behalf of our people and try to basically spread information to assist those individuals. I think that's another area we really need to dive into. But nonetheless, definitely I will work with my colleague to do what is possible to assure that we keep our people here in the territory, especially with the modulars we have here right now. If we are supposed to have some type of emergency in the near future, they will not be able to sustain our people. So we have something in place. We heard from the individuals, and I believe it is the right thing to do on behalf of our people. Let me ask, in respect to preventative programs, Commissioner Encarnacion, can you speak briefly about what are we doing in terms of from the health standpoint to assist?
Mm-hmm. Thank you, Senator. I was kind of hoping I was able to do that. Our chronic disease unit actually works a lot on prevention, and as I reported, diabetes is one of the high priority areas that we have. Hypertension is as well. But let's go a little further. MCH also works on preventing hypertension from an early age, because diabetes, the number of the data collected in diabetes as well as hypertension shows that it actually occurring at a younger age more and more. A lot of it is because of what we eat. And so MCH works on educating individuals as to what are the best foods to eat, exercise. But we'll continue to do that. I'm not quite sure if Dr. Fredericks is on the line, but she could speak to you about the program. So we actually have a diabetic teaching program that goes throughout the year.
3 minutes.
And it allows us to be able to do prevention. I have to say, though, that a lot of the dialysis centers also offer preventative measures that we need to be able to push. So that's something that will continue.
Okay, thank you for that. That's important. I know for the Board of Licensure, the Nurse of Board Licensure, I know at the end of your testimony, you referred to a lapse in quorum. What is the status of the board membership and quorum? And what discussions has been had with the Office of the Governor about filling your vacancies?
Thank you, Senator. Presently now, we have quorum. We're just stating that we have 3 extra vacancies. We have 5 members that meets the quorum status, but we have 3 vacancies that's still open.
Oh, just 3 vacancies?
Yeah, 3 vacancies that are open, but we have established quorum.
From which district?
The nurse educator, that can be either St. Croix or St. Thomas. The LPN St. Thomas, and consumer vacancy on St. Croix.
Okay, thank you for that.
Okay, you're welcome.
And let me speak to Dr. Gardner quickly on the other facility. Good day, Dr. Gardner. Let me ask you briefly in respect to your facility. If you were to close that facility in the near future, what would that mean for many of your patients in respect to some of those that are on the borderline, etc., and some of those you spoke to us about in terms of
1 minute,
4 times a week, 4 hours, 3 times a week, 4 hours a day. It's like going on a plane. I never thought about it that way. Like going on a plane 3 times a week, and the drain that is caused on these individuals, and it's not simple. Can you speak briefly about that, please, so folks can see the other side of what really goes on at the center?
Could you please repeat that, please? I did not
30
quite get it.
seconds.
I asked, in respect to just give a brief example of those individuals who go through the center 3 times a week, 4 hours a day. It's like going on a plane trip, and the drainage on one's body, etc. Briefly. You didn't get my question?
I heard your question. I'm still not so sure I got it.
Please hold the time for
Time.
Senator Blyden.
Time.
You may proceed, sir. Okay. Go ahead, Dr. Gardner.
Each patient's duration on dialysis machine is individualized based on the and several different factors. The 4 hours 3 times a week is close to the maximum, generally speaking. That is the amount of time it takes to get an adequate treatment on hemodialysis. And it's, like I said, it's a function of several factors.
Yeah, thank you very much.
Senator Fonseca.
Yes.
This is Commissioner Encarnacion.
Oh, go ahead, Commissioner.
If I may, I think it's important for me to stay on the record that I am also a member of the territorial board of the hospital, and it's important to note that we have actually been working diligently to solve this issue, speaking to all entities involved. And as Dr. Gardner has indicated, the conversations have been had between both hospitals as well as his entity. And so we are looking at that. The board meets again tonight, and we are going into special session to just discuss just this. So the community needs to know it's something that's being addressed and taken very seriously.
Thank you very much, Senator Blythe. You know, I want to just follow up on the question of Vice President. You're seeing a bad trend in the Virgin Islands. Dr. Gardner talked about it was originally 20 patients, you know, back about 20 years ago. And now we have, I don't know how much, it's over 100, but our population is less than it was 20 years ago. So it means that, you know, like you were talking about, Commissioner, the prevention, I think we have to, we have to take it seriously, because diabetes, and this was my first time ever seeing a diabetes chair. And trust me, a dialysis chair, trust me, I don't want to sit in that chair. And I'm sure none of us want to either. So, Dr. Gardner, if you may, can you tell us some of the issues and some of the symptoms and the lifestyle changes that we as a community need to adopt so that we wouldn't be in one of those dialysis chair or minimize the risk?
Yes, we at CKC has what we call CKC for CKD. CKC being the clinic.
Can you speak into the mic? We can't hear you.
Pardon me?
Speak into the mic. We couldn't hear you.
Okay. At CKC, we have a CKD program. CKD is for chronic kidney disease. Those are the patients who are not yet requiring dialysis because they still have some modicum of renal function, but that have evidence of kidney damage and kidney disease. Our focus is on, first of all, early diagnosis of those patients, and we try to encourage as many practitioners in the community to encourage early referrals to the nephrologist so that they can get into the program and we can start making measures that would at least attenuate, postpone the need for dialysis, if not completely eliminate the need for dialysis.
Thank you very much, Dr. Gardner. Senator Potter, you're recognized for your 6 minutes.
Thank you very much, Mr. Chair. Good afternoon, colleagues. Special good afternoon to the healthcare professionals who are here before us today and on the island of St. Croix. This is definitely a very important discussion, a very important issue that we're discussing today. I think we're all aware of individuals who are impacted by kidney disease one way or the other. My father, in the last stage of his life, he started taking dialysis. He was in his 80s for the first time. It just happened. And I had an opportunity to go to the hospital for the first time in my whole life at the dialysis ward. And it was just amazing to see the number of persons who were on dialysis in the territory. So it's something that's very serious and that warrants our attention, our sustained attention. I wanted to ask Commissioner Encarnacion whether or not, and I know you're on the hospital board, Commissioner, and you said that this is something that you're going to be prioritizing in your next meeting. But as the Commissioner of Health, is there a role that you would normally just play outside of being on the board to ensure that we have dialysis facilities here in the territory to meet the needs of the community? How does that?
Besides the certificate of need, which of course has already been signed, Dr. Gardner has one. Obviously, he has one for St. Croix St. Thomas. The nonprofit that is being spoken of also has a certificate of need as a result of the Department of Health. Outside of being the Commissioner of Health, many may not know I used to direct dialysis at the hospital, so I'm very aware of dialysis. I also worked with Dr. Gardner, worked with Dr. Tawakal and Dr. Khan, and all of the dialysis patients. I was there when CMS was thinking of pulling the certification and was able to help to regain full certification for the dialysis team. So I'm very involved in it. I've kept I think the first crisis that I had to deal with as a commissioner, it was to assist Dr. Gardner in maintaining staff. And then when COVID hit, most recently, Dr. Gardner was supported also. So I continue to support him and his team. I advocate for dialysis practices in the board as the Commissioner of Health, as a community member. My mother was on dialysis. My sister was on dialysis. So it impacts me. It impacts every one of us. So I have listened and I have been quiet, but I am very involved in the whole process.
Thank you for that, Commissioner.
3 minutes.
Just in terms of outreach and things that we can do as a community to put a dent on this, where diabetes and kidney disease is trending in a negative direction here in the territory. I was thinking about, and as you mentioned earlier, we're getting younger, we're seeing younger and younger type 2, I believe, diabetes patients or people who are pre-diabetic at an earlier age. Is there something that can be done, like, for example, identifying school-age children in the public schools and tracking them and providing the education at an early age, so that we can, as you mentioned, focus on the prevention side of things to avoid such a very cruel and deadly disease that is really ravaging this community?
I have to tell you that chronic disease promotion, health promotion, disease prevention, that bureau in and of itself, like we said, is one of our more productive areas in reference to outreach. So one of the things that we did last year, and I'm sure we're going to repeat it this year, is just teaching children how to eat better. And so there was a series of video shows that we actually had teaching parents how to cook in a different way. Our WIC program does that as well. Every time I go up to the WIC table, they give me a plate to look at. And, okay, Commissioner Henderson, this is tell me how you eat. So it's teaching, a lot of teaching, and we do that a lot. Spoke to our new Director of Communications, who I'm very proud of. How can we speak to the radio again? How can we get back on the radio? Dr. Linnea Fredericks, she's doing a tremendous job with chronic disease, and really and truly is all about prevention. One of the other things that we've spoken about and will continue to speak about is community outreach workers or community health workers. If I may? So we actually, this week, we actually have a summit focusing on community health workers. And the reason why is that in order for us to really look at the determinants of health, we have to get into the homes, we have to get into the community. And so right now we have 5 certified community health workers within the territory. We're growing it. We got a grant just to do that. So we have to, sometimes you say you have to go back to go forward.
30 seconds.
Well, I'm sure when many of us were a lot younger, we saw a lot more nurses and nurses' aid into the community. So that's really what we're doing. It even works with behavioral health. We have outreach workers with behavioral health. And let me go there also. It is a behavioral health issue because we have to change. We have to make changes. And in order to do that, you have to think of how you're going to have that behavioral change occur.
Thank you very much, Commissioner. I wanted to ask Dr. Khan and Ms. Salim about the nature, if I may, Mr. Chair, about the nature of the discussions with the Office of Management and Budget. You indicated that there was a commitment to granting you, I think, initially $1 million from ARPA funding to cover the initial renovations. I think you said that you were 95% completed with the renovations of the new dialysis facility, and you need additional funding, and there was a commitment to giving you additional funding, but nothing seems to be happening right now. Can you share with me what the latest communication with the Office of Management and Budget has been? And I mean, that's the question. And where are we with the negotiations? Or not the negotiations, where are we with the, just the whole discussions of you receiving the additional funding?
Thank you, Senator, for asking. Amina Salim. We had sent in, our first application was in November of 2021. And when we got that, we got the award in November of 2021, and we didn't get the money until March of 2022. And we got our first $1 million. And we with what we had done, we put this whole unit together. It is the former Board of Elections, if everyone wants to know, in Sunny Isles. And so we had to renovate the entire building, not only just renovate, but because it's going to be a dialysis unit, we had to have special firewalls put in. We had to have, which were not there before, we had to dig up the entire floor and put in new piping and for the water and for the sewage, so we could have that. We had to put in new walls for the electrical. So a lot of things you don't see are underground and behind the walls. We also had to get the water system. But one of the big things that happened is that because of the delay in getting money and COVID, prices went up. So by the time we started buying things, they were a lot more expensive. And because of the cost of shipping, it brought up our prices, the cost even more than we thought. It is what we thought might be maybe a $2 million project is actually a $4 million project when you come and see what it is. So we went back and asked for another $1 million from the ARPA funds, and ARPA funds were made for just this, to make sure there are facilities in case there's COVID, you have another place to send people. If you could put on another shift if necessary, if there was an outbreak of COVID in one dialysis unit and they needed somewhere else to send people, you could work together and do that. And so we were told, the government did say that we could get the $1 million, but when we put our application into OMB, we were told that we could not get the money for the operations, and operations are operational funding, because we have to hire staff, we have to buy medicine, we have to buy all of the medical equipment and things that we need, the small things. And when we have new patients coming in, our first set of new patients, we have to transfer them from their medical, wherever they're doing in, if they have medical insurance, or if they have Medicare, if they have Medicaid, it's a transfer. It's going to take about 6 months for all that paperwork to be completed and the transfers. So we're not going to be getting any income in. And so we've been advised by our partner that it's best to have the money up front. So we were told by OMB that we could not get the operational funds, and we had to go back and give them quotes on everything we had to purchase. We submitted that in. We submitted all the quotes that needed to be coming. And then the other problem we had is the water. We use from 5,000 to 8,000 gallons of water a day. And we're using WAPA water. And the WAPA water comes in brown. And we have pictures of that, and they could show you that the WAPA water is brown. We went to WAPA and they said that there's nothing they could do, that's the pipes. And so we can't, it's gonna take another year and a half before they change out the pipes. So now we have to filter this water about 2 to 3 times before we can even bring it into the dialysis unit. And so that's an expense we didn't expect either. So now we have asked for $941,479, and we still cannot get an answer from O&B. Each time they delay us, we're still paying rent, and each time they delay us, they delay the chance of us being able to supply this type of service to the community.
Thanks, Ms. Salim. So you're just basically waiting. You've done everything that you need to do on your end, and you're waiting for the Office of Management and Budget to respond.
We're waiting for them.
Okay. Thank you very much. Thank you very much for the leeway, Mr. Chair.
Thank you, Senator Potter. Senator Maurice James, you're recognized for your point of inquiry.
Thank you, Mr. Chairman, and good afternoon to everyone. I want to ask Commissioner of Health or Dr. Gardner or Dr. Khan to provide me with an answer that's of concern to me with respect to a statement that I read, listened to, and then reread in Dr. Gardner's testimony, where he says that the ESRD population of either island is not enough to support more than one facility profitably, which to me, inherent in that sentence is that the government at some point has to subsidize dialysis treatment. And I know we're here talking about prevention and of course we know an ounce of prevention is worth a pound of cure, but right now we're talking about treatment. We're facing a crisis, and that's what I think we need to really try to address this afternoon. I know negotiations are going on. I was also on the Territorial Hospital Board, but if that is the case, Commissioner of Health or any one of you, are we saying here that it's inevitable that the government of the Virgin Islands would have to subsidize dialysis treatment in the Virgin Islands?
I'd like to start, if I may.
Yes, you may, Commissioner.
Okay, thank you for that, Senator James, that question. Whenever it comes to a crisis situation, the government takes over, especially in reference to healthcare. So the answer to your question is, if we have to subsidize because there are no other options, then it becomes a public health crisis, and the government will have to subsidize in order to save lives.
My question is more than stabilizing. It's actually also beyond stabilizing. It goes to long term. Okay, thank you.
Let me try to answer that for you. I stand by my statement. Having been in the business here in the Virgin Islands for the last 20 years, we are being, first of all, the majority of dialysis patients' care is being paid for through Medicare. The Medicare reimbursement rate has not changed substantially in years. In the meantime, we've had changes in cost, which I would be happy to enumerate for you in a few minutes. But first of all, we have to remember that we're insular. This is an island. Everything has to be brought in here. Prior to me coming here, I was in Nashville. Shipping, supply cost, freight cost in Nashville compared to freight cost here. The freight cost here is 4 times what it used to be any place in the United States. Okay. Electricity in Nashville, the kilowatt hours is about 12 to 13 cents per kilowatt hours. Here it's more than 50 cents, probably even 60 cents an hour. We have challenges staffing-wise that are incredible, and that's what we're facing predominantly right now.
3 minutes.
I'm sorry. In the sense that even before before COVID, we had to seek to bring travel nurses in from states just to staff our facility. There were not enough nurses on the island, dialysis trained or willing to be trained to provide dialysis services. That meant our labor cost was higher than it would be in the state. All that has to be subsidized or paid for by a meager Medicare charge that is the same here as it is in the States, so that we start from behind the 8 ball to begin with. This is so that the 20 years, we spent years we've been in the business, has been skimping. People get the impression that we're making mucho money. There is not very much margin in dialysis, period. That we've survived, quite honestly, with the modicum of success that we've had, has been a challenge. Now, so it's my opinion that if there were one facility, right now there are, let's say, 120 patients on St. Croix and about the same amount at St. Thomas. With that volume of patients and the current situation with creative management, we can probably eke a profit. With less than that, you're not going to. So that if you have 2 facilities or more than 2 facilities on either island, neither facility is going to have enough business to carry itself, which is consistent with your suspicion that forever dialysis will be subsidized by the government. And when you look at the fact that the patient population is not decreasing, but instead increasing, that emphasizes the point even further. So yes.
Thank you very much, Dr. Gardner. Senator James, that answered your question?
Mr. Chairman, Dr. Khan from the other entity would like to reply also.
Yes, go ahead, Dr. Khan, you may proceed.
30 seconds.
Thank you, Senators. Yes, I concur with Dr. Gardner on the certain aspects of his response, and most of it actually, when Medicare reimbursement hasn't changed, the cost of giving care has increased. When we were working at the hospital, and the hospital was under a systems improvement agreement with the interim manager placed by CMS to get them out of the 10 level violations, one of the key things that we focused in on was a $7 million deficit annually when it comes to providing dialysis. And they did a root cause analysis and found that they could bring that loss, it's still a loss of care, but bring it down to about $1 million, $1.5 million, because they were able to renegotiate some of the rates. Part of the problem of doing dialysis in a hospital is you cannot negotiate rates as an outpatient facility. So the rates that were negotiated for the hospital entity are much higher. I agree also that the cost of shipment here is very, very high. You have to pay, FedEx we consider it international here. So a lot of the labs that go from here to stateside go as FedEx, and that's very high cost. Supplies come here in a timely fashion, can't depend on postal service or shipments. So they have to come by overnight. Those are all high costs. One of the things that's one of the biggest reasons that we chose to partner with a non-for-profit is 3 things. One is that they are a very large 250-unit entity. They order everything in bulk. So bulk medication, bulk supplies, bulk shipping, all of those reduce the cost of providing care to the community. Secondly is that the labs that usually are sent off island are sent off island from here all the way to California or Florida to be processed. If DCI brings their lab down here, that cost of shipping will go down. So we have looked at the cost analysis. We've done our pro forma due diligence, and I'm happy to share those numbers with you, because when we do our pro forma, we think that with 78 patients, we can become sustainable. And once we have the upfront costs of operating and getting through that CMS lag time of getting reimbursed by CMS, that we will be sustainable as we go forward. The third thing that I want to add to the discussion is that, yes, right now we only have 110 patients on the island. This is going to grow dramatically because our ESRD population is growing dramatically. I have 15 to 20 patients right now who are on dialysis stateside who want to come home. I have about 15 to 20 patients in the CKD clinic, I'm sure Dr. Gardner has the same amount, that are hovering on the fence of needing to start dialysis but waiting. And there are many, many, many patients who are at CKD 3, 4, and 5. And the nature of kidney disease is that it is progressive. Preventative care should happen at the very beginning of diagnosis of diabetes and hypertension. So if you control those chronic diseases, you limit the amount of damage that those diseases cause to the organs. Once that damage is set in, it is a progressive decline. All we can hope to achieve by doing preventative care in those scenarios is to slow down the progression of kidney disease, to allow time to prepare the patient adequately, to start dialysis in a non-catastrophic setting where they're planned, and that their risk of morbidity and mortality is reduced by not doing emergent care, by doing planned outpatient care and avoiding hospitalization at all costs. That's the whole point of having an access in place, or going to transplantation, or if they're stateside, going to peritoneal dialysis. Those are the preventative measures when it comes to CKD. The other preventative measure once they're on dialysis is to prevent damage of diabetes and hypertension to the rest of the body. Even though the kidneys are dead, literally dead, the other organs must be saved for quality of life, to reduce morbidity and mortality. So stroke prevention, heart attack prevention, loss of limb from amputations, loss of sight from blindness. These are all comorbidities, part and parcel of the pandemic of diabetes and hypertension on the island. So there's a lot of work to do, and unfortunately the incidence is so high that both units will be very, very full very quickly. And the hospital can no longer afford to take the brunt of this burden because they show up catastrophically in the emergency room and then have to be placed on dialysis. I hope that answers the question.
Thank you very much, Dr. Ken.
Thank you, Mr. Chair.
Yes,
Not good news, but thank you.
Yes, and Madam Clerk, Senator James is not charged. Her time, she is still. That was a point of inquiry. It's real important, the prevention, because you heard the testimony of Dr. Khan and Dr. Gardner. And I can see that the commissioner, she is following it. You can look at her BMI, that she is in good shape. So the listening audience, when you get them triple burger with the macaroni and the extra cheese, that equal diabetes. So we wanna prevent that, because you hear the numbers, 110 on St. Croix, and Dr. Gardner said about 120 on St. Thomas. That's 230 persons in our community that have this illness. That's very, very high. Next, Senate President Norvel Francis, you're recognized for your 6 minutes, Mr. President.
Thank you very much, Mr. Chair, and good afternoon to everyone. First of all, I want to just get notice that former Senator Hugo Dennis has passed away today. So on behalf of the 35th Legislature of the Virgin Islands, I'd like to offer his family our deepest condolences, and certainly we'll be doing a more official statement at the appropriate time. Additionally, I also want to commend the Board of Nurse Licensure for opening the St. Croix office yesterday. Sorry I missed that event, but I look forward to visiting that facility, and thank you for being able to get that completed. So today I also want to thank all of our healthcare providers that's here and really discussing this whole issue of dialysis, and also to thank the patient advocate and all those stakeholders that really participate in this whole dialysis issue. From what I've heard is that we have a crisis. And I'm hoping that via this conversation today that we'll be able to have and be able to make some inroads in terms of what we can do collectively to be able to address the crisis that we're seeing here. For me, sitting here, I don't believe that the discussion of the closure of the CKC is an option. I truly believe that there is opportunity for the entities to coexist, and those are the opportunities that I would love for us to be able to discuss, because we all agree that we're in crisis. And from what I'm hearing, this crisis is magnified by the fact that we lack the medical providers, we lack the medical staff to be able to support these facilities. So whether if it's Wang Louis Hospital, Roy Lester Snyder Hospital, the DCI, or the CKC, we're still in the same quandary because there's a national crisis as it pertains to having medical staff to address this issue. Commissioner Encarnacion, do we have a dialysis registry in the Virgin Islands?
No, we don't. We are beginning conversations in terms of a diabetes registry, which of course is a precursor, as many of as the physicians have actually indicated, could be one of the reasons why we have the number of dialysis patients we have within a territory. So that's the first start. But in terms of a dialysis registry, no. I have to say that the social workers I know from both areas ensure that we have tracking systems of everyone, especially as a result of the hurricanes in the past and them having to leave the territory. So we have a list of those. Just to let you know, I do have Dr. Linnea Frederick. She is online, so if there's any conversation needs to have in terms of what we do in terms of screening and preventive care, or preventive screening issues that we're seeing right now and what we need to do. She's here and she's willing to speak to that as well.
Very well. I think it's important. Are we mining any data or having any conversation in respect to mortality associated with dialysis? Are we tracking any association in that space?
Not at this point. We do have the registries that we have right now. Of course, is our vaccine, our immunization registry, as well as our cancer registry. And what we do, and Dr. Fredericks, you can speak to this as well, is our breakfast actually looks at the number of renal insufficiency that we see throughout the territory. But that is it's a data collected from the community itself. We can sit down and speak about what we need to do differently. Dr. Fredericks, if you're online, Senator, if I may have her speak to this.
Yes, you may. Dr. Fredericks, you can go ahead.
Good afternoon, everyone. I'm Linnea Fredericks, Director of Chronic Disease at the Department of Health. And one of the things that we are focusing on to prevent diabetes complications, which leads to dialysis, we are focusing heavily on the prevention piece as stated. So we have a number of self-management programs that we enroll persons in. They last from 6 weeks up to a year. Those programs are specific to prevention and management of diabetes to prevent further complications. As far as tracking and surveillance, as Commissioner stated, we have the behavioral risk factor surveillance system. However, that's self-reported, so participants are randomly selected and are asked if they have ever been diagnosed with certain chronic diseases such as diabetes, kidney failure, etc. So those are what we have in place currently.
Thank you very much for that. And Commissioner, in regards to the behind-the-scenes conversation that's being had in respect to the crisis that we're discussing here today, and I know that you said that there was a follow-up board meeting today, later on, either today or tomorrow. But what is the level of reassurance that you could give both, CDC, the DCI, as well as Dr. Gardner, and the patients, of course, in respect to what's happening in this space of crisis that's being discussed here today?
The board meeting is actually tonight, and we actually are looking at what we need to do in reference to the government itself, where we are, what we need to do. I have to tell you that I actually, when I did a review, AC Malloy and we did a walkthrough with the dialysis center.
30 seconds.
I've been at dialysis center up by CKC already, have conversations with him. So we are taking this very seriously, Senator. I cannot tell you what the result of the meeting is going to be tonight. I could tell you that I'm in full support of ensuring that dialysis services are provided continuously and there's no break in service. It goes back to Senator James's question, what is the government's responsibility if the crisis actually does ensue? And really and truly, what it says, if I may complete, it actually says that if we have to transfer patients off island to receive dialysis care, then that actually is going to go towards the Department of Health and the government in terms of the cost. So besides the cost, because the cost is something that we have to look at, but we also have to look at the care, we have to look at the family members and what it's going to do to actually send family members off island. That's one of the things that happened after the hurricanes. Individuals went off island and some individuals died, not just because they were on dialysis, but because they didn't have the support care, and sometimes that has a big effect on your wellness and on your healing. So there's a lot to be considered here at this point in time, and they have my support. I advocate strongly in the board, and I'll continue to do so. I'm looking forward to the conversation this morning because I know it's going to be a very high-level discussion that we're going to have.
Very well. Thank you very much, Commissioner. Mr. Chair, for the time, I wanted to conclude by stating that I don't know where the conversation is coming from regarding the ARPA money and that this body could authorize ARPA funding. The administration have made it clear that the legislature don't control the ARPA money. So certainly we have been pushing to interject ourselves to make sure that the ARPA money really is spent where we see the need for it as a collective body. But as I stand right now, I don't think that you want the finger pointing, but this body don't have any control over the ARPA money as it stands right now. All right? So I don't want that misinformation to get out there. We don't have any authority or authorization over the ARPA funds. Thank you very much, Mr. Chair, for the time.
Thank you much, President Francis. Real quickly, before I go to Senator Diane Capehart, Commissioner Encarnacion, the regional director, Ms. Darak Haas, I think from HRSA, was here visiting the territory recently. How are the preliminary reports and findings?
Her name is Director Darak Haas. She's actually the Region 2 Director of Health and Human Services, which is awesome. I have to say that she and Dr. Hunt developed a really good relationship because of COVID. She was very pleased. I have to tell you that Senator Francis, she was completely overwhelmed with the fact that all of the senators were available and listened to what she had to say, and she really wanted to listen herself as to what she thought and what we were doing here within health. What her last statement was is that she felt as though that we have a good handle of what our needs are. So part of what she came here for is to find out what our needs were and how we actually expand upon our needs and how we can actually fill the gaps in our needs, not from a physiological standpoint, a psychological standpoint. What can they do from a federal point of view to enhance? We spoke about grants and why grants are the way they are right now. Of course, the USVI, as well as a lot of the very, very small states and the Pacific Islands, we suffer because of the number of people that we have, the population within our territories. And so because of that, we're trying to change the way that they're weighing the grants and see how we can get more funding with our grants. One of the things that we discuss is in reference to behavioral health. If you look at the Pacific Islands, they have 100,000 in several of their Pacific Islands. We have close to that, but they have triple the amount of staff working in the behavioral health unit, as we learned when we visited, and we had a really cohesive, very in-depth conversation with Region 2 and Region, I think it's 17, Region 7? Region 9, my apologies. And that is the Pacific Island. So Puerto Rico, USVI, and all of the Pacific Islands got together about a month ago in D.C. And the Assistant Secretary of SAMHSA, who is from Haiti, spoke to us, and she really garnered support. How can we look and how can we think differently from a behavioral health aspect? And both individuals provided their strong support for what we need to do and how we can do things differently.
Thank you very much. That's good news. And of course, I'm very pleased with the entire Department of Health staff and organization. We've had several meetings, and the staff is very competent. There is excellent leadership, Commissioner. I want to just go back to what the President said. I think we do have a dialysis emergency in the Virgin Islands, and so we need to make sure that it doesn't get worse by the Caribbean Kidney Center potentially closing, because we're on notice now that if we cannot address those issues, that $72,492 every 2 weeks, that he cannot continue operations. So we have our work cut out for us, and we need to make sure that that does not happen. Senator Diane Capehart, you're recognized for your 6 minutes.
Thank you, Mr. Chair, and good afternoon, colleagues. Good afternoon, testifiers. Good afternoon to the people of the Virgin Islands. First, Mr. Chair, I'd like to thank you for hosting that tour this weekend, where this body had the opportunity to understand the challenges with this humanitarian crisis that we face on the islands. This is a critical need that we need to address now. Mr. Rivera, your testimony today, the testimony today from Ms. Vivian Flood. I've been in this legislature for 6 months, and this is the first testimony that brought water to my eyes, because this is a community that we can do better. Yes, we can do better. So when Ms. Salim talked about 5,000 to 8,000 gallons of water you need per day, and then I hear Dr. Khan talk about the quality of water. So one of my questions today is, if Water and Power Water Division doesn't even say water goes out, what does that mean? Do you have a backup water supply? How do you deal with an emergency like that?
Yes. Good afternoon, Angel Rivera here. Being a member of the team dealing with that situation, when we realized that problem with the WAPA water, we already had a plan in place when we initially started planning for the dialysis unit. And it was WAPA is our primary source, and we have access to the cistern where we at. It's over 51,000 gallons in the cistern that we have access to. That was our secondary backup. When we saw the conditions of the WAPA water, the orange color, we realized we had to do something. So we came up with a plan we're gonna have a capacity of 9,000 gallons. That's an extra space we have to be leased to store those tanks, and also a filtration system. It's called a media filtration system, with also a cartridge filter at the end to capture whatever particles that's coming out. With these tanks of 9,000 gallons, now we control the water. It's costing more because now that water we have to pay WAPA for the water, still have to clean it, still have to pay for the power for the pumps, the additional storage space, and then get that water into the unit itself to then be filtered through the reverse osmosis system.
Okay, Mr. Rivera, so cut costs, can you not use just the cistern water alone and use WAPA as your backup?
No, it will not be sustainable. The amount of water we're using, the system will be depleted very quickly.
Okay.
And then also the landlord would not allow us to dump water into their cistern. A couple reasons. The other tenants that use that water also, if we dump the water and the tenant uses up the water, who can we complain to? Because we put in the water there, and whoever else uses it, it still belongs to the landlord. Part of the backup system is that we have the location of where this additional spaces and the tanks are. We have access to park a water truck, a water tanker right outside the building to constantly keep our water. So we have a triple redundancy system to protect our system. We know WAPA is not reliable, so we have to devise a system so that we can be sustainable.
Okay, thank you, Mr. Rivera. I wanted to ask, in a testimony, I don't know who it was, said they are waiting to be placed on dialysis. How many people are waiting to be placed on dialysis?
Good afternoon, this is Dr. Khan. Yes, that testimony was part of my testimony, and there are people who are already on dialysis stateside who want to come home. The only reason they are stateside is because of the reduced capacity to provide that treatment here to keep them alive and for them to come home. So that's one population. The other population are those patients who are at CKD stage 4, which is chronic kidney disease stage 4 or 5, that is less than 25% kidney function at stage 4 and less than 15% kidney function at stage 5. Those patients, there are about at least, I would say at least about 15 at stage 5 CKD, and there are more at stage 4 CKD. So it's a matter of time before they all head towards stage 5.
Okay, thank you. Well, I just wanted to ask also the renegotiation of the Medicare rate.
30 seconds.
How can we revisit this with CMS? Because I think the cost of medication and supplies and the increase of labor and all of these things that factor in, I think there needs to be some renegotiations, conversations again with Medicare to say there's a need to renegotiate the Medicare rate.
Time.
So I just wanted, Mr. Chair, if I may.
Yes, you may
conclude. I just wanted to say that this is very important that we have discussions with Medicare to talk about that increase of that rate. And also just to even bring some memories as Hurricane Hugo. If we all remember Hurricane Hugo, we faced these same challenges. And now we had Irma and Maria. My colleagues, we are in hurricane season again. We don't want to revisit this. So this life-saving procedure that is so important, we need to address this ASAP. Thank you, Mr. Chair.
Thank you, Senator Caput. Majority Leader and Vice Chair of Health Hospitals Committee, Senator Gittins. You're recognized for your 6 minutes, Vice Chair.
Thank you, Mr. Chair, and good afternoon to all. I hope I don't get in trouble today, because usually when I open my mouth, I don't get in trouble. But I must give kudos to my big sister and my big brother here, who spoke, whereas the former Commissioner Flood, that is, said that patients first. I wholeheartedly agree with the Senate President when he said the closing of CKC is not an option. Where will our people go for help? As we sit here, I think I heard one of the response said, although we only have 100 and something people, only, that's a lot. That's a lot. All it takes is for you to lose one loved one. And we know the position that we can be in. As I sit here, having this discussion, because I wanted to ask some other questions to the Department of Health, especially since we're in the hurricane season and whatnot, and getting more operational stuff. But as I sit here and I hear this conversation, I am sickened to my stomach. Because we shouldn't have to be here wondering whether or not we're going to assist in keeping the Caribbean Kidney Center open. If this government could take $45 million outside of legislative authority to give this criminal entity, I continue to call it WAPA, if they could give them that $45 million outside of our authority, Why they can't help our people keep these doors open? Tell me. When they're done, they're telling us that the buyout agreement is confidential. Confidential, my behind. I want those documents, and I am serious about it. And by the hook or the crook, my colleagues, I need them to stand with me on this. And everything that I can do with every breath that I have in me, we're going to ensure that the people of this territory is taken care of. Knock on wood, thank God, those of us, except you, sir, I apologize, but most of us in here right now don't need dialysis. But what could happen tomorrow? What could happen tomorrow? Let's get serious. And I'm saying if we had that $45 million sitting aside, that we could have moved just like that, then we could assist our people. It's a crying shame. It's a crying shame. And I could care less who upset with me. This administration fired the Commissioner of Finance, not this last one, the one before. You remember that? Well, let me see if somebody gonna go home now for this $45 million. Yes, it's in my craw. Because we could use these funds for things like this. We shouldn't be here pondering. And I'm gonna watch it closely as we move through this budget season. Put the money where your mouth is and ensure that our people are taken care of. Every minute, every time you look, our people are traveling.
1 minute.
You go to Cleveland Clinic, you think you're in the Virgin Islands. Yes, me too. But we could be the Cleveland Clinic of the Caribbean if we invest in home. Instead of continuously sending our money elsewhere.
30 seconds.
Keep the 30 seconds. Take care of our people. That's what I'm saying. Thank you, Mr. Chair.
Senator Fonseca?
Yes.
Is Commissioner Encarnacion?
Yes, go ahead,
I just needed to
Commissioner.
let you know that there are several members of my team that needs to leave to go back to St. Croix, so they will be leaving in a few moments.
Yes, thank you. They did inform me. And thank you very much, Mr. Vice Chair, because, yes, WAPA got that $45 million, and there was testimony today that after Hurricane Irma and Maria, the federal government paid $40 million for 1 year to evacuate these dialysis patients. So, and I ask you, what is the price of one life? We are in a dialysis emergency, and we cannot let that center close. We must keep those 62 patients that are receiving treatment on the regimen right now. And thank you very much, Madam Donna Fred Gregory. Senator Donna Fred Gregory, you're recognized for your 6 minutes.
Thank you, Senator Fonseca, and good afternoon to the testifiers, and good afternoon to my colleagues, and of course to the wider audience that's listening and viewing today. I've listened to the conversation as it relates to what's occurring in our healthcare system. And I believe that it sounds good and it briefs well for us to talk about what's happening in the Virgin Islands, but it's time for action, okay? So we listen to the sound bites and we hear ourselves talking, but this conversation is in fact not a new conversation. Do you agree, Commissioner Encarnacion?
Yeah, it's been
So,
a long
Commissioner
conversation.
Encarnacion, I'm going to ask you this question because we are central focused this afternoon on dialysis care throughout the territory. But we must acknowledge that the issues that we have are not only centered around dialysis care. We have healthcare issues in the Virgin Islands. So I'm going to ask you, Commissioner, because I think it's time for us to establish some sort of a think tank. We have to get there. We cannot keep talking amongst ourselves with regards to the challenges that we have with healthcare in the Virgin Islands. So let me ask you, from your perspective and from the work that you do with your team, what is truly the state of healthcare in the Virgin Islands? And have you developed some sort of a strategic plan, or are you working towards a strategic plan to begin to address the healthcare issues that we have here? Because we know that we have challenges. We know geographically we have challenges. So let's talk about how do we begin to address that.
Okay, so in terms of chronic disease within a territory, we know diabetes, we know hypertension, cardiac, of course, is the number one cause of death within a territory. Cancer, breast cancer is the highest, cervical cancer as well as testicular cancer, all high within our territory. In reference to that's it for the infrastructure. We know that we still have sick buildings throughout the territory. We know that, of course, we are getting approval for full, what's it the term? Prudent replacement for many of our buildings, and so we're leading there in terms of public health. We have started the demolition, so you know we're coming up to where we can see a structure being erected. That is the same thing for both hospitals. You know that we've gone into the modular system finally for JFL, so that's where we are. We are established a
3 minutes.
From a HRSA standpoint, we do not have access to care, so we are a safety net area. So that's been established. That's basically what we're looking at from that perspective.
So let me ask you, how are we? I think we are at the stage where we have to establish, like I said earlier, some sort of a think tank and recognize and acknowledge the areas where we are falling short. And if we are unable to provide those services locally here in the territory, then we need to extend ourselves on the national level. We have to establish those relationships with hospitals, with clinics, etc., outside of the Virgin Islands. Geographically, infrastructurally, you name it, we are challenged. And we have to first acknowledge that. So let me ask you, as it relates to the dialysis situations that were all discussed today, what are you doing? What can you do to begin to address those issues? And before you respond, I read the testimony of Ms. Rodriguez, and it was very clear that her primary concern was the fact that she is challenged with skilled dialysis nursing staff and having to contract with nursing organizations because we are challenged with that type of staff here in the territory. So I don't want us to have the emotional discussion. It is an emotional issue, but if we are going to solve it, we have to solve this issue collectively. And that's where I am with this, because I went to my office, I was here on the floor earlier, and I sat in my office and I actually listened so I don't get distracted by the emotions that I heard today, because there was a lot of emotions. So share with me.
Okay. So one of the things that we did when I was at the hospital is we started a certification program, and UVI-Cell is the one that actually began the program because we asked for it. So the question is whether or not they do. So I think that we need to step back and do a full assessment, as you said. Is that program still available? I did ask whether or not The nurses as well as the techs at the hospital are still certified. I asked a question just this week, or last week actually, to the CEO, Doug Cook. He said yes, they are still certified. We just have to push that program a little bit more. In dialysis, you need registered nurses, but more than
30
registered nurses, you
Okay, so my time is running out, and I really need to ask one more question. But I hear you, and so we have to look at this. This is not only a funding issue. This is an issue that's impacting us from resources.
Mm-hmm.
And when I say, I mean human resources. So I don't want us to skew the conversation. So we see the headlines tomorrow saying that you're not doing your job. Because we have to make sure that all of us understand what the challenge is. But I have two other questions, Mr. Chair, if you would allow me.
Yes, you may proceed.
I have a question for Ms. I want to have a question with the Nurse Licensure Board, but I want to go to Ms. Amina, my good friend Amina. Very quickly, Amina. Your entity received $1 million from the ARPA funds, sometime last year, correct?
Yes.
Okay, through the chair, I'm going to ask that you provide a breakdown of how those funds were utilized. You've since submitted documentation to request for additional funding, some $941,000 based on your testimony, correct?
Yes.
And when
Yes,
did
we
you
did.
submit that request to the GVI?
We submitted that in December of this year, December of last year, but January.
And have you received feedback? Have they asked you for additional?
I'm sorry?
Have you received feedback? Have they asked you for additional information?
They did. They asked us to send us they asked for some things that we had already sent them, and we had to resend them. Then they asked us to give them quotes of everything we were going to spend the money for, and we submitted all of that. I mean, down to everything we had to purchase. We got quotations on what it was going to be. We sent that in, and we still cannot get an answer from them.
Okay, so I took the time out to call the Office of Management and Budget. So there is some information that needs to be provided, and there's some concerns with regards to the initial allotment that was received. So I don't know where they are with having that conversation, but I'm going to urge them to have the discussion so we can move this along. But we must remember that the issues that we have are associated, and this is not for you, this is for the overall conversation, are associated with resources. And one more question, and that is, we can't forget that we have these ladies sitting here, these beautiful ladies who are actually nurses, right?
Mm-hmm.
Yes. So you last year I think it was last budget year, we did something where we allowed you to the funding was sent directly to you. Have you received the funding?
Mm-hmm.
Do you speak in the mic?
Thank you, Senator. Tanisha Penn. Yes, we have received the funding.
And can you spend those dollars?
We're having difficulty spending the funds.
Why?
Because of how individual or different departments view the board.
What department? Be specific.
Different departments, Department of Health, Property and Procurement.
Do you have access to the ERP system?
Do we have full access to ERP system?
Good afternoon. Carmen Vanterpool Romney, Executive Director at the board. We have access to the ERP system, but for the board, we are not in the approval process of the system.
Why? Is it that you need legislation? Do you need to send us ideas around the legislation? Do you have an executive director?
I am the executive
Okay, so if you have an executive director, so let me ask the Commissioner of Health very quick, and then I'll wrap up.
Yes,
because my time
yes.
is more than called. Commissioner Encarnacion, what is that relationship between yourself and the board that's before us, the Nurse Licensure Board?
Okay, so basically from a regulatory standpoint, we collaborate with ensuring that that process in terms of nurse licensure is actually kept.
We're talking about the funding.
Okay, in terms of the funding, we do have access to the ERP as well. Our certifying officer is the CFO. Hewitt, of course, she had to leave just now, so she does the final approval. However, we have sat and we have spoken about who where the approval process is. I have to tell you that I did request a meeting with the former Commissioner of Finance to go through that process. We have a meeting coming up next week that I requested, so I'm going to actually ask Acting Commissioner Modeste Elliott to be at that meeting so we could continue the conversation that we've had. Would be around the third meeting. What I've been told from CFO Hewitt that the process is not as long as I'm hearing, but of course, tracking is something that I just asked them to do. So in other words, we can track when things come in and when things go out. I think we have to track the data to actually establish how long it's been taken and why it's been taken as long, if it has been taken long.
All right, thank you. Thank you for the time, Mr. Chair. I will say that this is a simple issue, and we can resolve this. So Department of Health, Nurse Licensure Board, you guys can work together. If there's something that we need to do from a legislative perspective, we are more than willing to do it. Stay in contact with us so we can fix this. Thank you, Mr. Chair.
Yes, and thank you, Senator Fred. I have to follow up on that because, Commissioner, the way how you answered that, I ain't clear myself. So the Nurse Licensure Board, Ms. Vanderpool or Ms. Penn, funding is directly allocated to the Board of Nurse Licensure, and the Commissioner of Health has to approve your expenditure. Is that what's happening now, or do you have full access without having to go through the Commissioner? Explain to me what's happening.
We've been appropriated funds. We come to budget hearing every year requesting funds. The issue arises when it's time to utilize those funds. We have, based on our rules and our bylaws, the certifying officer is the chair, myself, or the executive director. We need to be in those authorizations of funding, contracts, and all of those things. We are not being included in the final process of that. We need to be in the ERP system where we can finalize all our documents, all our financials, all our NOPAs, all of these things that funds and takes part in the operations of the board.
If I may, Senator.
Yes, Commissioner, go ahead.
Okay. So prior to the former Commissioner of Finance leaving, I did have a discussion with her so that we can actually look at that process. After the storms in 2017, there was some indiscrepancies. There were some concerns with the way the process was taken. So it was taken back from the Board of Nurse Licensure, given to the authority more so to the Commissioner of Health. Of course, that's prior to my coming on board. However, I am willing to sit with the commissioner. Like I said, I did ask Commissioner Bruce to sit with me and to discuss this. She's no longer here, but I am going to speak with Acting Commissioner Modeste Elliott and see exactly what needs to be done, the reasons why it was done previously, and what we need to rectify. Looking at the time frame, whenever a document comes to my desk, it is signed and sent as soon as possible. From what I'm hearing, CFO Hewitt is not here, but she has reported the same process. Of course, not only the VA Board of Nurse Licensure, we are experiencing some delays in our hiring process. So I know that is a difficulty that you're experiencing as well as we are. But I am willing to sit. Like I said, we have a meeting next week that'll be discussing certain issues, and I will ensure that this too is addressed. There has to be some oversight exactly where we go with this, but I am in support of make sure that we do it and whatever is done safely. And I could not make that decision by myself. It was a decision historically was made by the former Commissioner of Finance and a former Commissioner of Health. That's why this decision has to be made by both.
Okay, well, I'm glad to see that you're willing to sit and work it out. Executive Director Vanderpool, you had some comments?
Yes, Senator. Carmen Vanderpool Romney, Executive Director of the Board. For clarification where Virgin Islands Board of Nurse Licensure stands with the issue of our finances, as it is written in the law, the board is responsible for their finances due to the fact that we come here every year and we sit for the appropriations of the fund. What the board is having difficulty with and challenges with is if we are appropriated the funds from the Senate, what is the reason for the board not approving its fund? As the executive director, I should know where these funds are going, what is going, and if I'm not in the ERP system, that means if I do not have a trustworthy person sending in the payments, I am at a loss, and I cannot go into the ERP system every day to look at it. So what we are asking, because it was done prior, our chairperson at that time used to sign off on all the documents. It was only because of the damages and the board lack of quorum, that's when the Commissioner of Health, Commissioner Davis, stepped in, and that was correct. She is over, and the Commissioner of Health is the highest ranking in health. But as we move forward and we receive a quorum, and there was a chair or is a chair, and an executive director, then by law, the board is responsible for its own duties and responsibilities.
Thank you for
Thank
that
you.
testimony. Well, Commissioner Encarnacion indicated that she's willing to work with you to work it out. So keep me informed on how that goes, because, the boards, there's several boards, and they all have to, the commissioner is is the state person, but we want to make sure we have that independence. Senator Maurice James, you're recognized for your 6 minutes.
Thank you, Mr. Chairman. Good afternoon, Virgin Islands. Good afternoon, testifiers, colleagues, everyone in the room here on St. Thomas. I'm going to begin actually by allowing Dr. Brittany Dawson. We had a little side conversation regarding nurse staff shortage, and I wanted her to respond to the public like you responded to me.
Okay, so Dr. Brittany Dawson, Vice Chair of Board of Nurse Licensure. So one of the things that the board does is we look at licensure across the board, including all, which includes RNs, LPNs, APRNs. We're even looking at nursing assistants and things like that as the board regulates. Meeting the staffing crisis within the territory is a broad conversation that's been having with all agencies, including dialysis. But one of the major things that we're seeing is that we need an LPN program to be established and functioning within our territory. It would fill a lot of gaps. This includes the gaps with our dialysis techs. Our trained dialysis nurses, LPNs can function as that. We talk about long-term care, geriatric needs as our elderly growing population. We need more of all areas of nursing. As UVI has continued to expand its program and they have their BSN of nursing program, we need to look at bringing back in an LPN program.
I agree.
The Board of Nursing took its first step while opening an office in St. Croix because we're also looking at long-term goals to be able to offer a testing center in St. Croix so that we begin to streamline what it looks like to license in the territory. My recommendation would be we need to look at all the funding that's needed on the table today, and that includes programs to staff these facilities.
Thank you. I like that because we're here about solutions today. That's why we're here and why the legislature is trying to help resolve some of the issues that we're seeing in front of us. I want to ask the Commissioner of Health a few questions with the time I have. And they're really quick questions. While I appreciated your long testimony, I wanted a little more detailed responses. And so I'll just go through some quick ones that jumped out at me. When it comes to the National Governance Challenge and the team that is going to, I think, maybe DC or somewhere.
Yeah, you're right.
It says in June 2023, 7 behavioral health staff members are going to go in collaboration with the Office of Veterans Affairs. Yeah, we'll travel to DC. Do you have civilian or private sector or nonprofit members as part of your team?
No, it's right
3
now.
minutes.
Right now, it's only the Department of Health. It's a challenge that came from SAMHSA, the Veteran Administration, to the Commissioner of Health and the Director of Veteran Affairs. And now this is implementation process. They have asked the Department of Health as well as VA to provide individuals to go. No, we do not have anyone from the community now. Doesn't mean we cannot expand, but this is the first meeting that we're going to.
Okay, I know that it allows civilian members, nonprofit, and private organizations that actually, I'm a little familiar with this. So, I thought that you would, rather than just simply have public sector members, you would have leadership from caregiver organizations, private sector providers. When I look at the website, they talk about those because those are the other entities that you expect to provide services to veterans and their family members. So hopefully in the future, when the Virgin Islands sends a team, it includes people from the other sectors in our community, the private and nonprofit sectors. Okay, I want to also ask you about the community health workers. Let me go back and say this, Commissioner Encarnacion. When you have paragraphs where, for example, you talk about outreach and education services to 3,874 contacts made with students. Okay, that's good that those contacts were made, but I'm really interested in any data that you got from those contacts. What were the issues that came up? What were the concerns? What did you learn from these outreach and education services? Because the paragraph below talks about radio ads with mental health, bully prevention, substance abuse prevention, coping with stress. So in the future, I'd like to see something more than just that you made contact with 3,874 students, but what does that tell me as a senator about the students? What does it tell me about what the outcomes, the results?
30 seconds.
Oh, man. Okay, one more quick question. On page 16, you speak of community health workers. What exactly do they do in the community?
They enter into the actual communities. For example, in St. Croix, we have the Machuchal area that our community health workers and speaking Spanish as well will go into that area as work. If I may continue, Senator.
Yes, you may.
Work with those that are there and actually sit and just listen to them to see what they are telling us their health disparities are. So, and it's actually, we have in St. John, St. Thomas, and St. Croix. We only have 5 certified. We have others that we're training at this point in time. So expansion of the program is critical.
Thank you, Mr. Chairman. I'll wait until the next round if there's another round. Thank you.
If I may, Senator, may I continue?
Thank you, Senator James. Go ahead, Commissioner.
Okay, thank you. In reference to the data collection, what we can do is we can provide a little bit more information to you, Senator James, through Senator Fonseca, so that you can actually see, of course, the ads that are being produced right now is as a result of that. So we'll let you know exactly what some of the responses were. So yes, we're keeping that data, and we'll provide the information as soon as possible.
Thank you very much. Senator Javon James Sr., you're recognized for your 6 minutes. Please recognize the mic for Senator James.
Afternoon. Greetings to the people of the U.S. Virgin Islands. Thank you, Mr. Chair, for the time. Thank you, testifiers, for being here. I am not going to beat a dead horse. I think we have established what needs to be done here today and understand our oversight responsibility as legislators. But I always try to be a get-to-the-point person. We live in a small-knit community. No one is hard to find, and if a person is hard to find and they work for government or any department or agency who solves for the people of Virgin Islands, that needs to be dealt with. So a lot of these issues I'm hearing today needs just a simple phone call. You know, we are here to provide funding if you need the funding. Like, come here with a plan, a detailed plan with data and statistics, and let us make the determination of whether we should fund it or not. And if we fund it based on data, then they could root us up on the radio. But pick up the phone call. Pick up the phone. And as far as the start of the budget hearing was yesterday, the start of the budget hearing, and it was a great conversation. And during my line of questioning, I asked OMB regarding the status of the funds for the Jeffrey Epstein settlement. And hopefully at a later time, this body, once we receive the data and all the information from the entities that are truly dear to us and need funding, then we can make that decision. So as far as things that deal with morale and what have you, that's beyond our control. Y'all deal with that. Be able to recruit and retain, y'all deal with that. You know, but when it comes to funding, check us out. You know, simple. But we really need the data, and I agree with the Senate President. And that was my line of questioning, but of course I don't want to beat the dead horse. But moving forward, what can we get from you, Commissioner Hussein Kanasiong, after today, without us having to run you down, micromanage? When can we get some level of data? Is it going to take, how long do you think it will take?
The data that I spoke with Senator James about, the other Senator James?
No, the Senate President. He asked earlier about data. And as far as like dialysis and the list goes on.
So we do not have a dialysis data bank. We are working on a diabetes data bank. It hasn't started yet because we're working with the Diabetes Center of Excellence in beginning that process. But the data we have in terms of our screening process, I'll have whatever information that we have from Director Linnea Fredericks, Dr. Fredericks, and we can provide that as soon as possible.
Thank you for placing that on the record. Okay. And I will just use the remaining of my time to talk. During COVID, the governor mentioned the whole Sluxing thing, and everybody had it as a joke.
3 minutes.
DJ Avalanche even made a song, big up yourself, DJ Avalanche. But in humor, it's a serious message. And of course, we can't tell individuals how to eat and how to live their lives. But at the end of the day, it's a part of our culture. And whether we like it or not, once it becomes a norm, it is our culture. Once you practice something over and over and over, whether it's bad or good, it's a culture. So moving forward, we know for sure we have to put the infrastructure in place. We have to provide the funding. But in the meantime, as far as initiatives for our youth and what have you, those on the elementary level, junior high school level, to try to kind of change the mindset just a bit. If you can save 20% of the population that's coming up out of high school, junior high, what initiatives are being taken to educate our high school students, junior high students, and high school students on the importance of health, diet, avoiding having to fall into the scenario or situation of diabetes?
Okay, so we don't start from high school. We have our WIC program. We have an infants and toddler program, which is 0 to 2 years old. Then, of course, WIC it continues as well. And then, of course, MCH. So it's a combination of behavioral health and what we do and how we teach parents how to parent and how to actually cook better food, but more healthier food. Those things are happening through our MCH, WIC, and Infants and Toddler program. It's happening through our chronic disease program. Last year, MCH spoke a lot about weight. So we focused on how children are looking at their weight, how parents are looking at the weight of their children, and what do we do differently. So those are all the things that I have to tell you that, and I said that in a testimony, but really and truly, disease prevention, health promotion is one of our more active programs that we have. So you always hear them on the radio. They're always in the school system. One of the things that we put together that I asked to actually happen is to really and truly engage in others, going into schools, speaking to the students, not just the programs outside, but going into the school system and say, okay, you attended the Put Down to Gun program last week. What do you think about that? Because, of course, gun violence is a public health issue as well, right? So it's not just the physiological aspect of it, but it's also the psychological aspect of it. But we are going to be going into schools a little bit more, and yes, over 3,000 students were touched, but they were touched with education, they were touched with questions and answers, and so we'll continue to do just that as well. But I think that the point is well made. It's not just
30
the conversation, but the information that's brought back and what we do with the information.
And like I said, you can't tell grown adults how to live their lives, but I strongly believe with starting with the children, there's some hope there. And I can tell you off the bat, I know the commercial for Racetrack. The commercial is always on YouTube and all those annoying commercials. But we're big up to them. They have to do what they have to do to market and advertise. But I'm just saying to use the same approach. I guess commercials that target young adults, younger, children, or whatever the case may be, and run some ads. Put a budget for some ads. Even if you have to spend $200,000, so be it. You're gonna save some lives. With that said, like I said, y'all pick up the phone, call each other, come to us with a master plan with some data and some real numbers, and if it needs funding, so be it. We have money from the Jeffrey Epstein settlement if this is really a crisis. That's if this body wants to act on that. But thank you, Mr. Chair, for the time.
Thank you, Senator Javon James Sr. Senator Donna Fred Gregory, you're recognized for your point of inquiry.
Thank you, Mr. Chair. And I, have to say that I have to agree with Mr. Angel Rivera that accountability matters. So we all have to hold ourselves accountable. But I want to ask this question to Commissioner Encarnacion, because today I heard the issues surrounding dialysis care, particularly in the Island District of St. Croix. Is it that we're saying that we don't have a dialysis care issue in the Island District of St. Thomas, St. John? And if we do, what does that look like? Because I think it's important to hear all of the information.
Okay. So yes, we're actually focusing on both of the districts at the same time. Of course, the reason why the island of St. Croix is the focus is a little bit more is because we have a hardened structure in St. Thomas, and that's at the hospital as well as CKC. In St. Croix, CKC and the trailer, which doesn't give us much of an option if something happens. And I think that's where the focus, why you see much of a stronger focus. But everything is actually being dealt with and how we go. Senator James spoke about crisis and adversing the crisis as well as long term. You have to do both. So I speak about prevention and preventing the crisis.
But I want you to answer my question though. Mm-hmm. Okay, so let me be a little clearer, because I know there was a dialysis center in St. Thomas that closed. I was at the Port Authority some years ago. How many dialysis centers do we have in St. Thomas, St. John, and are they in crisis as well? That's basically what I'm asking.
So yes, because the second center is CKC. So
Okay.
if they close in St. Croix, and Dr. Gardner will have to answer that as well, but the plan, I'm sure, is going to be in St. Thomas as well, so it's going to affect both. St. John does not have a dialysis
Right.
center. Patients go over to St. Thomas for care and treatment.
So then my last question is, what is your commitment to working with the CKC in particular to ensure that we are able to mitigate this situation? Because based on what I heard, it's squarely tied to resources. So there must be something that we can do. I mean, we can't make people or make professionals unless they go to the university and do what they have to do. So we really need to drill down and see what's available. And if we have to do some moving around, that's what we do. But there must be a commitment coming from the Department of Health to provide some level of support to ensure that we are able to mitigate this situation that came before us today.
Okay, so Dr. Gardner, I think I'm hoping, I'm sure he can say that he's aware that he does have my commitment to ensure that the dialysis population on either of the district are supported. So that is just a given. In reference to any additional dialysis center, I've made my rounds. I know exactly what the need is, and like I said, I don't know if you were here, but we actually have a very high-level meeting this evening at the territorial board, and I'm hoping to have some positive outcomes of that meeting, and I will be there as an advocate.
Thank you, Mr. Chair.
Thank you, Donna.
Point of
Senator
information.
Frederick. Senator Potter, you're recognized for your point of inquiry.
Thank you, Mr. Chair. Commissioner, I know we're wrapping up the day, and I just wanted to give you an opportunity to elaborate a little more on the community health clinics. That was really the shortest section of your presentation. Do we have active functioning clinics? Do we have physicians, an adequate number of physicians in place? Are we aware of the types of clinics that you have? Do we have like an immunization clinic? So can you just elaborate a little bit more about that?
Okay, so our community health clinics, we have one on St. Croix, one on St. Thomas, and that is from the Department of Health. We also have community health clinics outside, and that is the Federally Qualified Health Center. Of course, in St. Croix, I think we have the Frederick said Health Center has about 7, if I'm correct, and they also have some dental center as well. In St. Thomas, unfortunately, there is only one segment of St. Thomas East End Clinic, and I know that right now you'll be hearing from them this afternoon or this evening, and they are right now wavering. However, we met with them last week. In terms of access to care, it has been reduced, but I know that there is a physician there that has taken on the acting CEO role, who seems to be very committed based on the discussions that we had with her. So I know that there's some support that's needed in that realm as well. In terms of immunization, we have a regulatory portion of our immunization focused more on children. Then, of course, we have adult immunizations as provided into our by our clinics, and that funding source is from the public health sector.
So you're essentially relying more so now on the federally qualified health centers to provide the clinic service that I know once upon a time Health did a lot of those types of initiatives.
Well, we still actually provide high-level medical services. We have medical, we have diabetes, we have endocrine, we have cardiac. So all those clinics are still provided by the Department of Health. But you also have surrounding, and the governor feels this way, and I feel this way too. We don't have to do it all. We just have to support and regulate what's being done.
Thank you, Commissioner. Thank you, Mr. Chair.
Thank you, Senator Potter. Senator James, you're recognized for your point of inquiry. Information.
Thank you, Mr. Chairman. I wanted to follow up on my colleague's question concerning the Island District of St. Thomas St. John with respect to CKC. And I wanted to ask Dr. Gardner specifically if the same issues that he's encountering here on St. Croix that may cause the closure here on St. Croix, if we do not avert that crisis, how is St. Thomas affected by your decision?
Both CKC facilities will be closed. The figure I gave you was the cost for both facilities, operational cost. And without that's just not sustainable, as I said earlier.
Not sustainable for either island, for your entire operation, CKC operation.
Exactly. Correct.
Okay, thank you, sir.
Yes.
Thank you, Mr. Chairman.
Yes, thank you, Senator James. Yes, Dr. Gardner, you operate the dialysis units on both islands, and you need that $72,000 biweekly to keep your operation in effect running, and that's your testimony, correct?
That's my testimony, Senator.
Thank you. Colleagues, I think we've almost exhausted this, and we have our Block 2 group here. So what I'll allow is if any one of the senators has one or two burning questions, I'll allow that at this time. Any senator? Okay, well, I'd like to thank all of the testifiers. At this time, what we'll do is we'll give each one of you 30 seconds to do a quick rack up and summary. We'll start with Commissioner Encarnacion.
Thank you. First of all, thank you for having the hearing today. Didn't expect to see so many people, but I think that it was good to get the information out to the public to really address what's going on. One of the things that I'd like to put in front of the community as well as you, AC Malloy is working on a data warehouse. It's a contract that is actually being fulfilled, and we do not have a health information exchange. But the data warehouse itself would allow us to collate information and data and tracking. So once that's up and running, we'll be able to give you more succinct data. So we're working on that as well. And I thought that was important for you to know, led by AC Malloy, as well as the Office of the Governor. In essence, to all the things that we've said today, one of the things that Senator Fred Gregory indicated that it might be a headline whether or not I'm actually doing my job. I am doing my job. I love what I do, and I take it very seriously. I think that one of the things that we have to do a little differently is look at what's going on in the dialysis situation after the meeting that we have this evening, figure out where we need to go. I will continue to advocate strongly for what's needed throughout the territory. We do have a community health assessment. We have a community health improvement plan, and we have a strategic plan. We're about to redo our community health assessment based on the fact that COVID is now wavering, but we need to look at what we're looking at in terms of long COVID, because it's going to create some other high-level chronic disease that we did not predict, and that is diabetes, lung issues, cardiac issues, because it's hard to say exactly what long COVID is going to bring. It's a conversation that we're having nationally. One of the things that someone asked also is in reference to CMS. And what can CMS do in reference to the changes in the reimbursement rates that we have? Dr. Cassidy indicated that she's willing to speak to CMS. We are going to be going to Region 2, where all the Region 2 heads get together, and that will be in October of this year. It gives us an opportunity to speak with individuals reading Region 2 CMS, as well as everyone within the region, in Region 2 that's the highest level prior to the Secretary of Health, and see exactly what we need to do. I am also a member of the Association of State and Territorial Health Officials Board and the executive level as well. And so that's something that we can do, and they promote, and they actually supported the CMS the reimbursement rate changing, and we'll continue to fight for that as well. Here within the territory, we will continue to promote public health, as well as looking at it from a global perspective and see what we can do, what we do differently. But I think I go back to say starting from scratch, going backwards and saying, okay, you know what? Community health workers worked in the past and they can work in the future. So for those of you who haven't registered for our community health summit that we have this week in reference to community workers, please do so. We have done a lot, but we have a lot more that we have to do, but we are ready to do so. So thank you, sir.
Thank you for that 30-second summary, Commissioner. We hope you make it on time for your territorial board meeting. Office of Collective Bargaining, Attorney Josh Springett.
Good afternoon. Is it on?
Please recognize the mic for Attorney Josh Springett.
Good afternoon, Senator. Thank you for the invitation and the opportunity to testify. I wish you the very best in carrying out the duties of this committee.
Thank you very much. And even though you haven't said much, your efforts are to be congratulated with the new contracts for the nurses. I've gotten a lot of good comments, and I think we are on the right track to retaining nurses in our territory. They're very happy, and I think it's a good move in the right direction. Also, the Board of Nurse Licensure, Ms. Penn, your 30-second summary.
Thank you, Senator. Dr. Brittany Dawson will do the closing for VIBNL.
This is Dr. Brittany Dawson in St. Croix. I would like to say the Board of Nurse Licensure, again, is happy to be here to answer any questions before the body, and thank you for inviting us. We have to say thank you to our staff and give a round of applause to all healthcare workers within our territory. The board, in summary, needs its autonomy back. We have lost quorum due to a natural disaster. Our quorum has been well established well over the last 3 years, and we are still struggling to get full control over our board. It is not just us here in the territory. Our national organization is demanding that in order to remain part of their membership, that we regain our full autonomy. And to remain ethical and effective in our execution of the licensure in the territory, we should be functioning fully as an autonomous board. Thank you.
Thank you very much. Ms. Salim, your closing summary.
Yes, thank you very much for having us here today. I think we've kind of accomplished what we wanted to do, is to let everyone know that it is a dialysis crisis here on St. Croix. And as you can hear, it's going to it's in the territory. It needs to be on the front of everyone's mind. We cannot, we advocate for CK, for the Caribbean Kidney Center, because we understand that we need 2 units. Because we understand that we need 2 units. We do not want to be the only unit. We cannot be the only unit. We need 2 units here in the Virgin Islands, in St. Croix. CMS recommends that. And so we are advocating not only for ourselves, and we do need help in getting that money that really would secure dialysis here in St. Croix for patients by having 2 hardened units. One, our Virgin Islands Healthcare Foundation dialysis unit, and the Caribbean Kidney Center. And when we can do that, and when the government says this is our responsibility to make sure that we have this, not anyone else's, that they will find the money, just like they find the money, as was said, for a number of other things to make this happen. And yes, we are not going to have to come back to you. We are going to be working not to have to come back to be dependent on the government. We are going to be looking at all. DCI has already done a 5-year projection, and they feel that we will not need that. We are also, because we're a nonprofit, we can get donations, and we're looking at that also. And we're looking at how we train local Virgin Islanders to work in our units and bring the pay up. DCI will be paying them at a level that they do stateside. So we're hoping that we're not going to have those problems, but we know they exist. And so we are working towards making this better and better for all the patients. As I said, who knows it, feels it. Who feels it, knows it. And that's it. And all of you, you do not want to ever have to feel it. And I mean it. Anyone can tell you, you don't want to ever have to feel it. And so therefore, help make this happen. Because if you can't help us get our unit up, or you can't help Dr. Gardner keep his unit going, and you end up spending $40 or $50 million having a number of patients go off island. Each patient has about 10 persons in their lives. It's 120 patients. That's about 1,200 people. And all those people have people. That's a vote. And people would be very upset with everyone if we can't make this happen, especially when we talked about it here today.
Thank you very much, Ms. Salim. Is Angel Rivera, Mr. Rivera, Angel Rivera, you can give your closing remarks.
Well, thank you again for having us here today and being part of this. As a dialysis patient and advocate for the dialysis patient, I want to thank you. Thank you for hearing us once again. Like I said, we were here back in 2019, and here we are again. I hope for this not to have to be repeated. And I speak on behalf of all dialysis patients, the ones at CKC and the one at JFL. We all sit in that chair. And until you sit in that chair and you suffer what we suffer, you would never understand what we go through. Family members, caregivers, they see the pain that we go through. And we just ask that this legislature do their part. We are your constituents. We are the ones, okay, that put you here And we just ask for you to do your part to make sure that we can stay here in our home, on our territory, on our island. I thank you, Senator, for giving me this opportunity.
Thank you, Angel. Dr. Tasmin Khan, you're recognized for your 30 seconds closing.
Thank you, Senators. Thank you, Senator Fonseca. I think that we have accomplished the mission of everybody here to recognize the humanitarian crisis. I think also that it's very difficult, not I think, I know that it's very difficult to be a healthcare provider taking care of dialysis patients and to see the suffering and to hear from them, you're my doctor, what can you do about it? Can't you do something about it? What can you do to fix it? And the thing is, we can only do so much as healthcare providers. It becomes a community problem and it becomes a government problem to take care of our constituents, to take care of our community, to take care of our patients. And we need your help to help us accomplish this and to help us take care of them in the way that they deserve and to ease their burden, not only on their health care, but also financially on their families so they don't have to travel, and emotionally for each and every one of these patients. I'm an advocate for the patient. I'm an advocate for all of my colleague healthcare providers, including Dr. Gardner at CKC and his team. I'm an advocate for increasing capacity on the island for our patients. So anything that we can do to help answer questions as we move forward in the process, if you need us to be a part of that process, please don't hesitate to reach out. I'm grateful for this opportunity to testify today and to have this conversation with everyone today. Thank you.
Thank you, Dr. Tassim Gardner. Dr. Tassim Khan, I'm sorry. Dr. Gardner, you're recognized for your 30-second closing.
Senator Fonseca, thank you for this for this opportunity to appear here this evening, today. CKC celebrated its 30-year anniversary 3 months ago. We've been here through thick and thin. I say 30, 20. You get me married, I get confused. Okay, 20 years. And we've been here through thick and thin. We are going to be here, we want to be here to continue the service. We want to cooperate with anybody else and any other organization or group that wants to help us provide our service. We are committed to dialysis in the territory. There's ample evidence of that. On May the 12th, I signed a short-term agreement with Pafford for staffing. Again, because of that commitment and to hopefully provide time for the local government, the Department of Health, Senate, everybody, to try to come together and salvage the situation. After seeing this first bill, I'm surprised I'm still here without a heart attack. I am not kidding when I say I have no time and no choice without help. And the consequences that I had to think of. These patients and this business means everything to me. My life is in it. We also have the challenge that, for example, this week we have 2 people. First of all, one of the things that we pride ourselves in is that we've been probably the only dialysis facility in the territory who regularly accepts visitors, transient patients, etc. We have had as many as 19 transient patients a month in our facility. Recently with Carnival, we had a bunch of patients come into both facilities as well. We are proud to do that. We are proud to contribute in any way we can to the well-being of the Virgin Islands. This is home for me now. It's been here, home for me for 27 years. In addition, we've also trained literally 80% of our staff, both RNs and PCTs. We have an active training program The problem is we can't find RNs to train, we can't find PCTs to train, which is what has gotten into this mess. I want to stress that whatever we do, and whenever you decide to supplement dialysis services, plan for training and maintaining staff. So, I went to Pafford and I signed a short-term contract, and this contract is going to expire soon. It probably is not going to run its course simply because I don't know how much longer I could survive. I am running a constant bill as we speak. If funds aren't available for us, I'm bankrupt, period. I'm not being dramatic, I'm being very honest with you. So that I need your help soon, immediately. One other way you can help is, and this is specifically to the people involved in the Virgin Islands Government Hospital Health and Hospital Facilities Corporation. We have been negotiating for the last several months about the possibility of the government moving into and utilizing our services, our prepared building, both in St. Thomas and St. Croix, not just for this emergency situation, but for the rest of the hurricane season, if that becomes necessary. I've even offered to literally sell my facility to the government, as is right now. I'm sorry. To sell my facility to the government as it is right now, obviously at fair market value, so that I am ready to do what it takes, sacrifice my 20 years of dialysis contribution to the community to get this thing working properly. Anything I can do, I'm prepared to do. I'm available to meet at any time and any hour to try to resolve this issue. It is a serious issue. My patients beg you, my staff beg you, and I beg you, please act urgently. Thank you.
Thank you, Dr. Walter Gardner, for your testimony. At this time, we will release all of the testifiers. Thank you very much for your input, your valued contributions to the Committee on Health, Hospitals, and Human Services. I'm sure all of my colleagues have digested the information that you have provided to us, and we will work diligently to resolve this dialysis crisis that we have right now in the Virgin Islands. And thank you and blessings, and have a good evening. The Committee on Health, Hospitals, and Human Services stands in recess for 1 minute. The Committee on Health, Hospitals, and Human Services is called back in session. Madam Clerk, can you read Block 2 into the agenda?
The committee will receive the testimony on the operational and development status of the St. Thomas East End Medical Center Corporation. Air ambulatory companies Massa Global and SkyMed will provide testimonies on their operational status and key services they provide to residents of the territory. Invited testifiers is Mr. Carl Caldwell, Chairman, St. Thomas East End Medical Center Corporation, Mr. Stephen Mayers, Chief Financial Officer, St. Thomas East End Medical Center Corporation, and Ms. Linda Burton, Vice President of SkyMed.
Thank you, Madam Chair, and a welcome to all of the testifiers in Block 2. We apologize for the slight delay. Block 1, you know, there was so much important testimony received regarding the dialysis emergency that we needed to make sure that those questions were properly addressed. And so at this time, I would like you to put your name and positions on the record, and then we would begin with the testimony of Mr. Carwood. So starting from my right, your name and title, and then we will begin with the testimony.
My name is Joseph Sabino. I am
Media, please recognize the mic of the testifiers. Proceed.
My name is Joseph Sabino. I am the operational manager.
Hold 1 second. Media. Okay, go ahead.
My name is Joseph Sabino. I'm the
Hold 1 second. Media. Put the mic closer to your mouth.
My name is Joseph.
Lift it up a little bit. Yes, go ahead.
My name is Joseph Sabino. I'm regional operation manager for SkyMed.
Hold 1 second. Hold 1 second. We'll take a 1-minute recess to fix the technical issues. The Committee on Health, Hospitals, and Human Services is back on the agenda. Mr. Sabino, please, starting on my right, if you can give your name and organization, and then we'll go to the left, and then we'll begin with the testimony of Mr. Colwood.
My name is Joseph Sabino. I'm the Regional Marketing Manager for SkyMed International and Travel Discount.
Thank you.
Good afternoon, Senators. My name is Carl Colwood. I'm the chairperson of the St. Thomas East End Medical Center Corporation Board of Directors.
Thank you, Mr. Colwood.
Good afternoon, Senator and members of this committee. My name is Stephen Myers, and I'm the Chief Financial Officer for STEAM CC.
Thank you.
Good afternoon to all senators and staff. My name is Donna Street. I am the Revenue Manager for the St. Thomas East End Medical Center.
Thank you very much. So we can begin, Chairman Colwood, with your testimony. You can proceed.
Thank you very much, Senator. And I am the newly elected chairperson of the board of the St. Thomas East End Medical Center Corporation. I took the gavel on March 18, 2023. On March 1st, 2023, STEAM CC began its fiscal year 2024. So I'd like to thank you, Senator Fonseca, and the committee members for basically organizing your schedule to meet with us. What I have to report to you regarding the financial situation of STEAM CC is simply not good. I want to stress as we move forward that our fiscal woes have not affected the quality of care received by each patient seen. We do have a long waiting list, but it is neither my intent as chair nor the board's to see our negative post-COVID numbers impact that quality of care to each of our patients seen. Thus, we reached out to this body to lay our cards on the table and seek whatever assistance you can provide to help stabilize our system. Federally qualified health centers, such as ours, nationally reduce hospital visits by 24 to 35%, and that's according to the National Institutes of Health, and it's backed up by a February 2023 University of California, Los Angeles study. So our board is made up of 13 St. Thomas St. John District residents, all of them who are unpaid volunteers. 51% of our board membership must be customers of STEAM CC. The remainder are recruited from the service area community based on their skills and ability to contribute their time and efforts. It has been difficult over the years to recruit new board members. The Health Resource Services Administration, or HRSA, our governing body, does allow us to amend our bylaws to have up to 25 board members. So maybe this is an area where community members with the needed skill sets can help by volunteering as a STEAM CC board member. Okay, logistically, the board has one employee, the executive director. That employee is charged with running a medical center. All of STEAM CC's employees work for and are hired or fired by the executive director. Now, among the board's responsibility, it conducts oversight, approves policies, and hears final employee appeals. The board is prohibited from involving itself in the day-to-day management of the center. We receive reports at monthly board and committee meetings. And for the record, Chairman, I have sent to your office for circulation a copy of our bylaws, employee handbook, financial policy, and our corrective action plan for your committee members' information. So now, as you will hear from our new Chief Financial Officer, Mr. Stephen Myers, who's just about 2 months on the job, in 2019, the year before COVID hit, STEAM CC had over $1 million in reserve. Coming out of COVID, we find ourselves over $3 million in deficit. Today, our monthly payroll costs are practically double the amount that we earn each pay period. It is unsustainable. 5 years ago, projections for the future appeared to show opportunities for expansion and growth to better serve the community. No one could have predicted the impacts of COVID, nor estimated how long the pandemic would last, and also now, in recent studies, how long the effects of COVID will last. That could be decades into the future. The physical effects on the bodies that you heard from certain other testifiers earlier. So we entered into a world of ambiguity and uncertainty that has thrown all of our pre-COVID plans into chaos. So emerging from COVID, our rapidly declining financial picture started becoming apparent. Federal subsidies did not cover the totality of expenses accrued between 2019 and now. Board orders and actions to stem the rising tide of debt had little effect. While COVID did have a definitive impact, it seems that other internal issues and decisions may have also contributed to the increase in our costs. At the beginning of this calendar year, Governor Albert Bryan facilitated a 3-month advance in our allotments. That kept STEAM CC operational through the end of the 2023 fiscal year in February, but we are only able to pay basic payroll costs. When I took the chair, it became apparent to me that much more drastic and creative actions would have to be taken to halt our downward spiral. So in the first quarter of my administration, I've ordered a top-down review of the organization and its policies, both on the board and medical center sides. I have asked for local and federal assistance in conducting the proper investigations and audits to obtain answers. A formal letter has been written to the Inspector General, and this was accelerated at the behest of Senator Fonseca in conversations with your Chief of Staff, who said that was in our plan. He said basically get it in there now because she has a long list of things that she needs to audit, and this is one of those things that we would like to get up front. Because we need to understand everything that occurred in order to achieve our permanent fixes. Okay? And at the same time, we cannot wait on the past to rectify today's problems. A number of our vendors and suppliers have already cut us off. Our translation service has been cut off. Translation is a mandated service. The company that supplies all of our medical inventory cut us off. We cannot order from them until we pay. If we cannot order from them, we do not have supplies. Without supplies, we cannot see patients. The company that does our pap smears for us is no longer willing to send us the kits because we have not paid them. Women's health is a major priority for us, and we simply cannot stop doing pap smears. Our mobile phone service has been cut, so there are no phones for our drivers, our facilities personnel, or on-call staff. We did manage to get a phone for the on-call staff, so that is now covered, but the rest no longer have phones. The company that provides all of our cleaning supplies stopped supplying us. We had a situation where we had no toilet paper or no paper towels. And basically, that had been being scraped up between staff. And we finally got a check cut to get that done. The company that provides our high-volume industrial copier scanner cut us off. We are now only able to print from the small, non-commercial printers in the center, which is a major issue because we cannot print requested medical records, which can be quite voluminous. And we're saying that's a huge or a major issue because we can't hold people's medical records hostage because we can't afford to print. Okay? So our electronic health records company has threatened to cut us off. If they do that, we cannot send prescriptions and we cannot bill. Our employee health insurance provider has notified us that they will pull coverage. Just today, we had to scramble and figure out where to move money from to pay storage, because they put a chain on that door, and that's where some of our paper records, historical documents, etc., are stored. Okay, so we basically have a crisis situation, and what are we doing to help ourselves? Okay, well, first, I have notified all appropriate local and federal agencies of our situation. This includes Government House, with an in-person meeting with Governor Albert Bryan, the Office of Management and Budget, the Governor's Policy Advisor, the Commissioner of Health and her team recently, the Health Resources and Service Administration Region 2 Director, who came and visited the islands just last week for another conference and will be back in July. And now this committee. We have given them full access to our books and activities. We formed an ad hoc corrective action team, or CAT, consisting of myself, Finance Committee Chairperson Francia Brin, Interim Executive Director Dr. Tess G. Richards, our CFO, Mr. Mayers, right here, and a past Executive Director, Mr. Wilbur Smith, as Special Advisor to the Board. The CAT's main function is to create and oversee a corrective action plan. This plan was created, approved by the Board, circulated to our federal and local partners, and put into effect. Stage 1 achieved some cost savings through the elimination of top-heavy administration posts and the dismissal of employees who had been hired under expired COVID grants, but who were still on payroll. That reduction at that time was 9 persons. We also put in place significant austerity measures while seeking financial assistance from the governor and grant resources. With intense cooperative work by all parties, we have been awarded $2.28 million from the Rescue Act funds, which, managed carefully, was projected to see us through October 2023. We have yet to actually receive those funds in hand. But now, unfortunately as well, we were recently notified that the $2.8 million will not be received in one lump sum because we are considered high risk. We are to receive $500,000 per quarter, meaning that these funds intended to make payroll and pay vendors now will not be fully usable until September of 2024. And that, of course, means late fees, fines, and penalties accruing during that year and a quarter that will further increase our debt. And also now, people will be closing in on us and filing in court during that time period. So that means basically spreading out that $2.8 million into 5 quarters. It makes it virtually useless in helping the center survive today. Stage 2 has to address continued financial drains on the center. And we are at that spot right now. We just passed that Saturday night. It involves a reduction of our rental square footage, the renegotiation or termination of contracts and our land lease, some pay down of our mounting debts, and payroll reduction through non-critical staff layoffs. And those announcements were made yesterday, and that totaled 14 employees, so that at the end of the day, after round 1 and 2, we are actually down 23 staff. So the corrective action team will monitor progress and make adjustments and changes over time to keep STEAM CC in line with the intentions of the corrective action plan, and it will report monthly to the board. The corrective action team is to dissolve when a stable financial and operational process has been restored. Its authority must be renewed semi-annually by the board. And what I need to stress is that we need to reorganize for long-term stability. Locating lump sums may bring us to a net zero position, but this is not a sustainable or a consistent source of income. To generate additional income, we will need to add more providers, which is a nationwide problem, not just a local one. We are continually trying to recruit, but the act of proper recruitment costs money that we do not have. The salaries we offer often do not adequately compensate interested mainland providers for certain realities of life in the Virgin Islands. So we need to do things to support provider recruitment and retention. Now, as a result of our communications with federal officials, we are now receiving a lot of daily and weekly HRSA technical assistance and training for our staff. This includes revenue cycle management training and the operation of our new 340B program. When fully spun up, the 340B program will provide discount prescription drugs to our patients and hopefully generate additional revenue. And so far, to my understanding, such a program has been running very successfully on St. Croix. So that is something we really need to put our efforts behind. Now, STEAM CC, we already are a nonprofit, but STEAM CC also went out and formed the STEAM CC Foundation, which has been essentially dormant since shortly after its creation in 2016. I have asked that the STEAM CC Foundation be reactivated so we can raise funds locally and nationally. In our recent meeting with Senator Fonseca and Taisha Phillips Dorset, the governor's policies advisor, the senator spoke of the need for more leadership collaboration between STEAM CC and the public health services of the Virgin Islands to better coordinate all of our needs and acts for the entire healthcare system. I concur with the senator's assessment and hope that we can pull together some sort of overarching health action team that includes us, because in considering financial options for STEAM CC, I actually have come up with a wide range of ideas over the past 2 months that I've been mulling over with a certain creative team that I put together within the STEAM CC staff itself that Dr. Richards has been attending. And at the appropriate time in the very near future, I would like to share these ideas with the committee and key members of the health community, because the engagement is going to take all of us. And also, with your indulgence, Senator, I did some noodling around last night with the CFO's numbers without that $2.2 million lump sum, and without it as a whole lump sum. If you're just giving it to us in that $500,000 right now for this quarter, I would have to recommend closing the center at month's end, because we're going to run out of certain necessary supplies to ensure quality patient care, and that we cannot let slip. Understand, we are going into slow season, which I know all of you senators know, which is also hurricane season and price freeze season. Without patients, creditors, without patients, revenue slows down. That's the same time of year that our creditors' revenue slow down from their other sources. So what I can tell you is that they are running out of patients. They have been very nice. I've been having face-to-face meetings with a lot of them, and they've been extending us. But what I can tell you is that with the economic slowdown, they will have to take actions against us to be able to pay their own employees and their own regular bills to their own creditors. And now, so we're talking about ripple effects. $3.8 million plus debt. The problems that STEAM CC is having is already having a measurable effect on the businesses in your community, which are the tax generators. And we're having measurable effects on the hospital systems, et cetera. When we're not open, I can tell you that the hospital feels it. So our slowdown in patient care right now is mounting that hospital's problem. You were talking about the dialysis, et cetera. We don't do that there. What we're seeing are the people who we're trying to stop from going on that type of system, or maybe have already gotten there with putting that intermittent treatment. And that's about 10% of our patients are diabetic, 20 of them are hypertensive. And you know, those are the precursor illnesses before you get to that kidney failure and dialysis situation. So if we're looking at 10 and 20% on those ends right now at our end, which is supposed to be the initial catchment and preventative care stage, all of the rest of your medical system is going to fall like dominoes. And so right now, I did wander off of my prepared presentation to say what I had figured out last night. But right now, I would like, thank you for indulging the time, Senator. I would like to concentrate on today's hard reality and let our CFO, Stephen Mayers, give you those real numbers behind my statement. Thank you for the time, Mr. Chair.
Thank you very much, Mr. Carl Carwood, STEM CC, St. Thomas East End Medical Center Corporation. So you're going to hear us using that term STEM CC a lot today.
We actually pronounce it STEAM CC.
STEAM CC.
That's how we pronounce our acronym.
And
STEAM
that means
CC. Yes.
St. Thomas East End Medical Corporation. And just for technical, the name is Carl with a K.
Yeah, Carl with a K.
Okay, Carl Carwood. Thank you very much, Mr. Chairman. Mr. Mayers, you can proceed with your testimony.
Thank you, Chair. Thank you, Chair, the Honorable Senator Ray Fonseca, members of the 35th Legislature, especially this Committee on Health, Hospitals, and Human Services. Other members who are also here, the viewing public, my colleagues, thank you and warm regards. My name is Stephen Mayers, and I'm the Chief Financial Officer of the St. Thomas East End Medical Center Corporation, our STEAM CC. My goal today is to share with you the current financial state and future projections of STEAM CC's operations. In that regard, I must begin my testimony by expressing the gratitude of STEAM CC to the legislature, as well as the administrative arm of the government of the Virgin Islands, that have provided financial and technical support to the center through its 30 years of existence. Without you, our mission would not be possible, and we thank you for inviting us here today to testify. A good place to start is to look at our summarized financial statements since 2019, and we chose 2019 because it was just before the pandemic, and a lot of changes have taken place since. Our patient revenues for 2019 was $6.6 million. Our grants and other revenues, our related revenues, was $5.9 million, for total revenues of $12.6 million in 2019. This compares to our financial year FY 2023, which ended in February of 2023, where our patient revenues dropped from that 6.6 to 4.7 million. Our grants and other revenues, related revenues, dropped slightly, about 10%, from $5.9 million to $5.4 million. So overall, our total revenues moved from 12.6 million in 2019 to $10.2 million in 2023. Excuse me. We have very summarized results here, so it will make it easy for us to follow. Our payroll in FY 2019 was $5.2 million. That payroll increased to $8.1 million in FY 2023. I'm just calling out the numbers here. I'm going to read a little bit. And one of the things that we did was that, unfortunately, we are not sharing that right now on the screen, but we shared with this committee this presentation, and it includes several graphical illustrations of our financial results. The results that I give you here are audited for the most part. FY 2019 is audited all the way through to FY 2022. Or FY 2023 is the only result that is unaudited at this time. To say it bluntly, or to put it bluntly, the St. Thomas East End Medical Clinic Corporation is in a state of financial crisis. During the COVID-19 pandemic, STEAM CC suffered catastrophic declines in patient revenues. Those patient revenues declined each year from the 6.6 I mentioned previously to only $3.7 million in FY 2022. There was a slight improvement in FY 2023 as the virus emergency progressed from pandemic stage to the current endemic state. Grant income, including our Government of the Virgin Islands subvention, has averaged $5.3 million during that period, reflecting the consistency of our relationship with the GVI and our federal partners and benefactors. While patient revenues have continued to decline, our payroll continued to grow, ballooning 56% over pre-COVID FY 2019. Our substantial payroll expenses cover our net payroll plus local payroll taxes or FICA, as well as our FICA or Medicare and Social Security, or United Healthcare Insurance, and matching retirement plan, called the 403B. Other voluntary deductions include AFLAC, Aeromed, normal salary deduction areas in the Virgin Islands, Global Medivac, MASA, and United Way. Conversely, our non-payroll expenses have been relatively constant at around $4 million average for that 5-year period, and consists mainly of our provider, our contracted providers' costs, our occupation expenses, especially our rent and utilities, our medical supplies, office supplies, and other operating expenses. It is evident that our expenses outstripped revenues by over $4.5 million during the previous two STEAM CC fiscal years of FY 2022 and FY 2023. During the first month of STEAM CC's FY 2024, the board elected Mr. Carl Calwood as chair to start the new financial year. We are confident that he will bring to the table a new proactive disposition towards navigating STEAM CC's issues and facilitating greater cost consciousness. The board of directors has swiftly moved to stem the tide regarding runaway expenses by reducing our burden of top management and corresponding senior management payroll. So the board has taken that initial step, as Mr. Kalud enunciated earlier. Last year, STEAM CC represented to this body the center's staff leadership team consisting of 9 directors and executives. Today, that list consists of Dr. Tess Richards, and I must mention here, I must apologize that she's not able to join us today, who serves as both the interim executive director and medical director, and myself as CFO. Only one member of that previous executive team is currently on staff. Neither Dr. Richards nor myself were on that team on last year's team. The focus of the board chair and the board of directors is on rationing our limited resources to maintain the high standard of care provided to our patients by increasing both the quality and quantity of our services. At this stage, we are concentrating on balancing our books. This is to ensure the longer-term viability of the operations. We have funded most of our losses by not meeting our payment obligations, as described earlier by the chair. Because of the magnitude of our payroll, we have been using most of our cash to meet that particular expense. As a result, our vendors and suppliers have suffered from us paying them late or not at all. In reality, the $4.5 million of excess of our expenses over our revenues have been financed by exhaustion of all reserves pre-2020, FY 2020, sorry, then growing our accounts payable to its current $3.2 million from $1 million pre-COVID. I have a table here that talks about our assets and liabilities, essentially as a summary of our balance sheet. And I just want to stress here that our total liabilities was $1.6 million in 2019. It was $2.9 million at the end of FY 2023. In this early part of 2024, it's well past $3.3 million. I am well aware, before I say that, in the past 15 months or thereabouts, our financial challenges have been exacerbated by the reality that collection of patient revenues lags so much that our total cash collections have only been sufficient to cover net payroll. That is the essence of our reality. We continue to reach out to our vendors and apprise them of our circumstances. They, of course, remain nervous as we work through this difficult time. So far, we have been fortunate that a number of them have been patient, but some of them have reached the edge, and they've, as the chair was saying earlier, they've reached a stage where they have become tired and they've cut us off in several areas. The CMC Board of Directors has approved this corrective action plan. The team chosen to lead that plan, as we said earlier, was a former executive director, 2 directors removed, who is our consultant in this matter, and a couple of board members, the chair, the head of the finance committee, the chair, the executive team of myself, and the interim executive director. Our focus at this time is on results, and one of the things that we are in the position we have put ourselves in the position where we want to discuss with you what we're doing, how we're looking at all of this, how often we look at it, and what we are going to do moving forward. On that note, I want to thank you for inviting us here, and we look forward to some discussion with you at this time.
Thank you very much, Mr. Stephen Majors, Chief Financial Officer at STEM CC. At this time, we'll continue with the testimony. Mr. Sabino.
Yes, my name is Joe Sabino, Regional Marketing Manager for SkyMed International. We were invited here in 1998 by the Seafarers Union, and we've been serving here for 24 years. It's been our joy to have shared many of our life-saving testimonials over the years. SkyMed is different than the other air ambulances because we have a discount air travel program that gives our members up to 30 to 70% off on condos, hotels, cruises. And also, we also have a situation where when people are evacuated off the island, they are not with their families. So we provide a space on the air ambulance for one of their loved ones, a husband, a wife, or a relative. If there's no room on the air ambulance, we provide a commercial flight to that destination. And also we provide discount hotel fares for a hotel. We find a hotel that's close to the hospital so they don't have to spend that money on taxis to get to see their loved one in the hospital. Right now, in the situation with air ambulance, the air ambulance right now is costing more than ever before because of the fuel situation. So right now, a Learjet, which can fly from here to Florida in an hour and a half, is costing them about $1,800 an hour. And that's not even the personnel on the plane. So it could run anywhere from $40,000 to $55,000 for a flight. And that cost may go up because of the situation with the oil that's coming up in the next few months that's going to hit this island. So it's very expensive right now. And we are finding that people that don't have these air ambulance coverages, they have to come up with 2 to 3 credit cards to try to pay for these flights. Because of the lack of a support system in the hospital, like a trauma center, before a patient leaves the emergency room, they have to be stabilized before they get on that plane. If they cannot be stabilized and they don't have the money to fly off, or they can't get off, the possibility for them dying is very high. If you have a membership, then it's good you'll have the ability to fly off. But we are finding right now, and I've seen it in the community, that a lot of people either don't understand air ambulance or they don't want the coverage. But when their loved ones or the child gets in a situation and they don't have that coverage, I get a call. And I try my best to help them. But it's very, very tiring because they are very emotional. We don't have the money. Can the government help us? It's not easy. I've helped, try my best. In the past, I have talked to credit card companies to up their credit, and I've got things done like that. But basically, because of no trauma center and no burn center here in the Virgin Islands, people have to be flown off. And right now, for the over 28 years I've been in this business, the air ambulance service at the airport is flying off. I've seen 5 of them in 1 month, and it's increasing. It's increasing. And a lot of times, a lot of their loved ones don't know where they're supposed to go. SkyMed has a program that we can fly them anywhere in the United States they need to go, anywhere. And if they have a loved one in South Carolina and that hospital can take them, we fly them there if they want to go there. If the situation where there's no beds in Puerto Rico, we fly them to Florida. If there's no beds in Florida, we fly them maybe to Texas or higher up with no cost to the member. We pay that. The difference in SkyMed than the others, we don't charge by regions. Regions means that the East Coast, the Midwest, or the Southwest, we don't charge by regions. We give one flat price and we pay the price. Because we have members in Mexico, members in Canada, members in the United States. The other air ambulances companies don't have the financial means that we have to get the patients to where they want to go and have to go in case there is a situation. And right now, because of hurricane season and things happening in the United States with weather, maybe they can't go to Florida. I had a situation where a patient wanted to go to Georgia. There was no beds. Amazingly, there was no beds. So we had to fly them back. We had to get them back to Florida. And we didn't pay that cost. So, this is what's going on right now because of the health situation here in the Virgin Islands. And it's getting very serious. So, all I have to say is that I personally been in this business for over 28 years. And right now, I'm looking at a serious crisis when it comes to air ambulance and people who don't have it. Where are they going to get this money? By the next 3 months, it could be $60,000 for a flight. $60,000. Who's going to pay that? That patient is going to die. It's going to die. There's no way they're going to live. If they don't have an air ambulance service that would step up to the plate and say, well, okay, save $60,000. We'll pay the extra $10,000 to fly you to Texas because we can't take you to Florida because there's a hurricane in Florida. So we'll pay the extra money to fly you to Texas. Can the other ambulance do that? We did it before. Also, if there's a situation where a member needs a procedure that cannot be done here, but they don't need an ambulance, We could fly them to where they need a procedure on a commercial plane and pay them. They don't have to stay overnight in a hospital if they don't have to. If they need to come back the same day or the next day, we'll pay for the commercial flight to bring them back. But people don't understand the cost of what is happening right now when it comes to trying to get off this island. So they have a choice to make. And with the fuel system happening now, with what happening in Saudi Arabia, with decreasing the oil coming out, the prices in the next 3 to 4 months here in the Virgin Islands, especially for aircraft fuel, is going to go higher. So I try to tell people, I know you have bills, you have this to pay, but the most important thing is the life of your children or the life of your husband and even your own life. So it's getting very, very serious right now. Thank you.
Thank you very much, Mr. Sabino, for that testimony. Well, sir, $60,000 for a flight one way. See money day. That's incredible. You know, this is a serious issue. How much credit card you gonna pull out to get $60,000, Papa? This is a crisis. In addition to what we've seen from East End, that's a crisis, and the Honorable President of the 35th Legislature has declared we got a dialysis crisis. We got some crisis that we have to resolve. You know, I'm very confident, though, that the members of the 35th Legislature are committed to resolving these issues. $60,000 a flight one way. So I'd like to, I want to recognize Senator Potter because he has a medical appointment that he's already put off for 4 hours. And he has to get there. So, Senator Potter, you're recognized for your 7 minutes.
Thank you very much for your kind consideration, Mr. Chair. I have a number of questions. I know I probably won't get to half of them, but I want to just start by welcoming the members from STEAM CC as well as SkyMed. Thank you for spending a few hours here at the legislature with us. I'm a little disappointed that the interim executive director is not here. I understand that things happen. But as critical a meeting as this is, I would have liked for her to have been here. On that note, Mr. Chair, where are you with regards to filling that vacant executive director position, that key leadership position at the organization? Is there a search that is officially underway?
Yes, the process did get started. It was started under the previous chairperson, okay, and the process was also started before we had a full 100% picture of exactly how damaged things were within the center. We had a prior acting executive director, and it wasn't working out, and that's when we went to Dr. Richards, who became acting executive director. And at the expiration of the executive director's contract, because we had placed him on administrative leave, she became interim executive director while certain other things had to happen. So we did have out an announcement for an executive director search. Okay, and that was placed in the hands during the previous administration of the chairperson of the Human Resources Committee, who is the same chairperson now under my administration, and he is still tasked with that job.
So is there active search process right now? Or has that been put
We
on
had
hold?
started the process coming in. Okay, but when we're looking at the center and Dr. Richards at the moment as interim, and going up and looking at HRSA guides, HRSA process procedures, et cetera, there is actually a very strong recommendation that we have an interim in between executive directors if you have what you call either a distress center or a center where a prior executive director left under less than ideal circumstances.
Okay.
So we fall under both of those two transition categories. They have 7 transition categories.
Okay. Is
So at
she,
the-
not to cut you off, I know my time is
Yes.
running, is she functioning in both roles right now as the medical director? I think that is her official title. So is she capable of functioning in both very critical roles for the
And
organization
actually,
right now?
in actuality, yes, she is. And right now, that actually seems to be more beneficial
So there's
than
no
if we had
conflict
just had
there,
a
in your view?
straight business administrative person in there. Her ability to bridge both worlds right now seems to be what is seaming this thing together, so that we can revise and amend certain policies and procedures, so that because administration evolves over time, the medical side, there's supposed to be a hard line separation evolves, and somewhere along the line, a lot of the procedures and policies that we're supposed to have written weren't quite adequate.
Okay.
And in pulling those together, yes, that's where HRSA recommends this interim period.
I'll move on.
Okay, thank you.
You said you had 23 persons who were laid off from the organization.
That would be the total. The
Total.
nine before, and those were as a result of positions dissolving. This time we actually had to take a more straightforward layoff approach, and that was 14 people were given notice yesterday.
Okay.
That's notice. So that, I mean, and with layoffs, I mean, things are reversible if we see
Yeah.
a brighter picture. But right now, we had to go to that hard choice.
Okay.
After looking at
3
everything
minutes.
else. Yeah.
I know that in the central government some time back we had challenges, fiscal challenges, and there was an approach to scaling back salaries. I think that was done on a temporary basis until recently. I guess the salaries of employees who was scaled back was restored. Was any thought given to that approach by the board? Rather than termination of 23 persons, was any thought given to perhaps scaling back salaries, maybe temporarily, until the institution has an opportunity to really catch itself?
Okay. A number of those things were considered, and the CFO can give you some of the numbers that show that it wasn't going to save nearly enough for us to keep open our doors during those periods and now during this next period. And also, the way our employees get paid from different types of funding sources. Okay, a straight out reduction across the line, which the VI government already learned, is not legal. So we would have ended up having different employees, some of them staying at their full salary scale, others being reduced because we're doing that. And the whole balance would have been very chaotic and unpredictable.
I appreciate you sending us a copy of the employee handbook, and I know in the handbook I noted that there was a provision for severance pay. Have your employees who are laid off, have they been granted their severance pay? I know there's a severance pay as well as the accumulated annual leave payout. Have they been, paid that? Seeing that now they are on the street. Some have.
Some have. What we had to do was, as we saw certain monies come in, and we could make
1 minute.
the payroll a couple weeks ago. We looked at some of what was the balance left and said, okay, we need to take care of those other departed employees. And so there was an initial payout some made that we would say, okay, across the board, there'd be this maximum amount that a person could receive in the first round. And that basically cleared out most of the employees who were owed things.
So those employees who were not...
On the previous round, there are only 2 employees on that, actually only 1 employee on that previous round who
have
would
not
still
been-
need to be taken care of in that way.
Okay.
That was on the layoff. We had a resignation that has to be taken care of fully.
Okay.
And then, of course, the outgoing executive director has to be taken care
So you're
of.
giving priority to doing that, to making these individuals who separate from the organization whole, so to speak? Because I know it affects your ability to recruit talent. In the future, when you're planning on bringing talent here, if you treat the employees in accordance with your established rules and guidelines, and people are witnessing that, I think people are more inclined to want to be a part of the organization. So that is something that I really want you to give some some priority to.
If the chair would let me expound just a moment.
Yes, Chairman Calwood, you may.
Because it is critical to us, okay? Because, yeah, we do have some employees wanting to line up and say, hey, we want to take you to court, we want to sue. But that isn't the reason why it is critical to us. We were trying to get this done from before. If I only have 5 cents and I owe you 15, nothing in the world I can do.
Okay.
Going to get you that other 10. So what we're trying to do, we're asking them to be patient. We're trying to treat them as fairly as possible and learning the lessons now so that once we can get this fixed, it's my intention to set up a truly working procedure so that it never happens again.
Okay. The compensation, Mr. Chair, just one
Yes.
final question.
Yes, you may.
The compensation for the interim executive director, what is that and how does that look? Performing, you said, the medical director role, performing also the role of executive director. Is there a formula that you are utilizing to compensate, the person who is performing
the person
that
who is
awesome
performing that function right now actually said, you're in the center in trouble. We need to get it done. I'm not going to ask for any additional compensation.
Okay.
For the work. So no,
That's commendable.
She has not asked for anything, and she has specifically said. And as a matter of fact, she has already taken thousands out of her own pocket to buy and repair equipment at the center. And I'm telling you now, there are many employees who have been buying supplies, and that's like, I mean, to force employees to have to do that, the words are just. Okay.
That is commendable. Mr. Chair, I thank you very much for your leeway. I am really sorry that I can't stay to ask additional questions, but
Thank you
that
very
was a
much.
great- my dentist can kill me, so let me
yes.
go. Thank you.
Thank you very much, Senator Pata, and we hope your visit goes well. Mr. Calwood,
Yes,
a
sir.
couple questions. Dr. Tess Richards is your interim, your acting executive director?
She's interim executive director.
Where is she today? How come she's not here?
Okay, right now she's traveling on.
She's on vacation, right?
She's on leave, and one of the reasons why I went ahead and authorized that is because we have to pay for unused
wait,
leave.
no, I don't need that all.
Okay.
She's on leave. What
Yes,
kind
she's
of
on leave. Okay,
She's
yeah,
on-
I'll leave the rest
she's
of
on leave.
the reasoning behind why.
Okay,
Because
so
there were more
your,
than
your
one.
interim executive director is out on leave. Mr. Coward, how long have you been a member of the board of STEM CC? I noticed you've just recently been appointed as the board chair. How long has you been a member?
Yeah, this is the first year I'm serving as officer, but I was on it previously for 7 years. Actually, the year after this term, I will be term limited out.
Okay, so you've been on the board for 7 years. Okay, does STEM CC...
About 8 years, right? 7 years prior to
Okay,
this one.
7, 8 years, no problem. So does STEM CC have an IT director? Who is responsible to manage the patient records right now? Do you have an IT director?
We have an IT individual. The IT director that was previously on was a part-time individual, and when we were looking at what was happening and everything else, regarding the amount of hours that that individual was able to put in, and also what the second person behind there in IT was doing, that person had also expressed that they didn't really want to be there in the first place. But I don't know if we need to go into a lot of the personnel stuff. But when it came down to it, it looked like things would be easier and more efficient if that person were on contract and on call. And then the other individual would be handling the day-to-day. Now, even previously, STEAM CC is nowhere near where it should be electronically and with its technology system. So that's one of the things that the interim is looking at. Because if we don't grow IT, and if we really need comfortably about 3 or 4 qualified people in there, STEAM CC's growth will grind to a halt because electronic record system keeping is what the future is going to be. And if we can't keep our systems going, if we can't have a consistent flow, we'd have a problem. And that was also one of the problems with IT before. IT is scatterpated. Under the prior director, things were allowed to happen where different pieces of machinery were purchased by individuals, so that now you have a system that is not 100%
I think you've
compatible.
answered. Sorry for the interruption, sir. My question was, does STEM CC have an IT director?
At the moment, no.
Okay, thank you very much for that answer. Okay, so what is the monthly rent? I'm trying to get to your expenses. What is the monthly rent STEM CC is paying now? You're located at the mall, right?
Yes, we are.
What's the total monthly rent?
I'll have Mr. Myers, if please.
Yes, you may, Mr. Myers.
Sorry, the rent is approximate. My name is Stephen Myers, CFO. The rent is approximately $70,000 a month.
Approximately $70,000 a month rent. Well, okay, so do you have a medical director on staff right now? Mr. Coward, Chairman?
Right now, we do have a medical director, and right now in the building on the floor, we have an acting medical director.
Okay, so I'm told that you had recently one of your CFO retired, and they came back, and you at one time had 2 CFOs. Is that correct?
We never had 2 CFOs at one time.
Okay, so you never had, your testimony is you never had your previous CFO didn't retire, and another staff was hired, and that person was training the other. That's your testimony?
No, you had asked if we had 2 CFOs at one time.
Okay,
No, the previous CFO was contracted back on, and the board had no knowledge of it. We heard rumors for years, had asked about it, and then finally dug up stuff after they dug up some contracts after the former executive director was put on administrative leave. Okay. And realized that, yes, this person was indeed in there. But if you look back at the board record, we have been hearing rumors. And on the board minutes, you see board members were asking questions multiple times. And the answers were never forthcoming as to whether or not this person was on staff.
Okay. So in your position now as the board chair, have you come to find out in the recent past that there were 2 persons being paid the CFO salary, meaning the former CFO that retired and a new CFO hire? Yes or no?
I don't know whether or not they were being paid the same salary, Mr. Mayor. Okay, Mr. Mayor is saying yes.
Okay, so your testimony is yes, we had 2 persons being paid a CFO salary, your former CFO that retired and a new hire. Is that your testimony, yes?
That is correct, Senator.
How long did that occur? How long a period of time did you have 2 CFOs?
Senator, as far as I haven't dug up all of the records, but at least for the last couple of years.
Oh, for a couple of years. Okay, Senator Gittins, I'm sorry. Senator Marvin Blyden, you're recognized for your 7 minutes.
Thank you so much, Mr. Chair, and good afternoon again to the viewing and listening audience, and good afternoon, Board Chair Calwood.
Good afternoon.
And Mr. Mayers and all other individuals there, and thank you for the testimony. Before I begin, I want to say it's very unfortunate what's going on in our territory. It's very unfortunate. Mr. Mayor, I want to thank you for the chart you provided to us. I mean, it sends a clear picture of exactly what has been happening at the center. I really don't even know where to begin, to be honest with you. It really hurts when you see some things happening in your community that should not be happening. And I did also receive that information also in terms of having 2 CFO at the center. I also got that information. See, many times when we ask questions, we already don't know the answer. So it's always good to be honest because we already have the answer. It's a small community. We have relatives, friends, significant others, what have you. It's a very small community. And I know we have a 13-member volunteer board that runs STEAM CC. And the meetings, how often does the board meet?
The board is required to meet monthly, and we have consistently met that, even during COVID. There was, I think, one time where we had to move a meeting for a certain reason, and we were able to hold it. But yes, monthly.
Okay, so in 2019 we had reserve, $1 million in reserve. And right now we're about $3 million in debt. When did a red flag go up in terms of things not going the way it should? When did anyone see that something was wrong?
We have, how do I put this? I got it in writing. Exit interviews, other employees coming to us now who are telling us that there were actual lies told to the board, that they were being asked to change numbers, that they were threatened and intimidated with statements like, I got a lot of friends and family around here, et cetera, et cetera, et cetera. Now, one of the things is that knowing when certain things started, because there were a lot of things that weren't kept as records, and we know for a fact, and if you look at the board transcripts and everything else, that we started getting rumors and whatnot, we start asking questions, start seeing things are disruptive. So it was about a year and a half ago. Okay, people were starting to get sick in the board and everything else, and I ended up, okay, and I'm telling you, it was too much for me at the time, but there was nobody else to come in. I ended up chairing 3 different committees, chairing a committee and chairing a board meeting, all at the same time, as people went down, board members went down like dominoes because their family got sick or they got sick, et cetera. And it was because of that. I think if that hadn't happened, I may never have gotten to see what was underneath some of the papers. And that's where about a year and a half ago to 2 years, I started saying, wait a minute, the pattern I am seeing here, which was different than the pattern I was seeing in finance committee meetings, told me that we would be coming to a bankruptcy state by about between July to September of last year, okay? And I actually got laughed at, I'm sorry, by people, because basically here's the CFO's projection, here's it backed up by the executive director, what are you talking about? Because I'm not a financial person, but I can see patterns. So when you don't give a name exactly, you get a lecture at the true definition of a name rather than an answer. So this went on, and I'm telling you that, in my opinion, board members felt intimidated as well. Okay, so when finally certain things are happening and you're yelling and screaming, and they're getting the confidence, we started getting more of a closer look into the books until by the time there was the budget hearing last year. We started realizing, when he started, there were comments being made about, oh yeah, we can take the 800,000 or leave it, et cetera. And right after that, board members left out of here angry. And from there, that's where I think a lot of the initiation and momentum to start saying that, hey, the rest of them started coming aboard. But there was some earlier as well, but we didn't have a majority because people were uncertain. This is medical. We're civilians, required to be civilians, unpaid civilians, and we have this awesome, terrible responsibility. And we paid a lot of people a lot of money to be experts, to bring this knowledge back to us as the federal government requires, and use the common sense judgment of a regular person and customer in the community to create policies that they're supposed to be guided under. So, yeah, I'm using up a lot of time, Chair. I don't know if you indulge him.
That's fine. I'm letting you talk because it is critical and important for folks to understand what's going on here. Because of that now, and because of, I want to applaud you for what you did. You know, and others members who stood up because of that now you started to see the trickle-down effect, you know, of the medical inventory, not having any phone, cleaning supplies, scanner, you know, and on and on, and on and on. So it is going to affect the operations one way or another, and it all came to bear. Now, let me ask you in respect to situations like the 2 CFO, who deals with those type of situations moving forward, though? Because I don't understand that.
Well, that's where right now I've asked the interim executive director to pull out and find every single policy,
1 minute.
every single procedure in STEAM-CC, and I'm doing that with the board too. What we're finding is that all over the place, things that should have been in place, that we're told were in place, are not in place or not findable. So in essence, I've commanded our board development committee to do a full review as well of all of these documents and procedures. Okay, because I'm going to come up with a plan so that none of this ever happens again, because I like to see things go in a certain flow, and then everybody can see along the way what's missing and make those corrections right away.
Okay, Mr. Mayers, how long have you been in this position, CFO? And I thank you for the chart. I really appreciate that. It makes it much easier for us. But how long have you been in that position?
Senator, I've been on this in this job almost 2 months.
2 months.
Yes, sir.
Wow. Well, you did a very good job in a short time span. Because numbers don't lie. And everything is right there in front of your face. Wow, well,
time.
With that being said, Mr. Chair, we have problems. We have major problems, and we need to really get to the bottom of this. Someone must be held accountable, because this is unacceptable for our people. You know, this is not right. One way, shape, or other, there's no excuses. And one more question before I go, Mr. Chair, because I know my other colleagues on the other end are waiting. The funds for the land, the Hartman land that we're getting a new, so-called a new STEAM CC. What's going on with that in that space? I know we've been paying for grass for the longest. How much are we paying a month?
Right now, it's supposed to be $16,000 a month, plus adjusted to the consumer price index regularly. Yeah, and that was one thing that a lot of board members were asking about, et cetera. And there's a portion of it that we have some real questions as to how it even occurred. And like I said, now this is a major deal. You have a landowner there who actually dealt very fairly, to me, had dealt fairly with us and has been patient. But this matter really, really, really needs an investigation. We are not qualified to judge every single thing that happened in there. I know certain things in my background with a father as a contractor are totally missing that should have been done in the first place before anything started.
How long have we been paying for this land? What's the time frame?
I think it looks like, from what I saw, somewhere in the region of 4 to 5 years. But initially, it was only $4,000.
I think it came about just after the hurricane. We are looking for documents. A lot of paperwork is not where it should have been.
Do we have a cumulative number of the total amount we have paid thus far?
Most of it we haven't paid, actually, in terms of cash, but we're accruing it every month. We're about 170 or so thousand right now.
Thank you so much for your responses, Mr. Chair. I want to thank you for having this most important meeting, and thank you for the time.
Yes, and thank you, Senator Blyden. I do agree with you. Real quick before we go to Senator Gittins, Mr. Mayers, following up on what the senator from NADA was mentioning about that lease, I have information where in 2017 you entered into a lease for $4,000 to build that building, and now in 2023 that rent has gone from $4,000 to $16,000, and the grass ain't even cut. Is that your understanding? Is that a correct statement?
Yes, Senator, it is.
So you see there, they rented it, they leased the land for $4,000 in 2017. The grass ain't even cut, and now they're paying $16,000. You see, colleagues, this legislature, I've noticed we have some issues with boards. There's the WAPA board, you know, the taxi cab, and now we have the STEM CC board. Mr. Calwood has testified here that he has been here since 2017, 7 to 8 years, and this lease was entered in 5 years ago. And he is now telling me he didn't know that the lease was entered into 5 years ago. How long does it take for the board to know about a lease? It's 5 years old. You see, the board has 3 primary roles, and that's to establish policy, to make strategic decisions, and to oversee the organization's ability. And you know, financial oversight is a job that is very important. Boards must remember that the organization is theirs to oversee. They don't manage the day-to-day operation. The board only hires the executive director. But you also are involved in setting the policy and decision making. That involves making choices about the organization's mission, visions, and strategies. Let me ask you another question here, because like Senator Blyden says, I have the information. I just want to make sure that you're giving me a truthful answer. So let me ask another question here. Well, no, I don't want to take up too much time. I want to allow Senator President Francis. Senator Francis, you're recognized for your 7 minutes.
Thank you very much, Mr. Chair, and good evening to everyone. Mr. Chair of the board, Mr. Colwood.
Yes, sir.
When was the last audit of the STEAM?
We just finished.
What was the last?
Hello? I'm sorry. We just finished an audit a couple months ago. That would have been the fiscal year 2022 audit. And I will tell you that our audits have been behind by several years. This one, we just got caught up. Mr. Mayers, we caught up with, what, 3 audits in the last 2 years, I think?
I'm not sure, but I basically we can see that we're caught up with 4 audits at this point.
Yeah, so that right now, 2022 is our latest, just done a couple months ago. We had the meeting with the auditor, and there are things in there that I have problems with and things that I want clarified. So we got more meetings to come on that. But last year, 2023, that's going to be the biggie, and we're waiting for that to be done. And I think deadlines
based on
are
the
September.
audit, what was the findings?
Excuse, I heard an echo. Sorry.
Based on the audit of 2022, fiscal year 2022, what was the findings of the audit?
Can I ask the CFO to give you that, since that's a little bit more technical?
Good afternoon again, Senator. My name is Stephen Mayers, CFO. There were not that many findings per se. I remember I don't have all of them in front of me right now, but there were findings related to some technical issues. Accrual of accounting wasn't being done on time. The reconciliation of our accounts, or in particular our balance sheet accounts, were not being done timely. They were all being done at the end of the year. These, I think, were the main ones. They didn't have any of the kind of, I want to be careful about the word I use, the kind of findings that you'd expect for an organization of this, with this level of difficulty. However, the auditors did recognize that there was a going concern issue for the organization, which meant that one of the findings was that the organization didn't appear to be able to sustain itself for the next 12 months. That resulted in a qualification of the accounts. So I need to mention that as probably the most important finding.
So how do we reconcile or account for the fact that in 2019, you had $1 million in overage in excess, and now today you find yourself in $3 million of a deficit? Where did you go wrong? Where did the cooperation went wrong?
Senator, I'm just going to mention a couple of things. One of them I already mentioned. If you look at the numbers, our payroll rose from $5 million to $8 million over that period, the COVID period. I'm not sure what the thinking was at the time. There was a lot of grant funding. I am not sure if that got us a little ahead of ourselves. But essentially, there were other issues. I'm sure some of it you probably already heard, related to increases in salaries for certain employees. There were some general increases in salaries as well. So basically, salaries was essentially our main downfall. We also expanded our operations significantly. So that's why we have that $70,000.
Salaries been rolled back? Have those salaries been rolled back?
This is Carl Colwood. Not sure they have not. That again came up as a circumstance where afterwards we found out the board was given
just
3 minutes
warranted in terms of increase. Why, as in terms of saving the corporation or the center, haven't those salaries been rolled back?
If I can ask Mr. Mayers, because he was, when we were going over the numbers, he was one of them who looked at the numbers and said that there would have been complication, wouldn't have made enough of a difference. Can you, Mr. Mayers, if you please?
Senator, that's a good question. We looked at. I just want you to follow the quantum of what we're talking about. That discussion specifically related to rolling back salaries. That was not, in my recollection, something that we looked at in depth. However,
it may have been with the interim director.
One second, please, one at a time. I am trying to follow as much as possible. There is an attempt or a discussion here today where there's a crisis situation. However, there's an audit that don't support that. There have been, if I'm hearing that there was some high salaries that was increased that resulted in an increase from 5 million to 8 million, but no action have been taken then to roll those back. What is your current staffing levels?
At this particular juncture, we had, I think, 93, with 7 of those were part-time. We've subsequently released 14 out of that, so that brings us to about 70, 79, or thereabouts.
Very well. And what was the amount of money that the government provided you with to run for the first 2 quarters of the fiscal year?
The government provides us with about, just to make sure, just to be clear, in terms of regular subvention, it's $175,000 per month. In addition to that, Mr. Calwood mentioned, we've been approved for a grant of, actually it was supposed to be $2.28 million, but the approval was for $2 million. We haven't received any of those funds, but we expect to receive it on a quarterly basis of about $500,000, starting hopefully next week, hopefully.
So currently, how are you making payroll?
Senator, we pay the basic net payroll. We have not been able to meet the peripheral costs related to payroll, meaning federal taxes, local taxes, et cetera, not GRS, sorry, or 401k. We have not been able to meet those expenses.
And Senator, if I may, that's one of those things that somehow what was being reported to the board at meetings was not what was actually occurring. It's when we did these rounds of layoffs that we found out that no unemployment compensation, the employee benefits, had been paid since 2017. Now, in this time, the auditor came to us once and said, oh, we found a payroll where the benefits weren't paid. You guys got to get on that and make certain they're always paid and everything else. And the board did go back to them and say, hey, what's happening here, and make the corrections. And then we were assured that corrections were made. Okay? And then multiple meetings after that, we asked, okay, for this information, for that information. We have the Human Resources Chair here who wanted to pull documents of employees and everything else. And the brick wall that we got and the lecture about interference in day-to-day, when we finally got sheets of numbers to look at, it was redacted information, where you see like the blackouts that you might see on a classified document. These are the struggles that the board went through to try and get paperwork. So we had a previous chair who had a way of doing business, and my way of doing business is to tear through the China shop and get that. So that's why we have
you
this
may
info
complete.
now.
You may
Chair,
complete.
my time was called. I have 2 further comments, if you'll allow it.
Yes, go ahead.
One, I want to caution, again, the team CMC here today that in light of the fact that they have already requested Inspector General's audit or investigation into this matter, that they refrain from making further accusation pending the outcome of that investigation. Again, we're here, we're making comments in the public domain. There are transcripts being developed here, and and some of the responses is not supporting audits that were done. So I want to just caution them to be careful of that. Two, I wanted to take this opportunity to at least ask Mr. Sabino a quick question regarding the air ambulance services.
Yes, sir. Go ahead.
In regards to your air ambulance, I heard you mentioned the fact that you have you allow for individuals that may have been airlifted for medical reason, whether or not you assist them in being able to return home. We have situations where individuals are currently being airlifted. Once the emergency is completed, they're being told that they have to find their own way to be able to get back to their home district. Is it your testimony that in fact you support and assist individuals via commercial flight to actually return back home?
I was approached by several members of other ambulances that was complaining about that, but I told them in the contract they have, they have to read what it says. The other air ambulance companies, I know for sure MASA has in their contract that once they are in the hospital, once they was evacuated from here to Florida or wherever, and once they are out of the hospital, MASA contract states that they have to be flown back. They will be flown back on a commercial flight. And also in the contract that they have, and we have, that if that patient coming back on a commercial flight, but they need a medical personal assistant, that ambulance contract says that their contract, along with what we have, will pay for a medical personnel to fly back on a commercial flight with them back to the Virgin Islands. Like I said before, we have the financial means to do this. I don't know the financial status of the other air ambulance companies, but people have been coming to me and complaining about it. Every time we have not done a flight in a very long time. So I have never experienced a negative feedback from any one of our members, because I take it personally that when I sign up a member to be a member of air ambulance, that I will rectify any situation. I don't let a member stay there and in a hospital or in a different state and don't get back here, because they have to go along with the contract. And the contract states that air ambulance membership contract says that that company have to pay and will pay for them to come back on a commercial flight with their loved one. If they went up there with their husband or the wife, we will pay for the two of them to come back here. Or if they need a medical assistant personnel to fly back on a commercial flight with them, we do it. And in most cases, most cases we pay the first class flight back. Pay a first class, not coach. So
very well, thank you. Response. I will continue to look at those contracts, because my office has been notified of several situations where individuals are left stranded on their own to make their way back to the territory despite being airlifted, and again having these various air ambulance services contract in place. Thank you very much for your responses from both.
Can I say one more thing? Those complaints are supposed to be recorded at the we call it banking and insurance. Those complaints should be filed at banking and insurance. Banking and insurance should have those complaints. And I guarantee you, those complaints are not from SkyMed, because we don't do that. And I would bet my life on that one. I would bet my life on that. That's all I have to say. Thank you.
Very well. Thank you. Mm-hmm. Thank you for your response. Thank you, Mr. Chair, for the time.
Thank you very much, Mr. President, for those important questions. Senator Gittins, Vice Chair Gittins, you're recognized for your 7 minutes.
Thank you, Mr. Chair, and good evening to all. Obviously, some of our boards and even the air ambulance services, some of them, that is, are totally out of control. Here we are again. And as you just say, well, sir, you know, when I tell you all that this government do not have a money problem, but rather a money management problem, some of you take it as a joke. But we see it time and time and time again. Obviously, Steam CC financials should be concerning to all of us, based on what we're seeing here. And Mr. Calwood, you can't tell me that you've been sitting on this board all these years and now, you know, I'm gonna leave that.
Yes, because I do want an Inspector General's investigation.
I didn't ask a question.
Mr. Coward, please respect the senator's time. Proceed.
$70,000 a month we're paying for rent. This is almost $1 million a year. We're talking about questionable salary increases that we can't address yet. We're talking about not being able to pay federal taxes, local taxes, the 401k. Are you all supposed to be paying GRS as well?
Sir,
yes or no?
I have no knowledge on that. That's been in court from the time I came on, and no information was ever shared with board members. We were always told the matters before attorneys.
Okay. Mr. CFO, what about you? Do you have that information?
Sorry, Senator, could you repeat the question, please, so I make sure I'm clear about what you're asking?
Are you to be paying GRS as well?
At this particular juncture, I am told that we're no longer part of GERS. So the answer to that is no.
I don't understand what you're all telling me, you know. What do you mean at this time? Come on.
Sir.
Come on.
What I'm trying to express to you is that when you look at our transcripts, when you look at some of what is written and everything else, there was confusion all over the place. There is actually really no way for us at this point to tell you specifically what was the truth about what happened. Yes, sir.
So, Mr. Calwood.
Yes, sir.
So when the confusion clean up? When the confusion going to clean up? What is it going to take to clean up some of this confusion that you're talking about?
What I'm doing right now, tearing through all the papers, finding out what was honestly told to us and not honestly told to us, bringing everything before every body and government official that I can find and telling them the doors are open, the file cabinets are open. Anybody within the government who has authority can come in there and look, because what I'm telling you is from the information provided us. I have nothing to hide. The other board members, they feel that way. They are livid. They are angry at what I've been able to dig up in the past year as to what was actually hidden from us.
So obviously, you've been losing patience.
Very much so.
It's understandable.
And it's a majority. It moves by a majority.
2020 and 2021. Hold on. Both of us can't talk at the same time.
Okay.
Yes, Mr. Coward. Please do not interrupt the senator when he is asking a question.
I do have an air problem from diving, so sometimes I didn't realize he's talking. I'm sorry.
Thank you. You may proceed, Mr. Vice Chair.
Yes. Mr. Chair?
Yes.
Before I say the wrong thing, I'm done. Thank you so much for the time. Thank you.
And then, sir, I apologize for the chaos. We feel just as frustrated as you do. to have been there all this time and to find out that something could be going on behind your back. But I guess that's how people feel when somebody says, hey, you've been here 10 years and this person was embellishing for 7 and the police just find out. The auditor actually told us, because we had asked the auditor about that type of thing, and he gave us a fancy explanation about how it's very difficult to tell between fraud and an error because one involves collusion and planning by people who are very experienced within the system. And then you take unpaid volunteers who are just patients of the center and give them this awesome responsibility. I don't know how to express fully the mental state that some of the board members are in. We feel betrayed, we feel used, and the staff is angry at us.
Yeah.
And we would like to figure out what happened, and we would like you to know
Thank
what
you
happened.
very much, Mr. Coward. You're answering questions, and there's no question.
Okay, I'm
before
sorry.
you.
We're frustrated. I'm sorry.
Okay,
This is
so
how we are.
I have a couple questions, and then we're going to go quickly to Senator Javon James Sr. Okay, so let's go back to the lease of 2017. Did the board approve and sign that lease?
The board approved the lease. What I saw was a board signature from the current chairperson at that time, and that was on the one for 4,000.
Okay, and
When we
the
were showing
board
the
approved the
60
lease, but you didn't have any knowledge of it.
No, I believe I was there the day that lease was approved, at that 4,000. Okay, now the addendum that took it to the 16, that was a surprise that we found about a year and a half ago or 2 years. And we have not found a board signature on that or record that we voted for that addendum to be added.
Okay, thank you very much. Senator Javon James Sr., you're recognized for your 7 minutes.
Greetings to the people of the U.S. Virgin Islands. Thank you, testifiers, for being here. Let's just make this clear. I ask the questions and you will answer, okay? All right, so you said that you spoke to Government House, specifically Governor Bryan, about what's going on. What was his response?
At the time, we didn't have all of the information. This was when under former acting director Crawford. And what he instructed was for his team to try and locate a funding source for us. He contacted Mr. Smith with Medicare, Medicaid, and gave him instructions. And then later on, their office sent us the application for the grant that we have now gotten the $2.8 million on.
And can you give us a specific date or time period of when that conversation took place with the governor?
That would have been late February, I believe. It would have been late February.
Okay, stop right there. And based on some of the things that you placed in your testimony regarding the cutting off of this and that and the Inspector General audit and those things, the governor is aware of that, or this is your first time bringing it to light on this Senate floor?
Can you repeat the question, the items?
The things that were discussed and mentioned in your testimony, is this the first time you have went public with this, or have you had conversations with the executive branch as well?
We've had conversation with some of the items on there, and as I said, when we were at the governor's office in February, there were still things that we had not discovered. But over time, as we found things or amended documents, Dr. Richards has been forwarding them to the administration. So a lot of the fine minutiae, the heavy paperwork, I couldn't tell you exactly what was sent, but I do know we've been updating people in the administration as we've been finding out things.
Okay. And then you made mention, while I was listening, that individuals are not sharing documents. There's a lack of transparency. So what teeth the board has to make sure that these individuals will send the necessary information for y'all to make better decisions?
The only teeth we have would be to fire the executive director. That's it.
So you have a problem with the executive director?
And with the contract that was built up, we were looking at the money we would have had to pay out on firing the individual. Because certain things need to happen if you're going to fire somebody. You have to make, you have to do your due diligence as far as jotting down and recording.
And I'm assuming that the board has the sole authority and decision when it comes to the firing of the executive director?
Yeah, and that's the only person that we can hire fire.
Okay, so moving right along, right? It's unfortunate that these things have to be placed on the record, but I understand that you're basically crying for help. And what concerned me the most, though, he said that pap smears, something that is very important to women.
For women's health, yes.
Listen, I ask the questions, you answer. Pap smears, that is not being conducted right now or being implemented. So that's you said that
They are being done.
You said the company that does our pap smears for us is no longer willing to send us the kits. So where are you getting the kits from?
But we have an inventory.
Okay.
When that runs out, we're in trouble, big trouble.
Okay, stand corrected. So as far as the inventory, because you really can't really tell, but usually how long would that inventory last for?
I can't give you that answer. That would be on the medical side. Do we have any inventory that you could? We can't track from that. That would be all medical.
So you don't have any?
They sent a...
3 minutes.
No, I don't have personally, but the medical director at the center right now, Dr. Thomas, would be able to give you that information.
Okay, understood. And it's sad. You say you have no toilet paper, no paper towels. What's really going on in there?
As I said, we'd like to find out.
Those are the basic necessities. This is very embarrassing. I feel very bad as a Virginella not to hear this nonsense.
We couldn't get through.
I ask the questions, you answer. I didn't ask you a question.
Mm-hmm.
Please respect the time. As far as translation service, we have a diverse culture in the U.S. Virgin Islands. We have Spanish, we have Haitians, and the list goes on. And you're telling me that translation service has been cut off? How much does it cost for translation service right now?
Mr. Mayor?
I think the outstanding balance to them is about $17,000 or $18,000.
$17,000?
Yes.
That's it?
If I remember correctly, the monthly amount is about $5,000.
That's it?
Yes.
And that has been cut off?
Yes.
I was hoping to hear like 100,000, close to $1 million or something. That's small money in a diverse community like this. We have to have translation services. Go ahead, speak.
No, just one quick second. Chair, with your permission, can I excuse the young lady? Please, thank you.
Okay.
Sorry, sorry for taking up your time.
So when you made those cuts, you made some cuts, so you fired some individuals. Didn't you take into consideration with those cuts to keep the translation services, especially with that low cost?
Senator, I just want to put a little bit of perspective on this. On a monthly basis, we have to meet expenses.
1 minute.
Besides the payroll, we have to meet about between $330,000 and $350,000 of additional expenses on a monthly basis. I'm talking about the rent, the costs about $60,000 for our medical insurance, that kind of thing. So we have several additional expenses. So everything is competing with everything else for the limited resources that we have. And in the last year or so, we basically have only been able to pay the net payroll. So there hasn't been a lot of wiggle room, so to speak. So reducing the net payroll, just so you can keep track of the numbers, the idea of reducing the net payroll is so that we can get a little more space every month. Hopefully, we would have loved to have gotten from that $300,000 worth of cuts to allow us to be able to pay our regular monthly expenses. But that is simply not practical at this point. So we've reduced some of the payroll, but it's not sufficient for that.
Thank you for that information. I will wrap up, Mr. Chair.
Yes, go ahead.
Please work on it ASAP. In the interim, even if you have to reach out to an ADC company, reach out to some big organization in the Virgin Islands that's making millions of dollars, reach out to them with these translation services until we identify the funding source and give you some level of relief. However, I hope this doesn't turn into a situation where it's like WAPA, where we continue to give, and nothing is being given to the people of the Virgin Islands in return.
If I may say something, Senator?
Proceed.
When Dr. Richards went in and started digging around and pulling things together, we were actually finding out that bills for pass-through services. Many of them were not even going through the business office. They were being pulled either to...
So stop right here.
Yes.
Thank you for placing that on the record. And like the good Senate President said, you have an audit that's going on. You ask for local and federal assistance. Proceed with caution. Thank you, Mr. Chair, for the time. May God continue to bless the Virgin Islands.
Yes, thank you very much, Senator James Sr. You know, when you're elected as a senator, you make an oath. You swear to do the people's work. And you know, in the testimony that I have received today, ladies and gentlemen, my fellow Virgin Islanders, I can't see how East End Center can be closed. We must continue to serve that patient population. In addition, I am very uncomfortable with what is going on and any potential layoffs. So at this time, I have to refer this STEM CC issue for an audit and investigation because I don't like what I'm hearing today. The Committee on Health, Human Services, and Hospital is adjourned.
Thank you for the time, Senator.